Are you watching the participant number? Wow.
Since we don't have the chat, I'll just say it. Make sure everyone's muted when we get started.
Okay, I'm looking to see if all board members are present. I don't think we're missing anyone, are we? Okay. Okay, I would like to call to order the August 17th, 2020 regular board meeting of the State College Area School District Board of Directors. Please join us for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, I'd like to welcome everyone who's here this evening, as well as those of us who are viewing remotely from home. Board members, with an agenda before you, are there any changes to the agenda?
Amber, I have one. I would like to make a motion to add an action item that would become action item A to begin the 2020-21 school year remote with the addition of care centers for students with IEPs, social emotional needs, CTC students, and students who would be home alone otherwise.
Okay, so is there a second to that motion?
I second that. Liddell.
Okay, so it's been moved and seconded to add the motion to the agenda as item A. Is there any discussion around that motion?
Can we please clarify that motion?
Gretchen, would you like to reread it?
Sure. The motion would be to add an action item that would become action item A to begin the 2020-21 school year remote with the addition of care centers for students with IEPs, social emotional needs, CTC students, and students who would be home alone otherwise during the school day.
Scott, did you have a question? Yeah.
So the motion is that we will forego everything that's in the safety plan and go remote. Just want to make sure I know what I'm voting for.
Yeah.
Motion is to add that motion as an action item to the agenda. So the motion on the table is whether or not to make that an action item.
Okay, thanks for the clarification.
Right. So, oh, I'm sorry. My hand is not raised.
Laurel, I saw your hand raised.
Yeah, two things. One, just following up on what Scott asked and making sure I'm clear about this, because the way Scott worded is we would not do any of the health and safety plan, but that would still be in, you had mentioned care centers. So the health and safety plan would still be under your motion in effect for that part of schooling. Is that not true?
That is correct.
And then I'm just wondering why you asked that be A as opposed to later after we've had more discussion.
Because amongst, this was my thinking, that amongst the action items on the agenda for tonight, the motion that I just made is the most stringent in terms of returning back in person. And so I just had a flow chart in my head that would be the most stringent. And then action item 6B would be the next one. And so I was just trying to perhaps, hopefully, potentially shorten the duration of each action item in terms of discussion.
Okay. And apologies for not having my video on. We're getting a lot of distortion on the sound.
Dan, I see your hand up.
Yeah. Gretchen, I appreciate your enthusiasm and your interest in trying to consider a wide range of possibilities. How does this represent good process?
Is that a question for me, Dan?
Yeah, it's a question for you, Gretchen, because that's one of your themes. We've been down the road in terms of developing a safety plan. We talked about the ed models. We have come at this question about dealing with the pandemic environment in a cautious but yet strategic manner, relying on the science. And of the alternatives we've had presented to us, including the safety plan, the updated safety plan, which we would approve this evening. But I don't know where this is really out of left field. I don't know how this represents good process.
Yeah, I'm just following Robert's rules, and I can make a motion. So I was just following parliamentary procedure. And I thought that out of respect to the teachers and the families in the community that we've heard from that support going remote, in addition to, this is not actually my idea, this is an idea from a New York Times article, other articles I've read too. This one was called How to Reopen the Economy Without Killing Teachers and Parents. But the answer to your question is I'm just rules.
So it's the opportunity is there. It's procedurally legal to do this. Essentially, that's your thinking about it.
And appropriate, legal and appropriate. Yep.
Okay. Well, my take on it is that it really is out of step with the steps we've been following systematically for the last 6 to 8 weeks, and so I will certainly have perhaps and I'm not sure the next step would be in this from a Robert's Rules perspective, whether we need to vote in favor of adding this item to the agenda or not. But
That the motion, just to clarify, if we need to take a roll call on whether or not to add the motion to the agenda.
Okay. And then we'd review them. Should that roll call pass, then we would have an opportunity to vote on it later.
To discuss and vote yes or no on the motion. Or action item.
Okay, thank you.
Okay. Lori, I see your hand.
My thinking on the second was just that because we're making such an important decision, and because we have heard from so many people who would really like to just go remote, that I just thought that it needed an airing. And so I think hearing the arguments for and against it would be a useful use of our time. So that's all.
Jim?
I think I should have lowered my hand. I think you answered the question about the procedure is that we have to vote on it to, a roll call vote to vote on it. So thank you.
Okay. Scott?
Yeah, fully get that this is within Robert's rules. Very, very disturbing of the deliberate attempts to circumvent the established protocols and procedures and past practices that this board has maintained for a very long time relative to having items on an agenda that go onto an agenda through agenda planning with board leadership and the superintendent, and having items come on for information and discussion so that there is appropriate public discourse and transparency. And here tonight, we have this motion, which again is completely acceptable under Robert's rules. We have other considerations that are completely outside of our norms and board protocols, at least in my opinion. And I think that this is a disturbing trend that we're seeing here this evening.
Laurel?
Thank you. Couple things. It was said that this idea came from out of the blue, but it has been out there before that we consider this. I know it's been mentioned in at least one meeting as just a possibility. But my question is, and this may be a Scott Eder question, I don't recall ever having had a motion to add something to an agenda. I do recall motions being made during that part of our agenda. And if this motion is defeated, does that mean that a motion couldn't be made actually during that time?
We talked about this a little bit earlier, and if we're following Robert's Rules of Order, the same motion cannot be brought up again later in the meeting, except by someone who was on the prevailing side of defeating the motion earlier. But a second motion potentially could be brought up that's different than the first, but related to it, if we're looking at this from a technical standpoint of Robert's rules. So the motion to add it to the agenda cannot be brought up a second time unless it's by someone who votes it down and they're in the majority the first time. But the substantive motion, the one to do this, could be brought up again later.
Thank you.
All right. Any other questions or comments? Okay. I'm willing to vote to have this on the agenda because I think it's been a question that a number of people have asked within the community, whether this would be a way to go forward. So since we're already having this level of discussion right now, it seems like reasonable to complete the discussion around the topic as an agenda item. So that's where my vote on this would be coming from. Anyone else? Any comments or discussion?
I just wanted to add one thing really quickly, which is that, again, this is, I think, at least some way to communicate to the teachers that we care about them. Even having the conversation, I think, send that message. And I would hope that we indeed do all care about them. So that's it. Thanks.
Okay. So is there any public comment on this motion? So if I see a few hands were up, but they were probably up before. And I would like to, first of all, make sure that any public comment at this time should only be on the motion to add this item to the agenda. Okay. The first comment I see is Adam Seitz. And if you'd unmute yourself, if you could, well, first of all, public comment is limited to up to 3 minutes and has to be related to items on the agenda or board business. In this case, related to this particular action item. And I'll just go in order of those whose hands are raised. And then if you could confine your comments to 3 minutes. So I see Adam Seitz, if you could state your name again and where you reside in the district.
Thank you much. Good evening. My name is Adam Seitz. I live in State College. This is my first public comment to the State College Area School District Board, and I'd like to first thank you and the entire school district for your efforts to create a healthy and safe environment for our children this fall. I am a biological, adoptive, and foster parent of 3 children in the school district, with our first child set to start kindergarten this year. I am a person of science. I am also immunodeficient and at an elevated risk of a severe outcome if, maybe when, I develop COVID-19. Due to the district's efforts, however, we selected the in-person option for my daughter who is about to enter kindergarten at Easterly Parkway. I am here because I do not support any potential motion to only approve the in-person school session for 2 weeks beginning August 25th, followed by moving to fully remote learning to obtain a greater understanding of the COVID-19 prevalence in our community, as expressed under draft meeting agenda action item B. Should there be a formal motion on this front, please vote no. Further, please vote no on the potentially new added action item A. It is too late for action item A. It does not represent good process and is inappropriate at this point in the war plan. I think the school district has been transparent with plans and proposed action should there be an outbreak. That plan is satisfactory. Selecting the in-person option was challenging for us, but a decision we were happy to have the opportunity to make. If privileged enough to be able to do so successfully or at all, others were able to select the remote options. I understand teachers may not have that option. In addition to being foster parents, my wife is entrenched in the outbreak as a human services professional for the county. As such, we are well aware of the societal difficulties this pandemic has caused and is causing for families and their children. I recognize that we are between a rock and a hard place as families, as a school district, as school district staff, and as a society. We also understand ours is not the only valid view. We understand that the situation may, likely will, develop such that fully remote learning becomes necessary, but the decision to go remote should not be arbitrarily set for 2 weeks from the start date. Further, we should all step up to the plate, and we should all serve as called upon to prioritize keeping in-school learning an option for as long as possible, ideally indefinitely, especially for the many at-risk children that depend on school for respite. If our society prioritizes opening anything, it should be our K through 12 schools. My family and I live with the nightmare COVID-19 could reap on us, especially given my immunodeficient status. However, our child's and other children's access to in-person schooling is a value that outweighs the cost. Thank you for all the work you've done this past spring and summer to make the best possible decisions in such a trying time and to make the State College School District what it is. Thank you.
Mr. Seitz, thank you for your comments. I do have a question for our solicitor. We've never had, in my greater than 9 years now on the board, had a motion to vote on in regard to adding an item to the agenda. In terms of public comment, because I do see there's quite a few people who would like to make a public comment, but we'll have multiple future opportunities for public comment. Do we need to have public comment on adding an item to the agenda?
Any action item that appears before the board, you need to have public comment on it before the vote.
Okay, thank you.
Yeah,
Okay.
Amber, do you want to just though repeat and explain why, why we were originally going to ask for people to comment on, because if this gets placed on the agenda, people will have an opportunity to comment on this specific motion. If it's placed on the agenda, and I would encourage our attendees to try and slot their responses in at those appropriate places to help convey their perspective.
I'll just review quickly. After we have the first portion of the meeting, before we even begin routine approvals and action items, we do have a public comment time. And then we also have public comment time on each action item. So there would be time to comment on this item if it's added to the agenda during the public comment time for that action item. So if we could, anyone who would like to make a comment simply on the motion to place an item on the agenda at this time, but not on the rest of the agenda. Okay, so I'm just going to call on folks in order. Joe Gordon. And if you could turn your mic off, you'll have 3 minutes. And if you could state your name and where you reside in the district.
Yeah, hi, my name is Joe Gordon. I reside in the Grayswoods area. Grayswood Elementary School is right across the street from me. Yeah, this is my first school board meeting that I've attended and listened to in the beginning here. And I support Mr. Seitz's perspective. I recall there was a survey done with how many percentage of families wanted to go back to school and have their children physically in school. And I wonder where that is in this agenda proposal. I certainly feel the majority want their children to be in school. If there can be remote learning, then there can be remote teaching as well. Children's need it. Certainly the science supports it. Thank you.
Thank you for your comments, Mr. Gordon. Todd Baney, I see your hand up. If you could state your name, where you reside in the district, and any comments on adding this to the agenda as an action item.
Yes, can you hear me?
I can hear you. Thank you.
Okay, all right. I live in the Graysdale section of Grayswoods, not far from Mr. Gordon. My question is, why would this even be brought up, considering that, as Mr. Gordon pointed out, that we had a survey that went out to all the parents, and it was overwhelming that 75% of the parents want to send their kids back to school. For the folks that don't, they still have the option to go remote, and that can still be on the table as is. Thank you for your time.
Thank you, Mr. Baney. Mr. Dawson, I see your hand up. If you could just state your name, where you reside in the district.
Hi, this is Mike Dawson. I live in College Township. My children attend Spring Creek and Mount Nittany Middle School. I wanted to comment on the addition of this action item to the agenda. I think it's really, really deplorable the way that you have decided to conduct yourself. I used to cover this school board as a news reporter for the Center Daily Times, and I've never seen anything like this. And you certainly have made very tough decisions in the past. And I totally respect that you have tough decisions to make and that it's not always cut and dry. But to spring this on the parents and the residents and the people that elected you to the board, I think is disgusting. If you said that you discussed this at a meeting last week or whenever it was, I really think that you owed the district or the parents in the district a heads up about that. My wife and I know friends and other people do not have time to watch meetings, hours-long meetings, to find all the updates. I think we were owed that information well before tonight or even over the weekend. And you guys did not, provide this information to us. This is the first that we're hearing about it in a public forum, or at least it's gotten the attention of the community. I think it's disgusting. And furthermore, you really need to look at your communications plan. You guys have, the board members, have no problem using their personal Facebook pages to make public comments representing the school district. Is that appropriate? There are certainly ways to get that message out, and I would encourage you to look at a better way to do so. Thanks.
Thank you for your comments. Mr. Gutoff, I see your hand raised. And if you could state your name, where you reside in the district, and you would have 3 minutes for comments on the action to add this to the agenda.
Thank you, Amber. Steve Gutoff. I live in the Houserville section. I have a son that's going to be a senior at the high school. That'll be my fourth child going completely through State College Area School District. I'm commenting at this point of the meeting against the action item. I believe it violates any sense of transparency. Emails were sent home asking parents for their choice to whether return, to go virtual. 78% of the residents in the district who replied indicated they wanted their children in school. I certainly support that. And I think adding this action item to the agenda at this point is disingenuous. Thank you.
Thank you for your comments. Ms. Holloman, I see your hand up. If you could just restate your name, where you reside in the district, and then 3 minutes for comment on the motion to add this to the agenda.
Hi, thank you. This is Ashley Holloman with my wife, Heather. We live in Park Forest. We have a daughter who just graduated from State High last year and currently have another daughter who's a sophomore at State High. I understand that should this get on the agenda, I hope that it does not, but should it get on the agenda, we'll have another opportunity to comment on the item itself. So right now, I just want to comment on, I do not believe it should be added to the agenda. I wholeheartedly agree with the others, what the others have said. The survey that was sent out, you certainly have an understanding of what the families and parents want. And I did not know about this at all until about 24 hours ago by rumor with a neighbor. We got no notice, and we've been getting good communication from the district, but we got nothing about this. And you want to make a decision tonight that's a huge major decision that undoes everything that we've cooperated with and been a part of for the last several months. This seems like an ambush. It's inappropriate, and it just degrades trust in you as a school board. Thank you.
Thank you for your comments. Ms. Myers, I see your hand up. If you could just restate your name and where you reside in the district, and then 3 minutes on the motion to add the item to the agenda.
Hi, my name is Carla Myers. I live in Boalsburg, and our daughter is entering 9th grade. I want to say that I really respect Miss Brandt for what she just did, especially in the face of all the comments she's now receiving. I think she's probably responding to a significant portion of the population who feels like this would be appropriate. And the one reason why maybe everyone hasn't heard about it before is because the data is always changing. So to me, it seems like a reflection of observation of data. I personally keep coming back to the idea that although we don't always agree, we are a completely interlinked community, and that's all a virus cares about. And if we can do something to prevent this illness from spreading, especially to higher risk people, we should. Because the virus seems to sicken and kill other people or random people, I think it feels reasonable to say, okay, we have the best plan, maybe the best plan in the entire state. I believe that. Let's open school buildings and see what happens. But everybody is somebody important. I don't think any of us would feel comfortable lining up all the students, teachers, and staff and picking exactly who gets sick and who dies. And if we can't do that, then we shouldn't open the buildings, because that's exactly what we would be doing. It'll be somebody's mom or dad, somebody's child, brother, teacher, or friend. We just don't know their names yet. So let's find a way to let the data come in from the effect of the Penn State students' return before rushing to stick to our traditional fall schedule. These are not ordinary times, and I get that, but I think we as a community can meet the challenge, and I support action item A.
Okay, thank you for your comments. Michelle Rodino, I see your hand. If you could just restate your name, where you reside in the district, and then it would be 3 minutes on the motion to add the item to the agenda.
Okay, thank you, Amber. Thank you, Gretchen. Thank you, Lori. Thank you, everyone, for considering this motion. COVID is now the 3rd leading cause of death in the United States. When I spoke a week ago, It wasn't quite yet, and here we are. Thousands of Americans have died, unfortunately, since we last met. We have horrible data coming in about this virus. We see that UNC, University of North Carolina, has had to close after just 1 week being open because of multiple clusters of outbreaks. I have a feeling if UNC could have started all remote, it would have, because now it has to deal with sick people and treat them and let the illness play out. Wouldn't it be great if we had that kind of foresight? Wouldn't it be great if we could look back at ourselves in the future and say, if only we had closed just a week earlier, maybe 2 weeks earlier, because we are opening the same week as Penn State. Maybe we could have saved some lives. Maybe we could have saved some people from having permanent disabilities, catching the virus. So I would like to applaud this motion. It absolutely is a discussion we need to have. It is in the interest of transparency and in the interest of teachers and paras and staff. We still have not heard, what about surveys of them? How many of them want to start all remote, or at least want the choice? We owe it to the employees of this district and to our community to consider this motion in its entirety, and I applaud. And I believe it's part of our democratic process to do so. Thank you.
Thank you, Michelle, for your comments. I see Donna KORZIK's hand up. If you could just restate your name, where you reside in the district, and then comments related to the motion. Thank you.
Hi there, my name is Donna KORZIK and I reside in the borough, and my daughter is a rising 7th grader at Mount Nittany Middle School. Imagine my surprise when I tuned in tonight expecting to hear the board according to the agenda that was posted, and to find us talking about a motion to support closing the schools. And like the majority of the others who have gone before me, and including board members, Dr. Duffy and Mr. Fozard, I just want to say on process, this is deplorable. And I can't imagine how the board could take action on this item, even if it is passed and added. As a parent, I'm outraged that this is coming forward now at this late time. As a scientist, it's getting a little bit old about the abuse of the data. And I just want to speak in favor of voting putting this motion on the agenda down tonight, and that let the process play out, let the plan that the district has worked so hard to find a way to allow our children to return to school, and for our teachers to be safe and our children to be safe. Thank you very much for letting me speak.
Thank you, Ms. KORZIK. Amanda Jacobs, I see your hand raised. And if you could just restate your name, where you reside in the district, and then 3 minutes for comments on adding the motion to the agenda.
Hi there, can you hear me?
Yes, I can, thank you.
Thank you. This is Dr. Amanda Jacobs. I reside in the Grays Woods area. I have a child in Grays Woods Elementary, in Park Forest Middle School, and in State High. My comments will speak only to this agenda item, although I have many other comments to make. I do not believe that it is appropriate to put this onto the agenda without alerting the public to this, as I was just found out that this was all going on over the weekend regarding 6A, not this agenda item, but to close the schools completely without putting that out to the parents and the students, or the parents of this community, is absolutely ridiculous. Our COVID situation in State College is stable. I work in healthcare. The plans for safety that are allowing us to mitigate COVID, which include universal masking, social distancing, and frequent hand washing, which is what allows me to do my job safely every single day, are the same plans that you are planning to put into place for school. You should trust your safety plan, and we should not put this agenda item on the agenda at this time, specifically with not allowing all parents to be aware that this was even going to be discussed. And we should move forward with opening school. Thank you.
Thank you. I would like to just clarify in terms of process, this is one of several ways that a board member can make a motion in a meeting, and asking to add an agenda item at the front end of the meeting does give a little more warning than other ways to accomplish the same goal in terms of potentially introducing an agenda item as its own motion during the action items, or amending an item later in the meeting. So in terms of process, I just do want to clarify that this is one of several possible routes to do that. So, so right now we're just asking, the question is whether this would be added on as a standalone item. Okay, Sarah Miller, I see your hand raised. And if you could state where you reside in the district, and then 3 minutes on adding the motion to the agenda.
Sure, thank you very much. So my name is Sarah Miller. I live in State College with my husband and our child, who attends Delta Middle School, but also takes classes at State High and Delta High. I want to speak tonight not as a mom of a particular child in the school district, but rather in my professional capacity as an ethicist, which is the area of study in which I received my doctoral degree and have taught and researched in this area for nearly 2 decades. So I think contrary to popular opinion, the job of an ethicist is not to tell you what's right or wrong necessarily, but instead to help you draw an ethical map and to offer different ethical principles and values that help people make decisions that are most in line with their own moral compass. So when we sit on hospital boards, for example, as ethicists, we often come to ensure that all angles of a problem or dilemma are being considered rather than telling the board what they should do. Now, you, the school board, and we, the SCASD community, are facing what is an impossible dilemma, that is an impossible problem. I don't need to tell the members of the school board that. In the multiple meetings I've recently attended, I've witnessed the care and thoughtfulness that you've evidenced in figuring out how to make this decision. What I want to do tonight is urge you to look at all angles of the issue and urge you to allow this discussion to go forward, such that you can know that you have abided by ethical principles that make sure you've left no rock unturned, and that you focus carefully on the different angles. Most importantly, you're in a position where you have to figure out how to do the least harm, right? There's no good choice to make. One population that stands to be harmed are the students, especially those with special needs who need to be in schools, and those, for example, who need to go back to school to eat, to receive food. Both populations are among the most vulnerable. And I think you've paid a very important and should continue to pay important attention to those populations. But there's another population with considerable vulnerability, and that group is the adults, the teachers, the paras, the principals, the bus drivers. Adults are at a greater risk of death and are at greater risk for long-term disability in the form of pulmonary, cardiac, and neurocognitive issues that arise from COVID-19. And in fact, 40% of adults in the US population have underlying conditions that put them at higher risk for those types of complications. So as an ethicist, I urge you not to make any one specific decision. That's not my place in any way, shape, or form, but rather to think carefully about the ethical principles that guide your decision-making, and to really take the time to have this conversation tonight by adding it to this evening's discussion. Thank you.
Thank you, Ms. Miller. I see Mike Cox's hand raised. Mr. Cox, if you would like to begin by introducing yourself, where you reside in the district, and then 3 minutes on the topic of adding the item to the agenda.
Thank you very much. I live in the Pine Grove Mills area of the district. I have a son who will be a senior at State College High School. And I really appreciate what the preceding speaker just said about considering all angles. I was really surprised when I heard that it was under consideration to remove in-school learning after 2 weeks, and then use the 2-week period of time to educate the community about the COVID disease. I think we as parents are doing everything we can to stay on top of the risks presented by the COVID disease. And I was kind of taken aback, not just by the notion that this meeting was taking place, but the school board felt that there was a need to educate the community, the students, about the COVID disease. I would ask all of you to consider what the pediatricians said at the last board meeting about the risks imposed to our students in terms of depression, anxiety, and abuse that has already taken place and will take place should you continue to keep these schools closed. I really recognize that there is a risk for the COVID disease, but I also know that these students are not going to get this time back. The quality of the education will not improve. That's why 75% of the high school students' parents have voted against this. And I think it's also important to consider that other districts, while they may not be dealing with the influx of students from Penn State, we still don't know how that is going to affect our students. We can make an assumption, but we do know that the quality of the education, since our students have been shut down, is been diminished, and it will be continue to be diminished. I do not believe other school districts are considering these type of permanent shutdown after 2 weeks. So I would really urge all school board members to vote this down and to work to make sure that we can minimize the risk and provide our kids with the best possible education, of which we as taxpayers pay a lot of money for. Thank you.
Thank you, Mr. Cox. Next, we have Stacy. If you could state your name, where you reside in the district, and then you would have 3 minutes on this motion.
Hi, thank you. My name is Stacy Probolka. I live in Pennsylvania Furnace, and my 8-year-old son attends Ferguson Elementary. I just wanted to voice my concern as well, that I am not in favor of this motion being added to the agenda. As a healthcare worker, I cannot afford to, my patients take risks every day to come to get the treatment they need, and I need to be there. I can't take this risk to stay home to teach my son. I don't have that flexibility. I would have to leave my job, and then that financially would hurt my family as well. But also my son is owed an education, and I won't be able to give that to him. I can't do that. He definitely needs the support of being in school. And like I said, as a healthcare worker, I've been through this since March. I've been working every day, and I think we're doing great as a community. And if we continue to do great as a community and take the steps we need to keep our families safe, I really think that this is the best option for our children. That's all. Thank you.
Thank you for your comments. Georgi Terrizzi, and if you could unmute yourself, introduce yourself and where you reside in the district, and then 3 minutes. Thank you.
Hi, my name is Georgi Terrizzi. I live in Ferguson Township. My son will be a senior at State College High School. I also am urging the board to vote no to this motion. I believe that the school district has done a wonderful job of developing a safety plan. I feel like in the community that the community has also done a good job of keeping this at bay. And I feel that the students are fully deserving of their education. I know that I also work in healthcare and feel that taking the precautions that we do, masking, wearing gloves, using hand sanitizers, washing hands regularly, that it is really helping to offset the COVID. And I do believe that the students need to proceed with schooling. Thank you.
Thank you very much. Zoubeida Ounaies, I see your hand up. And if you could introduce yourself and where you reside in the district. Thank you.
Hello, my name is Steve Carpenter. I am a parent of a child in College Township. And I am in favor of adding this motion to the agenda. I think it's very important to map the widest range of options possible, where we don't discount or prematurely make decisions without a full range of possibilities. What's also important about adding this to the agenda is that we're taking into consideration the health of teachers, some who might be in more vulnerable situations than we realize, and supporting teachers, staff, and bus drivers, among other individuals, is crucially important. And this might provide an option that some people might benefit from who are otherwise inclined to only consider the existing options.
I'm Zubeida Ounaies. I'd like to add my voice to Steve's in fully and strongly supporting this motion to be added to the agenda for the reasons he stated. But I also wanted to add that as a scientist and an engineer, if there is anything we can say with certainty about the virus and the data surrounding the virus, it is that we are still learning about it. We certainly see in recently published papers that what we considered at the beginning as vulnerable populations is now extending and permeating into other age groups, people with vulnerabilities that were not identified at the beginning. And so in closing, I want to say that the only way to consider various point of views, including point of views of vulnerable population, is to have discussions about the topic. And this is one way to take teachers and staff into considerations. Thank you very much for the work that you do.
Thank you very much for your comments. Mr. Clark, I see your hand raised. If you could state your name and where you reside in the district, and then it would be 3 minutes on adding the item to the agenda.
Great, thank you. Thanks for letting me speak. I'm not in favor of this motion being added to the agenda tonight. It frankly caught me by big surprise. I don't have a doctorate. I don't have a college degree, but I have common sense and I know what's right and what's wrong. And adding this motion in the manner it has at the last minute is flat out wrong. A motion of this significance at the last minute before the public's had a chance to review it ahead of time seems calculated to avoid any transparency. The district's had 6 months to plan this fall out, and to get cold feet at the last minute to return to school seems irresponsible, especially while the Center County COVID numbers are as good as they have been all year. The people pushing for the remote only are comparing nationwide data to Center County's. And in my opinion, Center County's data is all on its own. Comparing the UNC news today to Center County isn't good science, in my opinion. Wake County, North Carolina has 12,000 plus COVID cases in the Raleigh area, and Center County has 350 cases. So I would just like to say that I am definitely not in favor of the motion, and I think it shouldn't even be brought up as a motion. Thank you.
Okay, thank you, Mr. Clark. Mr. Anderson, I see your hand up. If you could state your name, where you reside in the district, and then 3 minutes on the motion at hand.
Hi, my name is Carl Anderson from College Township. I was going to speak against the 2 weeks of in-person learning and then switching to remote, but I will, the theme of my message goes against remote in general, so I'll speak to that. And I'm against adding the motion. So I'm speaking on behalf of my son who's entering 4th grade, and he is in special education. And last spring, he was placed in a position that was really untenable for him to receive the education that he deserves. And I fear that if we go to remote this fall, either right away, as was proposed, or in 2 weeks after that, he would be at a great disadvantage. I do appreciate Ms. Brandt bringing up the issue of special education at all. I think that's really important, but I still am against, I still believe he deserves to have in-person instruction. So when we went remote, he lost almost all of his instructional support. Between mid-March and June, he had a handful of conversations with his special education teacher via Zoom, but otherwise my wife and I were left to educate him on our own. My wife, who does not have a special education certification, was forced to teach our son 2 to 3 hours each day on her own just to keep him from regressing academically. Both of us work full time, so even if we were certified in special education, we would not have had the time to provide the education that he deserves. So I appreciate the commitment towards safety in the district, but I strongly feel that my son specifically and all students with an IEP deserve to have in-person instruction this fall, and so I'm against the current motion.
Thank you for your comments. I see someone with their hand raised, only identified as having a Samsung phone, and so I'm not sure who that is. If you could unmute yourself and then introduce yourself, where you reside in the district, and then it would be 3 minutes on adding the motion to the agenda.
Hello, can you hear me?
Yes, if you could just introduce yourself. Thank you.
Sure. My name is John Panino. I'm in the Hauserville area, and I have 2 children in school. One going into
First, one going into
first grade, and
one going into 6th.
And we just found out about the putting this on the agenda today. I did, and I was shocked about it. And I believe that during this whole time, our kids' mental health has been consistently
declining,
going down. And would you like to? My wife Elizabeth would like to speak about that.
I suffer from anxiety and severe chronic depression, and as some of you may know, that is genetically disposition to my children. When this all started, you know, there aren't enough resources available for, you know, as a lot of other people said, special needs children. And me as a stay-at-home mom, it just puts everyone, you know, I feel like their mental health is the most important thing right now. Like someone else said, just teaching proper hand washing, wearing the masks, you know, things like that should be considered more, you know, like, and it's like for me, if I'm not doing well mentally, obviously my children aren't going to be doing well. We're in a spot where, you know, you start, you're home all the time, and then you start, that's the routine. Like having a regular school schedule is so important, socially, mentally, physically, everything. Anyway, that's all I wanted to say. Thank you.
Thank you for your comments. Priya Poehner, I see your hand raised. If you could just introduce yourself, where you reside in the district, and then 3 minutes on the motion at hand.
Yes, this is Matt and Priya Poehner. Actually, we live in the Hauserville area, and we have 2 children, one in the elementary school and one who's starting high school. And we'll speak together. We really are grateful that the school board is bringing this up. I think that contrary to what I guess many voices have expressed, I think a big part of science is, in fact, responding to new information and being able to pivot quickly. And I know that the situation in the country has continued to change. And I actually think that the situation in the country is something we need to be monitoring very closely, rather than just what's happening in Centre County, given that our state college community is about to be transformed as it doubles in size with the arrival of Penn State students from all over the Commonwealth, all over the nation, and in fact, in some cases, internationally, for students who can get visas and come. So I think that we're going to change in dramatic ways, and having the possibility to be, for our students to be remote at the start of the year, while we see what impact this transformation has on COVID and its presence in our community, that certainly seems extremely, safe for us to be able to monitor that and then have the most relevant information, because then we'll know what our situation is to be able to make decisions at that point about when it seems safe to return to in-person instruction.
So Matt and I would like to
ask that this motion be placed on the agenda for full discussion. Thank you.
Thank you. Thank you for your comments. David Morosky, I see your hand raised. And if you would like to introduce yourself, where you reside in the district, and then 3 minutes for this motion at hand. Thank you. And you may need to unmute yourself. Mr. Morosky, we're not able to hear you. I think you have to unmute your machine. Okay, I'm going to move on to Rebecca Lothian, has her hand raised, and then we'll circle back to Mr. Morosky in a moment. Rebecca, would you like to introduce yourself and where you reside in the district then? Thank you.
Yeah, my name's Rebecca Lothian. I have 2 children that go to Easterly. My kids are special needs. One is in 3rd and one is going into kindergarten. And I just wanted to put my voice behind all those that are in agreement with adding motion A to the agenda. My kids, like others have said, have definitely fallen behind because they haven't gotten as much of their IEP support during the emergency learning. But I think kids are really resilient and they can catch up whenever this is finished, but putting the lives of the staff and the teachers at risk that might not be able to, you might not be able to undo that if we have deaths because the school is open. So yeah, I just wanted to agree with everyone, and I think that the motion should be voted on and that we should talk about it. Thank you.
Thank you for your comments. Mr. Morosky, if you would like to speak now, and you'll need to hit unmute. I think it's a technical problem there. Mr. Morosky, you might find in the bottom left corner of the Zoom screen, there's a mute button. And if you unmute, if you click that button, you should be able to unmute yourself. Okay. Does not seem to be working. Nick, are you on the line here? Are you able to unmute from your end?
I'm not able to unmute him. He will have to unmute his audio by himself.
Okay, thanks. Okay, so I'll move on to Kristen Scipione then. And Ms. Scipione, if you could just introduce yourself and where you reside in the district.
Hi, I'm Kristen Scipione and I'm in Half Moon Township. I have 3 children in school. And I wanted to say today that I am in favor of discussing this motion. I'm not sure why we wouldn't want to discuss more options. It seems silly to peg ourselves down to one course of action when there are constantly changing factors in our community, in our state, in our country. And one of the biggest changing factors right now is that we are seeing these college campuses that are opening up, and we're seeing huge clusters that are coming back with the students. And as has been pointed out, we will have students returning not just from Pennsylvania, but we're going to have students returning from, you know, the South, the Southwest. We're going to have students returning from all over the world. And I think it's silly to pigeonhole ourselves into a plan that was made before we saw the effects of college campuses coming back into communities and what the students were doing, or in terms of some students not doing to protect themselves and the communities that they were back in. So I think we absolutely need to look at the changing situation. And I do appreciate a lot of parents have pointed out it is very tough to educate children at home, but kids are very resilient. So I think our priority should be making sure that everyone lives through this year. And then we can, you know, work together as a district to get kids caught up to where they need to be. And, you know, maybe even by spring, we can get people back in to full-time education that looks more like what we're used to. But it is very important that as this is a constantly evolving situation, that we keep our minds open and that we discuss things that as we become aware of them and as the science changes and as statistics are showing us where outbreaks can happen and where they are occurring. And I think college campuses are a big issue right now, and we're seeing colleges that have gone back before us, what's happening in those communities. So I think looking at our historic numbers in Center County over the summer, and yeah, our numbers have been great. We've been doing really well. I think that's going to change, and I think we do need to talk about that. Thank you very much for your time.
Thank you, Ms. Scipione. Mr. Morosky, would you like to try to speak at this point? And if you could unmute yourself. I think it's possible that he might not actually be on the line. I'm going to move on to Bernadette Snyder. Ms. Snyder, would you like to introduce yourself, where you reside in the district, and then 3 minutes on the motion to add this to the agenda?
Yeah, this is actually Bernadette's husband, Travis Snyder. We reside in Ferguson Township. Our son goes to Coral Street. And I haven't been following the school board's decision and process too closely, but I guess I'm just confused as to why we want to bring up discussing this option this late in the game. It's been no secret that Penn State students are coming back. You smart people have been working all summer, I suppose, on options. And I assume that this option would have come to the forefront earlier in the process. And we just do not support bringing this motion to the agenda, and hope you guys move on to other things. Thank you.
Okay, thank you. Tina Powers, I see your hand raised. If you could state your name and where you reside in the district, and then 3 minutes.
Good evening. My name is Tina Powers. My family resides in the borough. I am not in favor of adding this motion to the agenda. I believe I've been very diligent keeping up on all school updates, both for State College as well as other schools, and found out about this motion on Facebook a couple days ago, as it sounds like many people did. I dialed in today to see if it was true, and learning that it is. Ms. Brandt's comments to begin with, I feel are very unfair to suggest that going to school in person means we don't care about our teachers. That would infer that those of us wanting to send our kids to school don't care about our kids either. And this is simply not true or fair to judge. Each family should be respected to choose their own path and of course follow all safety guidelines. We all know what is best for our own children, and we should all have a right to choose with the help of professionals to mitigate risks. The options currently available give every family choices as well as flexibility for the district to make changes during a fluid situation. I have many friends that are teachers, both in State College that are very much, and other schools that are very much looking forward to going back to school, as they know their kids need them and each other. They know, as we all do, that things are different, but are committed to educating our youth and doing their jobs to the best of their abilities. No one or no couple people should have the power to dictate one option for every family in our community. Let's be clear, if the board votes on this remote option after 2 weeks, there is only one option, not options. My son has been a student in the district for 8 years. Tonight's board decision will play a significant role in our decision of whether or not he continues to attend State College this year. Thank you.
Thank you, Ms. Powers, for your comments. Is there anyone else who would like to make a public comment? Okay, seeing none, I'll transition back to board members. Board members, do you have any final comments on this item before we vote? Oh, I'm sorry, there is another public comment. Malcolm Hummel? If you could unmute yourself. Thank you. And state where your name and where you reside in the district.
Yeah, my name is Malcolm Hummel. I reside in Patton Township, and I am not in favor of this motion. As far as what I understood until, actually yesterday was that school was going forward as planned, that we had, plans in place. We've been wearing our masks for the last couple months. We've been washing our hands, and this area has not been hit lightly. If you divide the overall deaths by the amount of people living in the United States, that's 0.00045%. And many people don't show symptoms at all. And I understand that's why it's sort of scary to some people. But in this day of social media, which is relatively new to humankind, nothing like this has happened before. This is pretty much the last 10 years. We work ourselves up into a flurry over everything. And I just think that if we look at the numbers, and if the teachers are willing, if the faculty is willing, then, I've heard 70%, I've heard 78%. I think that school should be held then. If people do not want to send their student to school, you're always welcome to do that. But by canceling school, that would take the option away. And that's about all I want to say. Thank you.
Thank you for your comments. Julie Wan, I see your hand raised. If you could introduce yourself, where you reside in the district. You would have 3 minutes. Thank you.
Yeah, hi, this is Dr. Michael Fryman. I'm actually Julie Wan's husband. Can you hear me?
Yes, thank you.
We have 2 daughters in the state college school district, a 7th grader at Park Forest Middle School, and then a freshman starting state high. Whether or not this motion is brought on, this meeting has been pretty long, and I just wanted to let our thoughts on this process be heard. We probably can't attend the whole meeting. First and foremost, I want people to think about students first and not their own self-interests. I'm a physician, and I do try to follow CDC guidelines, and CDC guidelines are stressing the importance of children going back to school. Through wearing face masks, proper hand washing and sanitation, and social distancing, we should be able to have our students go back to school. I'm an ear, nose, and throat physician, and my specialty is at highest risk of morbidity and mortality from COVID-19, yet I still believe that the fear is disproportionate to reality. When we hear about positive cases, even in the case of UNC going back to school, ask yourselves, are those people sick? We also do want to take care of our immunocompromised, our elderly, and try to wear a mask and social distance for everyone's sake. But our students are also at risk for depression, anxiety, addiction to electronics. I believe that this is disingenuous to add this to the board meeting today, that it is an ambush, to use someone else's words. But even so, if we are able to talk about it, please keep students first and not teachers first, not parents first, but students first, because education is about the students. Thank you.
Thank you, Dr. Freeman. Thanks for your comments. Douglas Glannard, I see your hand raised. If you could introduce yourself and where you reside in the district.
My name is Doug Glannard. I live in the Patton Township. The questions I have regarding this motion are, have the teachers had the opportunity to express how they want to handle the education process? That's question 1. Question 2, has Matchek Boney discussed how the university handled their educators? The last comment is, I think the board needs to have this added to their agenda to discuss these areas. Thank you.
Thank you, Mr. Glannard. Any other public comment at this time? Okay, Amy, I see your hand raised.
Yeah, I just didn't get a chance to comment. A couple other board members had about placing it on the agenda. And I just want to be clear, this is the way the process works. Agenda setting is done between leadership and the administration, and the avenue for other board members to have items placed on the agenda is one such as this, or perhaps asking to have it done during the action period. So I appreciate that Ms. Brandt tried to have this done up front. That's the mechanism. And so in the interest of the points the ethicist made, I'll support putting it on the agenda for the democratic process and for a discussion to be had. And that would be the reason why. Thanks.
Laurel, I see your hand raised.
Yes, I wanted to make sure that we do reread the motion. From many of the comments, it sounds like people think that it is the thing that is actually already potentially on our agenda item menu for a closure after 2 weeks. I did not think that was what this motion was to add. So I wanted to make sure that the motion is reread.
Gretchen, would you like to reread the motion?
Sure. The motion is to add an action item that would become action item A to begin the 2020-21 school year remote with the addition of care centers for students with IEPs, social emotional needs, CTC students, and students who would be home alone otherwise. That's the motion.
Okay, thank you. Any other board member comments before we vote? I would just like to say that I'll support adding this to the agenda. I appreciate Gretchen raising this during this portion of the meeting. That was the appropriate process for adding something to the agenda at a meeting. And you know, otherwise, if we weren't adding an item at this point in the process, there are other opportunities when board members can add items or can make motions in the meeting. And I feel like I'd like to appreciate Gretchen doing it this way. Okay. All right. So at this time, we will have a roll call vote.
Ms. Concepcion.
Yes.
Dr. Duffy.
No.
Mr. Fazzard.
No.
Mr. Hutchinson.
No.
Mr. Leos.
Sorry, yes.
Ms. Sidney.
Yes.
Dr. Bader.
Yes.
Ms. Bedell.
Yes.
Ms. Brandt.
Yes.
Okay, that item has passed. So at this point, what Gretchen's motion will be the first item under action items, since that was part of how she had written her motion. So that will become item A, and item A will become item B.
Amber, I'd like to make a motion to move the new item A to what would then be item C, I believe, which would be a more appropriate consideration of the process and the fact that this was sprung on the board and the community to allow us to get through the safety plan, which is on the agenda and people have known about, and to get on the 2-week question, which was on the agenda and people have known about, and address the new motion at a better place in the agenda.
I would second that. Second that movement further down in the agenda.
Oops, I'm sorry, I was not unmuted. Thanks, I heard motion and second. Is there any discussion around this motion? Okay, is there any public comment? Okay, we will have a roll call vote on this motion.
Dr. Duffy.
Yes.
Mr. Fazzard.
Yes.
Mr. Hutchinson.
Yes.
Mr. Leos.
Yes.
Ms. Sidney.
Yes.
Dr. Bader.
Yes.
Ms. Bedell.
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion.
Yes. Okay, so that item has passed, and so that item will then be item C. Okay. Actually, where we are on the agenda right now is where Dr. O'Donnell is supposed to review housekeeping items related to the COVID-19 pandemic. I think we can shorten this considerably. I'll just run through this really quickly. This is a virtual meeting as a result of the pandemic. The IT help desk is available during the meeting. If the community encounters technical difficulties, you can call 814-231-7743. And you can see that when a board or community members want to make a comment or ask a question, use the raise hand feature in the Zoom program accessed under the participants tab. There are two parts in the meeting for public participation, public comment, and if an action item is discussed further by the board. The host will lower hands and unmute speakers as necessary to assist with the flow of the meeting. Dr. O'Donnell, is there anything else you would like to add to that?
Nope. Thank you.
No. Thank you. At this time on the agenda, we are moving on to communications. We have the superintendent's update, and I will call on Dr. O'Donnell to provide his update this evening.
You bet. Thanks, Mrs. Concepcion.
Amber,
So obviously, I'm sorry.
I'm sorry to interrupt. Do we normally have a roll call before this?
Yes, I'm sorry.
Did we miss that? Just a point of order.
I'm sorry. We'll have the board member roll call now. Ms. Tressler could provide that. Thank you.
Dr. Bader.
Here.
Ms. Bedell.
Here.
Ms. Brandt.
Here.
Ms. Concepcion.
Here.
Dr. Duffy.
Here.
Mr. Fazzard.
Here.
Mr. Hutchinson.
Here.
Mr. Leos.
Here.
Ms. Sidney.
Here.
Okay, that item has passed. Well, we're here. And I'll let Dr. O'Donnell move on to his update.
Thanks, Amber. So tonight we're at an intersection along a long road and an important moment for our district and our community. And before we proceed, I'd like to acknowledge the work that has brought us to this point. To prepare for the upcoming year, we've had many people scrambling throughout the entire summer, crafting a detailed and comprehensive safety plan, all 60 pages of it. We've also had a large number of faculty members going through the ups and downs and the changes we've had through the summer to prepare for the upcoming year, which we're a week away. Along our summer journey, we're fortunate to have scientists and medical professionals, including all of our nurses, sharing their thinking throughout the development of the plan. And I'd personally like to thank Jean Knaus for all her work in helping lead that group. Honestly, I've not seen a school plan in Pennsylvania that is as thorough as what we've designed, and I'm proud of where we are and confident that we're ready to get back to school, both in person and remotely, just 1 week from now. So much so that my wife and I have chosen our in-school learning for our children. Even with our protocols in place, however, we will continually monitor the virus in our community, collaborating with Penn State, Geisinger, Mount Nittany Medical Center, and its physicians group to monitor their testing practices and the results on a daily basis. For my role, we've been working to plan a safe opening of schools. We've also planned to monitor the presence of the virus in the community so that we have the agility to pivot at any time. And obviously, if we're in a scenario where my involvement causes us to make that decision, we will do so, just like we did in the spring. This monitoring includes those collaborations that I mentioned and monitoring their testing practices and the results on a daily basis per zip code. We're focused on the safety of students and employees, no doubt about it. And if we're safe, I believe that students should be in school with our faculty and staff. That's the best scenario for student learning and their well-being. And that includes all of the input we've had from physicians, including our pediatricians. 73% of our families have selected our in-person option, and this is up to date as today because we've been permitting changes through our principals. At this time, according to all of our metrics, the virus has a low presence in our community. Of course, the future is uncertain, and our planning with the board does allow us to close schools and immediately pivot to remote status. That is, if the board approves what we proposed. So at this time, my hope is that we can move forward with the recommended plan. As I shared with you on Thursday, I'm going to now update you with how we can monitor the virus. We've done some legwork since Thursday with our collaborations, and I've attached in written format to your agenda under communications, that information. And I'll just highlight it. Maciek is with us at this time. And because of his expertise, I'm going to ask him to weigh in on what he thinks as well. So in that brief memo that I attached, we would be monitoring total tests per zip code as well as total positive results per zip code so that we can understand a day-to-day impact of or presence of the virus. We would be using the Department of Health data dashboard. Today we spent time with Sean Kaufman, as well as Penn State officials, understanding how we can have real-time data so that we can share that with Maciek and our safety team, as well as the board and our community as we monitor this virus. So we're also monitoring how testing is proceeding with each of our partners, because currently Geisinger has reported their testing turnaround is within 24 hours. Mount Nittany Medical Center, Mount Nittany Physician Group, their results are within 48 hours. And Penn State University Health Services, their results were shared with me today. The timing of those would be 24 to 48 hours. So that's the update as I promised you on Thursday. And obviously my role is to work with our team and get you the most information, up-to-date information, so you're making informed decisions. At this point, I'm going to ask Maciek to weigh in on what we shared here with the monitoring of the testing, and then you can ask him some questions, and then we'll move on the agenda. So Maciek, are you ready to weigh in?
Sure. So Bob, do you want me to review the guidelines and the cut points, what we had originally and what was added, or does everybody already know what those are?
You know what? I think if you touch on the monitoring of the virus, then I think we can shift, because we're going to do that when we hit that action item.
Okay, so just
on this monitoring point, unless Amber, you want to move into that immediately right now.
Do we start with the monitoring and
Yeah.
how we'll be able the availability of relatively fresh data?
Okay. So I'll start with giving a brief overview of the daily monitoring that we'll be doing, the data types that we'll be getting, the qualitative information that we'll be getting, and then Bob and Amber, if there's any other details you want me to touch on, just let me know when I'm done. So essentially, we're going to use Pennsylvania Department of Health data that's very easily broken down by county, and then if you sort of zoom in and you look hard, you can see that it's also broken down by zip code. So we're going to get the daily new cases by zip code and by county that we'll be able to keep track of every day. And then from Mount Nittany, from Geisinger, and from Penn State, we'll get the percent positive among the patient pools that are being tested in those either clinics or at the university at that time. So we'll have both absolute case counts to let us know if the total number of infections or the total size of the epidemic is increasing in some ways that we wouldn't expect. And we will also have percent positives, which will tell us with some additional qualitative information about whether mainly children are being tested or whether mainly adults are being tested. The percent positive numbers will tell us, give us additional information on the rate of spread in the community at that time. The main things that we'll be looking at is changes from the first week of August to the third week of August to the fourth week of August. Excuse me. These are the most critical things to look at, especially early on, to see if we see any unusual changes. In addition to all these numbers, with the safety team, so that's Joy Drass and Allison Huggins, who are pediatricians who have been helping us along the whole way, we're going to be getting qualitative information that will give us insight as to, for example, the testing numbers reflecting an outbreak in an elderly care community, or a large proportion of children coming into Geisinger or Mount Nittany to be tested. So if there's any unusual changes in the screening or the populations that are coming in, this is something that we should be able to get with the safety team and with all the other monitoring that we're doing. So Bob and Amber, there's some other bullet points here. Is there anything else that you wanted me to touch on?
I think open it up to questions of board members. I know that once we get through routine approvals, then we'll step away from this and then come back to the health and safety plan and the memo that includes the markers.
Sure.
Okay. Lori?
Just one question. Do we know what percentage of testing is coming from those 3 centers and what percentage of testing is coming from the other facilities in the community? Is there any way to know that?
I don't know that, but I'm going to put that, but I know where to get that information. So we've essentially tried to cover our bases as much as we can. Penn State, Mount Nittany, Geisinger, which should be the majority of the tests coming in. And also because we have the county-wide numbers and the zip code level numbers, we'll know if there's something very irregular. So if there's tests coming from a center that's not among those 3, but the county and the zip code numbers shoot up really quickly, we'll be able to see that. But yes, I understand for the board that's important to know. So I'll see if we can get that number.
Thank you.
Gretchen?
Yeah, thanks. I have 2 questions for Maciek, and thank you so much for all your help with this and for being here tonight. My first question is, with the addition of the 40,000 people that will be coming here, some already have, with Penn State opening, is it likely that the local case numbers will increase?
The very short answer is yes. We've discussed this at other board meetings. We've seen news reports from other university openings around the country. And yes, given the age band of the students coming in, given that it's 40,000, which is a quarter of the size of the community, the expectation is that by the last week of August, the first, second week of September, case numbers would probably go up. It's impossible to know when, because it all depends on us, our behavior, the students' behavior, how they interact with each other, and how well they adopt Penn State's guidelines for good hygiene and distancing practices. So it's impossible to say when, but it's almost a certainty that the cases will start to go up sometime.
Okay, that's helpful. Thank you. And my other question is a personal question for you. And this is something that many people have asked me to ask you. And so to be honest, it wasn't really my question, but because so many people have asked me, I thought that I would just go ahead and ask you, since as a board member, that's what we do. We represent the community. And the question is, will your kids be attending their school in person? That's the question.
So my wife is pregnant. We're having a baby in about 4 or 5 weeks. And in order to not introduce infection into our household, because we're going to have a neonate in the 3rd or 4th week of September, we've decided to keep our 2-year-old home for the year. And that's, I mean, that's our decision, at least for the next 4 months. I mean, we're not sure if we'll be able to enroll him in daycare in January if the situation changes, but this is what we've decided in my home.
Thank you.
Dan?
Maciek, it's a real pleasure seeing you again. Thank you for all of your help.
Thanks, Dan.
I really appreciate it. I just want to ask, first I want to thank you for bringing together, updating us in terms of the availability, almost not instantaneous, but within 48-hour availability of test results. Would you say that knowing the sources of those test results, one of the 3 sources, of course, is the test information regarding the student occurrence of the disease. Would you say that it's sufficiently similar? Would you say it's a sample, if you will, of this, that of all possible test results that the information we'll be getting can be considered a representative sample of all possible test results on any one day?
So Dan, I think your question is whether the test results that we'll be looking at, whether we can trust that the representative of the community. Is that your question?
That's correct.
So yeah, this is difficult because we know that Penn State students are likely to go to Penn State Health. we know that members of the community are more likely to go to our other two data sources, Geisinger and Mount Nittany. And part of the key in understanding how close we are to an outbreak at a school is understanding the age structure of the infection. So are they in 5-year-olds or 55-year-olds? And is it likely that we're 1 step away or 2 steps away from the school system? And also knowing whether they're part of a specific subpopulation. So we discussed some of these scenarios at previous board meetings, scenarios where a number might be a false alarm and it would not be an indication to close schools, or scenarios in the other direction where the numbers may not go up, but there's other information telling us that it's a good idea to close schools. So the short answer to Dan's question is that no, we don't have perfect representation of the community in the testing streams. So on a week-by-week basis, maybe even on a day-by-day basis, we'll have to qualitatively assess the data streams, whatever age information we have, and also information about outbreaks on campus, outbreaks at elderly care facilities. And these are going to help us assess and improve our own sort of situational awareness of where the virus is right now.
Great. And I apologize if I've asked that question before, because it has occurred to me. So, but no, thank you for clarifying that. Thank you.
Sure.
Laurel, I see your hand.
Thank you, and congratulations on the upcoming baby. Epidemiologists and you model things. And what I'm trying to get a sense of is if you were doing a model where you would expect that just by having more people here, even if they were not more contagious, if they were just duplicating our current pool, we'd still be low, but we'd have more cases. So what would be a number that you would expect just by adding 40,000 people versus what would be a number that you could model that would say we're heading towards an outbreak?
So there are answers to this question. So if you study epidemiology, you would know how to say add 20% to a population and describe how much the risk has increased. I don't think these textbook examples apply to our situation. And the reason is, and we've seen this since early March, that we respond to the epidemic and the epidemic responds to us. When there's an outbreak, people get scared. They also begin complying with distancing and hygiene measures better. And when cases go down, people relax, and sometimes they relax too much and cases go back up again. So I wouldn't put this under textbook epidemiology. The big uncertainty, and I'm sorry that I'm not going to be able to add any certainty today to this, but the big uncertainty is how the college-age population behaves in the first 2 or 3 weeks, and then how the next generation of contacts, the people that would be contacting them in the community, how good they are at distancing, mask wearing, monitoring their own symptoms, being considerate of others. So 50 to 70% of this is on us, our own behavior, our own hygiene, and our own distancing practices.
So I guess I have one more question, but just to say why I'm trying to figure this out is that if we just have an absolute number, it could be 1,000 cases, but if we have no sense of what we thought it might be, then how do we even know what a dangerous number is? So that's why I was trying to get from you some number that we could be looking towards.
Well,
we do have numbers in the plan, right?
Yeah, I mean, I can talk about dangerous numbers, and I would, just like Amber said, I would start with the plan. So Amber, do you want me to go to some of the bullet points in the plan?
That'd be great, thanks.
So the first incidence number, let me make sure I've got the most recent one here. The first incidence number is 80 to 120 cases in a 7-day period. So averaged over, so if we add up, sorry, not average, if we total, if we sum the number of cases over a 7-day period and we're in the 80 to 120 range, that's a decision point where we would want to consider closing schools. Above 120, we would close, below 80, we wouldn't, and in between, we would convene a meeting around it. So yes, the hollow bullet point beneath the black bullet point where the mouse cursor is, for those of you following the screen. But Laurel's question is also about, how can we be sure that this 120 is dangerous? And that's a fair question. It's a good question for, several different reasons. Most of them get back to the situational awareness and our own local knowledge of where these 120 cases are. If they're general community cases, then yes, this is a large number of cases. It's maybe 5 or 10 times higher than what we've been experiencing normally in Center County. So yes, it's certainly a time to be more vigilant. And is this a 100% definite turning point where if we wouldn't close schools, we would definitely have a major outbreak in schools? We can't say that. We can only say that this is a prudent and to some extent tested threshold based on what we've seen over the last 6 months that would be appropriate at this time to react to. So I think in March and April, if we looked back at states and schools, any place that saw a 5-fold or a 10-fold increase considered that enough, even though they didn't have certainty that it was going to be, that an outbreak was going to be imminent in about a week. Personally, in my experience in epidemiology, I think this is a pretty good threshold. We're still 5 or 10-fold away from it right now, which gives us some room to attempt to put in place good hygiene practices, good distancing practices, and attempts to keep levels low for a long time. And then once we get into that range, it's definitely worth considering a next action like closing schools. And Laurel had one other question, but now it's been lost in this bullet point. What was the second question?
The second one was about if we know anything about any of the results from Penn State's pre-testing of students getting here, and how and if we should consider that, or when we might get that information.
Yeah, so I don't, and Bob or Amber, have any of those results been shared with the school districts?
I was told we'd be that would be posted on their portal that they're producing for Thursday. I was in a conversation, at least with what results they've seen thus far, it was a positive as far as good. Now they did tell me, I believe it was 22 or 24,000 tests that were required of students from zip codes with higher levels of COVID presence in those communities, and that for students that tested positive, they were going to withhold those students from arriving to campus in the community. I don't know how they would do all that, but that's what my understanding. And I believe all this was published by the university, but I have not seen all that information. I assume it went out to parents, but that's my understanding, that we would have access to the results of those tests. I also do know from a family member who was moving in today, as well as Dr. Dross's family had somebody moving in, that they were doing testing today of all the students moving into the dorms as well. So hopefully we can see the results of both iterations that they're performing.
And one last thing, just to make sure I'm understanding, looking at the dashboard that I saw, it looked like currently we had 18 cases in the last 7 days. Is that the same number that we're saying we would get concerned if we saw 80 to 120?
So that, yeah, if that 18 rose to the 80 to 120 range, that's enough to warrant a meeting. And above 120, I think is time to take some level of action.
Okay, thank you.
Other questions from board members on this portion? So Maciek, one of my biggest concerns throughout this has been making sure that the testing data will consistently be fresh enough for us to make good decisions in time, so that if we see a spike, that we're not seeing a spike when test results come in, 7 to 10 days after individuals were tested, rather that we're seeing those test results, in that 24 hours to 36 hours, maybe range, or not 24 to 48 is what we're looking at, or maybe 3 days. I guess one of the questions I have is if we can just continue to monitor testing turnaround as part of this. And I know that's not a variable that's listed here, but it seems like that's something that would be really prudent to continue monitoring testing turnaround as part of our safety monitoring.
So
yes.
Amber, go ahead, Maciek. I know that I think before, in our agenda setting, I think that administration had shared a little bit, and maybe Amber, you hadn't joined us yet, that there were some relationships built with people at Mount Nittany, people at Geisinger. My understanding is a lot of Penn State Health, which serves the community, not the students, is sending a lot of their tests, majority through Mount Nittany's processing center now, which hadn't always been the case in the past. And we talked about that very issue as being something that we would want to keep tabs on, because I shared your same concern about the timeliness of the data that we're using to make decisions. And while this is really positive and favorable to hear that turnaround time has improved this much in the recent past, we know that there could be higher demands through the fall on testing materials and reagents and other things. And so tests themselves or reagents or the increase in testing in our community could certainly create a situation where our data becomes less fresh. And so I agree with you. It's really critical that we maintain those communication steps with those entities to know whether that's the case.
Yes, that's right. And part of Amy and Amber's questions and comments go to this point about whether we would want to consider any action if we find out that all the test turnaround times have gone from 2 days to 7 days. So in another part of the bullet points of the action plan, the triggers, what would cause us to take some action, there's some flexibility built in, and it's certainly worth a discussion. If we're at a point where case numbers have increased modestly, but we have also been told that all of the testing results are delayed by 7 days, then yes, I would recommend having a discussion about that the day of or the next day, as soon as it's possible.
That seems prudent, because clearly you would look at the case numbers in a different light if you were also dealing with testing delays.
That's correct.
Okay. Other questions from board members? All right, Maciek, is there anything that we didn't ask about that you think we should have?
Well, I think we've had a number of conversations on risk mitigation measures. So Bob and Amber, I mean, we've had conversations about viewing the worst types of outcomes, the second worst types of outcomes, and seeing if we could categorize and define the biggest risks and see what we could do to mitigate or just lower the probability of occurrence of some of those biggest risks. So is this a conversation that you want to have at this stage? Or is this in one of the items that you've got on the agenda today?
Maybe during action item A, would that be? Because that's the health and safety plan.
We've kind of been there, and we jumped over to there to the closing guidelines, but we didn't get into the full safety plan unless you want to do that now. I think if we check the box on this, move through routine approvals, will be there within a minute or two, depending on how many questions on routine approvals.
Okay, so I'll follow your lead on the agenda then.
Okay, so those questions, yeah, those would, any input there would be really helpful under the health and safety plan item. Okay, all right, so we'll look back at our agenda. So Bob, is that it for the superintendent's update portion?
Yes, that's all I have, thanks.
Okay. Legislative update. Do we have anything in a legislative update?
We have a meeting this week. I will fill you in next time.
Great. Gretchen, is there a COG report?
There is not. They have not met since our last meeting.
Okay, thank you. Okay, at this time on the agenda, we have time for public comment, but I would ask just respectfully that anyone who would like to make a comment on items on this agenda, please hold your public comment until we reach that item. So we have a number of action items, and I think most of the people who are here this evening that want to make a public comment are here to make a public comment on the action items. So if your comment is on something that is not on our agenda this evening, I'm going to just repeat that. If your comment is on something not on our board's agenda this evening, an item or topic that's not on our agenda for tonight, we'll take those comments now during public comment. I see Mary Ellen Worth's hand raised. And if you could unmute yourself. And then introduce yourself and where you reside in the district. Okay, I think her hand went down. I see someone whose name is Robert, hand raised. And Robert, if you could unmute yourself. And again, this would be public comments related to items not on our agenda this evening.
Okay, excuse me? Am I coming through?
Hi, Robert, I can hear you.
Okay, I just want to, really, I was getting really no reassurances on the health of our students, our children. It's all about, numbers. If it gets to a certain number, if this or that, and we're taking a chance on our children going back to school, and it's almost like Russian roulette. If they go back and little 7-year-olds are following social distancing and that kind of thing, then everything will be okay. But really, there's really no reassurances that the kids are going to be safe. And if you've got a little 7-year-old grandchild or 8-year-old grandchild, that's pretty hard to, it's pretty hard to hear that we're just going to have so many cases before we do something.
Thank you.
And someone, and I will ask this question. Someone asked the question the other day, if it's important that we have these meetings, over Zoom, if someone could answer this for me, why is it so important to have these meetings in Zoom, but our kids are going to be going back to school face to face? If I could definitely have an answer on that, I'd appreciate it.
Sir, I will answer your question on that. The state of Pennsylvania has guidelines for the number of people allowed in gatherings. And those guidelines for indoor gatherings are much smaller than the number of people in attendance at our meeting this evening. We have about over 700 people here this evening. So we wouldn't even be able to fit that many people in our boardroom. So this provides more accessibility for the community to attend. Okay, I'm just going to remind again, this would be time for public comments on any items that are not in front of the board this evening or related to items on our agenda this evening. And the health and safety plan is on the agenda. School closure guidelines, how we would make those decisions are all on this agenda this evening. So we will be discussing those later and having votes on those items. And so if anyone would like to make a public comment that is on an item not related to the agenda. Fred Daly, if you could unmute yourself and introduce yourself. Okay. All right, I think I'm going to assume the rest of the public comments are for items on the agenda, and there will be ample public comment time later. Okay, with that, I would like a motion to approve routine approval. Oh, yes?
Just one thing. Answering the gentleman's question, are we not also still encouraging, whenever possible, that all adult-to-adult meetings be held virtually?
Yeah, my assumption is the school district is not opting to put very many adults into a room at one time.
Yeah.
Functions that can be fulfilled virtually are being fulfilled virtually.
That's worded better. Thank you very much.
Okay.
Correct.
Okay. Okay, is there a motion to approve the routine approvals as presented on the agenda?
Peter, so moved.
Okay, that's been moved and seconded. Any comments or questions on the routine approvals? Okay, Laurel.
Thank you. I just wanted to check at this point with school opening in a week. We have a human resource report. Are we at pretty much complete full hiring?
I don't believe so, from what I understand. Linda? You're on mute.
And I'm not asking for a specific, just a general, because always there are things that come along. I'm just trying to get a general sense.
We are very close. I believe we might have 2 outstanding positions. It's 1 or 2. We're very close to being fully staffed.
Thank you.
Okay. Any other questions on routine approvals? Okay, we'll have a roll call vote then.
Mr. Fazzard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy.
Yes.
Okay, so that item has passed. Under action items, item A is the 2020-2021 Health and Safety Plan as updated on the agenda.
Bedell, so moved.
Leah, second.
Okay, that's been moved and seconded. And I'll let Dr. O'Donnell introduce this portion of the agenda. We have Jean Canals and Maciek Boney here from the safety team as well.
You bet. And Maciek already started walking through the memo and the markers that we included. We also did refine some of the flexibility markers down below, or variables, I should say, just because we believe that gives us some flexibility. We also included what we received following our work session with you on Thursday from the Department of Health. It was procedures that they shared with us, and we added those to that list, and we would gladly walk you through those. It pertains to if there is the presence of a positive case in a building, and it has ranges. But you can see that was included in the memo as well. And we'd be happy to answer any questions about those or any of the other variables that are down below. But since Maciek is here, I believe he walked through the key information at the top of the memo where we have those markers. So I'll turn it over to the board to see if you have any questions regarding what we've added. These are the key changes that we would use as a part of the plan. Thank you.
Board members, any upfront questions then?
I have a question about the materials, I guess. The safety plan itself, I think, has some language that predates tonight's meeting. It predates the memo. It's the information in the safety plan corresponds to the information that was presented last week. Let me take a look at it so I'm sure I'm barking up the right tree here. But on page, well, on the memo itself, it's going to be the section regarding the parameters at the bottom of the first page, where it introduces the case counts and talks about the positivity rate. Those figures were adjusted based on our conversation at last week's work session. And in the safety plan on page 3 in red, we have the previous criteria, the previous cut points, or the cut points that we had been considering as of the middle of last week. So it's just a matter, I think, of making sure that the content in the safety plan on page 3 aligns with the content of the memo.
I just actually saw that, Dan, and had struck through that and said will be corrected once we choose the marked and dated tonight. So thank you.
It's okay. Thank you. I should have mentioned it today, Jean, but I didn't see it till late. Too late to get in touch with you. Thank you.
Sure.
Okay, Gretchen.
Yeah, thanks. I have a couple questions. One is I saw that the percentage, I think it's moving average, we had discussed in for positive cases, we had discussed in the last work session, it was at 10%, and then several people had suggested 5%, and then I see in the current safety plan that it says 5 to 7.5%. And I'm wondering what happens at 5, what happens at 6, what happens at 7. I hadn't understood until I saw the draft for tonight that there would be a range rather than the number that I thought we had come to a consensus on at the last work session, which was 5%. So that was my first question. Thank you.
Thanks. I think that's a good point to have a discussion around this. Maciek, do you have thoughts on how to make sense of what percent positivity number and how how you would use that number in conjunction with other variables?
Sure. So last week we discussed that we would use these ranges as a sort of middle point where we would definitely call a meeting to discuss whether there was any action necessary. So below 5%, no action necessary. Above 7.5%, some action should be taken. And then in that range, if we see a 6%, then we take some of the other numbers into account. Certainly the absolute case numbers. So the percentages don't tell you how many cases there are in Center County, just what percent have tested positive recently. So if you saw 6%, but 150 cases or 100 cases in the last 7 days, that would be concerning. But if you saw 6%, but only 30 cases in the last 7 days, that would tell you that testing had increased a lot, that the percentages were low, and that the actual number of cases in the community was not very high. So that was my understanding of how we would treat these ranges.
I understood those ranges gave some flexibility to the safety team as we work through what we're seeing with the context and details. But if the board wants to have a clear-cut number, then that can be, obviously that's the direction we'll go. I didn't know there was consensus on that number.
Yeah, and I'll just chime in. Several times during the discussion last week, I suggested using a range as being, frankly, a more pragmatic and flexible way to deal with reality. Because one number, having in my previous position, in my previous professional role, the information you gather about humans, whether it's biological or otherwise, falls within ranges. If you get test results back from your physician, you'll see a range, what's considered normal and less normal. So I think providing a range within which to work makes sense clinically and also educationally.
Okay.
And another reason I think we built some of the flexibility in, which is where the ranges come from, is what we've discussed the number of conversations today, is the unpredictability of the whole thing. So we don't know if it's going to come from a group of teenagers, a group of undergrads, the northern part of Center County, the western part of Center County, in one subpopulation or in another. And being able to assess all this information in real time as quickly as we can, I think would allow us to make the most informed decision. So we try to preserve a little bit of flexibility to account for the how unpredictable this next phase is going to look.
I do feel like that's helpful to hear that as this is one variable among numerous variables, and the ways that each variable is moving affect how you would interpret the other variables. And so having somebody with your expertise to help us sort through that, I think is really critical. Gretchen?
Yeah, I had a couple questions for Ed. So just because indoor air ventilation is so important in preventing the infection rates for COVID-19, I wanted to ask a couple questions about the air ventilation. And so the air exchange rate quantifies the number of times the air inside a building gets replaced with air from outside in an hour. And I'm wondering, Ed, what is the air exchange rate for our classrooms?
I can't answer that question off the top of my head, Gretchen. It would vary depending on a lot of factors, including the type of system. We have some buildings with unit ventilators, some buildings with heat pumps, year of construction, design criteria at the time. We're working hard to maximize the amount of air changes, and we have been successful with our engineering team and our automatic temperature control vendors to work on changing programming, opening dampers to the maximum amount possible, and running our systems 24 hours a day, 7 days a week to flush the buildings, as well as introduce as much outside air as possible. I'd have to do some research to give you accurate numbers on air changes, and it would vary by building.
Okay, yeah, and the reason I asked is because the research shows that, I mean, the exact rate depends on the number of people and the size of the room, but most experts consider roughly 6 air changes an hour to be good for a 10 by 10 foot room with 3 to 4 people. Obviously, our rooms are bigger than that with more people. And in a pandemic, this should be higher. So I was curious what that air exchange rate is. And then the second question I had for you, Ed, is that a well-ventilated room will have around 800 parts per million of CO2. What are the CO2 rates for our classrooms?
So in our older buildings, when I say older, I'm talking about from the early 2000s and earlier, such as Park Forest Middle, Mount Nittany Middle. We do not have CO2 monitors. Our newer buildings that do have CO2 monitors, interestingly enough, the way those buildings were designed were to use the CO2 monitors to adjust the amount of outside airflow. So the CO2 monitor would, in essence, restrict or increase the amount of outside airflow in response to the CO2 level. In our work, what we're doing is basically overriding the CO2 monitors to increase beyond the recommended CO2 levels to make it better than a CO2 monitor would generate. So typically a CO2 monitor would say you're introducing too much outside air based on our CO2 levels, so scale back to save energy. So we're actually overriding our CO2 monitors to maximize the amount of outside air. Again, I can't quote. I can give you the concept there and assure you that we're using that as an advantage with our new systems. But off the top of my head, I can't quote exact figures.
Okay, and just to clarify, the reason why I'm asking those questions is because, again, if we knew those numbers and they were safe, like if we had an air exchange rate of 9 times per hour, and if we knew that the classrooms had a CO2 rate of 800 parts per million or lower, then if I knew those numbers for certain, then I would feel extremely safe in terms of both teachers, staff, students. I could sleep at night knowing that, you know, we were ventilating, because this is obviously, we know how COVID spreads the best. The infections come through the air more than any other source. So that's why I was really focusing in on, you know, what are the measurements? Because if we knew the measurements, then we would know if it's safe. It sounds like we don't know the measurements, and so that's helpful.
No, Gretchen, I'm sorry to interrupt, Gretchen. I don't characterize my answer as being we don't know. I'm just telling you tonight, I don't have those numbers memorized, nor do I have them at my fingertips. I think in most cases we could generate those numbers.
Oh, great.
I have them off the top of my head tonight. And
okay, that's great. I wasn't understanding. I'm sorry.
Yeah, I'll also say that we can give you our measurable numbers. You know, considering those are numbers being delivered by the system itself. The actual performance would improve because of the amount of windows we'll be able to open. So opening windows would also increase the exchanges. So whatever number there is, we do better than the calculated number.
Okay, yeah. So if there's a way to get those numbers, then I misunderstood your first answer. I thought we didn't know, but if there's a way to get the answers, then that would be very helpful. So again, I'm one of 9, so other board members would have to also want those numbers, but I would support getting those answers. And then my last question is, I was looking at the HEPA filters that are in the safety plan and for rooms that don't have the possibility of air ventilation through windows and doors. And I'm wondering, do we know yet, are all of the rooms and areas in the schools, because not all the schools have areas that are classrooms, but they're spaces. So that's why I'm posing that question with both of those in there. Will those rooms and spaces that need HEPA filters, will they have them? Will they be installed and in use on August 25th in all rooms and all spaces in all buildings?
I'd say with a slight asterisk that the answer to that question is yes. We do have the units in hand. We're working on distributing them. We're putting them in place. We have large units in places like gyms that typically don't have outside windows. Again, most of our classrooms do have outside windows, and our systems do deliver outside air. But as an extra precaution, we're deploying these units currently, and I believe they will be in place by the end of the week.
Okay, and if that's great, and ideally that will happen. Air ventilation is a possibility. Will the students be notified of that prior to entering into those spaces on August 25th? If that happens?
Gretchen, you froze, and I don't think we could hear most
of your sentence.
Oh, can you hear me now?
Yep, we can hear you now.
Okay, sorry about that. So my question was, if there are, ideally there will be, and hopefully there will be, we all hope that very much, that all the HEPA filters will be there. If by chance they're not there on August 25th, will students be notified ahead of time so that they know they'll be entering spaces where there's not air filtration in the space or the room? Will they be notified ahead of time?
I don't have a plan to do that. In my role as the facility director, I could tell you that these are, I think we've all along considered these as supplemental units, in that we are supplying outside air to every space. As to whether we're going to create some kind of a system that notifies people if there's something not in place, that's not something I prepared. So I defer to others if there's a desire to create some kind of a system like that.
Okay, those were all my questions. Thank you.
Scott, I see your hand raised.
Yeah, so my recollection, and apologize if I'm wrong in this, was that we discussed a number of different numbers, percentages, numbers otherwise, in the work session, but I don't think we had consensus per se on any one number. I do appreciate the range. I personally would prefer to see it match the state's guidelines, if for no other reason, because it's easy to say we've matched the state guidelines. If we haven't matched the state guidelines, then I feel that we kind of need some explanation as to why we felt the state guidelines weren't appropriate, whether they're too high, too low. But I'm certainly not going to be a stickler on that item. I do, however, think it's really important to maintain a range, because as has been mentioned once or twice, the range gives flexibility, and it allows Maciek and Bob and the safety team and everyone else to react to changing situations. So, I definitely, I would like to see it match the state range, but I think having a range in the first place is just absolutely critical. Because the other thing is, we could say that the range is at 10%, and that doesn't preclude us from doing something at a lower level. It just says that we have up to this point before we are quote unquote required to close. We can close before that based on other data, but we're not required to. We're flexible, we're able to make decisions. So that's why I would favor that higher point in the range if possible. Thanks.
I'll just address one question quickly. Amber, am I allowed to interrupt?
Absolutely. Go ahead. Yep. You're here.
So we are a little bit more conservative than the state guidelines right now. So we've taken their 5 to 10% and we made it 5 to 7.5%. And then for the 80 to 120, I don't remember what it was, but we can check to make sure, but I'm pretty sure that we lowered it to allow us to close earlier. So in that sense, we are compliant with the state guidelines and we're a little bit more conservative. So in other words, compliant and then some with the state recommendations.
I think the 80 to 120 captures up to the 75th percentile of the state guidelines. So the idea, I think, is that we want to make sure that we have some trigger points for serious discussions that are conservative rather than at the higher end of the guidelines. I would be concerned about putting the 10% number in there personally, because I think that when we've seen states where they have 10% positivity rates in their testing numbers, they're in really severe situations.
That's right.
I think the challenge, when we started with how we would close, we had variables in there and we developed those with Matt Ferrari and then with Maciek to give us flexibility to really understand in real time what's happening and make the decision. But I think board members wanted to have more specific markers. So this is kind of a blend of more specific markers using the Department of Health information and then having some of those variables still in there to give us some flexibility as a team to make quick decisions and not have to advertise and wait for a board meeting. But I do think the 10%, what we had discussed, and it's not in here, we would want to visit that with you at a later time, is after we close schools, if we're closing buildings, we would like to have support centers in place if below 10%. That was a discussion. It was not polled or anything with the board, but that's my recollection of that part of the conversation.
I remember that because I think one of the things we talked about was making sure that we don't wait so long to close schools, that we're not in a position as a community to be able to have those support centers.
Just to make everyone aware that the support centers would take planning. We would need 2 to 3 weeks to plan that out. We aren't able to plan those out right now with everything happening in the district.
I missed what was said there. Something with support centers. I'm sorry, I missed. It got garbled.
Sure. Well, right now, 7.5 to 10%. It's not in the document. We'd want to revisit it. We would propose having schools open as support centers for specific students, including special education programs. It'd be obviously less students in the buildings, but we'd be able to better manage a stricter safety plan.
So the idea that we've left ourselves some space there with these guidelines. Laurel, did you have, I see your hand is still raised. Did you have other questions at this time?
Yes, I thought others were before me though, but.
I can see the order in which the hands are up, so.
Oh, okay, thanks. Mine is always at the top on my list, so. Couple of questions. This one is probably for Ed. We had back in May ordered a bunch of electrostatic sprayers. Have they all arrived?
Oh, Ed, you're on mute.
Sorry. They have not arrived. We are prepared to disinfect with other equipment, but the electrostatic sprayers have been on continual back order since the time they've been ordered, and they have not yet been received.
But you do have sufficient supplies of disinfectant and other ways of
Yes.
accomplishing the same thing?
Yes, we are prepared to disinfect every building every night with other means of equipment.
Thank you. Then another thing, and this regards the ranges we've talked about, and I do want to revisit them, but I think it would be I like the idea of a range for flexibility. I also think we could develop a flow chart that basically said, if it hits this, then we look at this. I use my hands a lot. It's harder on a Zoom screen. If we hit here, we'll look at this or we'll look at this. And that would really help both for us and for the community define what we're doing. So it's not just a range. I would find that very helpful. I can't draw it right now, but I am requesting that some way that more clearly delineates how these ranges work would be very helpful.
I can speak to Laurel's point. If Laurel, do you want an answer to?
Yeah, anytime.
So one of the difficulties is when you start outlining case scenarios, you're almost guaranteed to find yourself in some scenario that you haven't outlined. And we definitely found ourselves in this position in March and April. And the second big challenge with outlining this what if scheme or a grid or a decision matrix is that there's a lot of missing data. You'd like to have 8 data points in your decision matrix, and it turns out you only have 3 because 5 of them haven't been reporting for the last 4 days. So currently we have no % positive from Mount Nittany. We have no % positive from Penn State. We have only % positive from Geisinger. We have the Center County numbers, and we have 1 day of data for the zip codes that we care about. So we're at sort of 50 to 60%, maybe even 70% data missingness right now, which is one of the reasons that we need some of this flexibility. And of course, if all the data goes missing, it's appropriate to take a conservative and precautionary approach and take some action.
Mm-hmm. Macha, can I have you clarify something? If we're at 75%, the 7.5%, what's the likelihood in the time frame that we would be at 10?
Well, in a college environment, and if testing is representative, if we saw a scale up that went 3, 5, 7 over 3 days, then as you can imagine, it's completely expected that it would go 9% the next day. There's no reason that it couldn't. And it could drop back down to 5% because maybe it was just an accident that 1 day the percentage was a little bit high. So the answer to Jean's question, how quickly could it go to 10? It could go to 10 in 1 or 2 days. And these things do happen. Outbreaks can be sudden and they can catch people off guard, and that might happen to us. It might not, but we should be prepared and watch the data every day.
Mm-hmm. Yeah, and that's why I think keeping that slightly lower range in there. Amy?
Yeah, I just wanted to clarify because Amber and I worked together a little bit to set up some of those ranges after the smattering of different feedback from the previous board meeting. Because there was some that felt the lower limit was a potential hard line. Others talked about a range. And certainly the state was in that 5 to 10% range. And so the reason we picked a lower shift was, one, out of respect for board members who were preferencing to that lower range, but also really fundamentally because the state's ranges are written in a wide range to try and cover for the whole state. And so we want to pick a range that's relevant to I feel we should pick a range that's relevant to our community. And our community has some unique issues because we are a college town, because we will have 30 to 40,000 new members of our community over the next couple weeks, because those members may or may not subscribe wholly to mitigation efforts of mask wearing and minimal gatherings. So for those reasons, we felt like the state's ranges, the upper limits of their range were probably more relevant for smaller rural communities and more appropriate, that may be more reflective and appropriate. Whereas our community, which may have some more transientness, growth in the community and other things, it felt much more appropriate to be at that lower range. So that's kind of how we came up with some of those numbers and why I support those numbers. And I think to echo what Maciek said in regards to having some kind of matrix, or this is not something we can plot out. There's too much variability. I think we as a board have already pushed for putting these thresholds in place, which, I think there's some hesitancy to do initially because it takes away some flexibility. So that's why I feel most comfortable with ranges, most comfortable with putting a lot of that decision making on our team, and then bringing, really monumental changes potentially to us to a board if that's necessary. So thanks.
Any other questions? Maciek, you mentioned wanting to speak a bit to our mitigation measures.
Yeah, risk issues. So we've had a number of conversations about closing schools, and we haven't appropriately discussed why we're doing that and what the risks are that we're mitigating. So what are the outcomes that we're trying to avoid? Will closing schools achieve those? Will opening schools achieve another outcome that we're trying to avoid? And these, I mean, they fall into two broad categories from what I could tell from the maybe a couple dozen commenters we had at the beginning of this meeting. And they are the most extreme risks for students when schools are closed, and the most extreme risks for staff when schools are open. So these seem to be the two risk categories that we should probably discuss. And there were a few comments as part of the meeting, and also comments that were called in about the children, about school being about educating children, about keeping children safe and making sure there are no adverse health effects due to coronavirus for children. And I don't think this ends up on our list of largest risks that we want to mitigate. Children don't progress to severe disease very often. There have been no child deaths in Pennsylvania at all during this epidemic. And the immune complications that we've seen in some children so far seem to be rare. So the negative, whether it's mental health or abuse or addiction, the negative effects of staying home seem to be the largest risks to children. And then contraction of the virus, which is at that point irreversible, seems to be the largest risk to staff. So if there's a way to categorize these and to come up with some creative solutions, this would be the best to mitigate both risks simultaneously. That would be terrific. It may end up being a win-win for a lot of people that were on this call. So any comments on that approach or the framing? Is that wrong? Does the board not want a discussion around that?
Dan? Oops, I'm sorry. Oh, Dan, you're on mute.
Agree with me here. Here we go.
There you go.
Maciek, thank you for bringing that. That's a public health perspective you're bringing to it. It sounds like you're weighing kind of larger global impacts, the social impacts on young people by being excluded from school, but then there are medical risks for the adults involved. But you're weighing one set of costs versus the other, and I think that's an important perspective to take, given the upcoming vote we're going to have on these issues, whether we're going to agree to like a opening and then closing experience, or a total closing, or whatever. But the bottom line is that basically going to remote and removing kids from the typical age-appropriate experiences, developmental experiences that they would normally have, generates a cost on several levels. So I just want to agree with that idea. Another piece to this, I think that's worth mentioning, that I would react to, is the comments that were made by you and by the physicians in the meeting last Thursday, the town hall they had with the staff. And one of the things that came through loud and clear through that was the confidence that you expressed, and also that the physicians expressed, in the impact of these mitigation strategies when they're adhered to consistently. That, if you're doing it the right way on an ongoing basis, in a way that, yeah, you should be thinking about it, but that the risks, it really reduces the risk significantly to the adults in the system. So if we're doing these mitigation things consistently, our adult staff would be less likely to be at risk, at least through their school environment experience. So those are the thoughts that occur to me on this, given the kinds of things that were talked about last week. And it really gave me hearing the comments made by the medical and in your case, the academic staff, just gave me a lot of confidence about the safety plan that we have in place and how effective it can be if it is implemented consistently.
So, yep, that's everything Dan said is true. And when we did express these opinions at past meetings, it is true that with mask wearing, distancing, hygiene, you can mitigate, suppress an epidemic. You can keep transmission levels low such that risks are very low. And we did all express confidence in this. And I still think we do have confidence in it, especially because we've seen how good our community has been at this over the last 4 or 5 months. So that's a population perspective. That's like saying that in a school system of several thousand individuals, so say 10,000 staff and students, am I sort of in the ballpark with that number?
Well, staff and students together, what, total 9,000 maybe?
9,000 staff and students. So at a population level, we're keeping risk low. And then at an individual level, individuals make different decisions based on their own risk. So a special needs child, their parent will make an individual risk assessment and send or not send their child to school for some reason. And then a staff member, a teacher, or a parent of another student may also make an individual decision that's best for them. So it's not that these types of risk decisions conflict, but they're just not always the same. And even though I do have full confidence in the population level measures, I still think it's appropriate, in addition to the population level measures, to discuss some additional individual level risk reduction measures.
So particularly for those who are most vulnerable.
Yes, a special needs child or a 67-year-old bus driver. So if there's additional individual level risk mitigation that we can help with for these 2 individuals and other individuals like them, then that's a good thing. We should do the population side first to make sure risk is low for everyone, and then see if on an individual level we can help some of these other groups that will be at a disadvantage, individuals at a disadvantage.
Right.
And to follow, to follow on that comment, I'm thinking that, so wouldn't age alone for the bus driver, for example, them be they're in the later 60s or 70 or older, they're in a risk group that would suggest that they could get some accommodations, if you will, physically through a plexiglass shield or whatever, that would help limit their contact with perhaps some of the kids coming and going from the bus, for example. But they wouldn't necessarily, other than their age, necessarily have to have a diagnosis, other than the fact that they were just in a particular age group due to their chronological, a risk group due to their chronological age.
Yes, that's right. So if we don't know anything else about this 67-year-old individual, then they are in a risk group because of their age, and this is now a part of the entire logistics of the school day, where you would want to take every possible precautionary measure. So the school buses today still have that little square yellow door in the back that has a red handle on it.
Yes.
Yes.
So maybe they should board the bus from the back, and maybe there should be a plexiglass separator that separates the bus driver completely from the kids.
The state looked at that. The state looked at that and wouldn't allow it. Yeah, the state, actually, there were appeals about plexiglass for bus drivers to PennDOT, and they said without evidence that it would increase safety and with concerns about it potentially posing unknown risks, they would not permit that to safely be added to buses. And I think the emergency exit door is too tall for a lot of elementary students to get into. So we brought up those questions. And so loading from the back of the bus is problematic in terms of access.
But it could be something as simple as an N95 mask, let's say.
Yes, and
the driver.
For the driver, right, for the driver, right.
Jean, do you want to share what we currently have planned for those individuals?
Yep. Yeah, and that is the only mitigation measure we can provide. And we do have N95 masks for them, and we're offering them to them.
In the 6 feet piece, other than when students are boarding and
all of our buses, the students will be 6 feet from the bus driver. In some spaces, the buses will have up to 24 kids, which will leave the WHO recommendation of 3 feet. But there are cases where we are even 6 feet between kids. Thanks.
And can the first 2 seats of the bus be empty?
Yes. Yes, that's where we get our 6 feet behind the bus driver. There's physical distance there. Mhm.
And that's because we had so many parents who helped us out by volunteering to transport their students.
So helpful. And windows open whenever they can, right, Jean? That the buses have the ability to open windows.
Correct. And the buses are clean between runs.
Maciek, do you think would the priority be if we had to choose between space between students and the driver, would you choose space between students and the driver?
Yes, space between students and the driver.
Makes sense.
Yeah. I mean, an outbreak that gets into the 6 to 10-year-old population. This is an outbreak that puts the bus driver and another staff member that is of a certain age or has a certain pre-existing condition. That outbreak puts those individuals at risk.
Yeah. Laurel, I see your hand.
Thanks. Is there such a thing as the term I've used is a major exposure, you know, a child actually, or someone coughs in your face, something that suddenly makes you much more vulnerable? And if there is, do we have protocols for instance, if you can rinse your eyes out or wash your hands? I'm thinking back to the first days of AIDS where they talked about this concept.
I mean, I would immediately wash my face. If somebody coughed on it, I would wash out my eyes. And that reduces your chance of getting an infection. But exposures like that are risky. They're not, so these are no longer, you know, touching a doorknob and not touching your face type exposures. These are sort of high volume, large number of aerosol, very risky exposures. So I had a conversation with one of the teachers about face shields. Face shields are items that prevent these types of high risk exposures. And I was told that there are some teachers in certain classrooms that would be wearing them. So if the classroom and the students and the teachers can accommodate face shields, then that's another risk reduction measure and it's a good idea.
That was one of my questions for you as well, was about that. And for the Ed or whoever would answer our supply question. But should there be a protocol or some, now I'm asking the board, in our health and safety plan, should that be written in there somewhere that if one of these events happens, this is what should follow from that? And I was also wondering, and with that, about eye washing stations. Is that something that would be worth having?
Brandon mentioned we do have. I'm sorry, Jane.
Our nurse's office do have the eye washing stations.
Okay, thank you.
And Joy and Allison will really know the answers here because as part of their medical training, they've been through these protocols. So I know about them from textbooks, but they know about them from practice. So that I think they would be the right ones to help with this.
It probably makes sense to codify what that advice would be. Hopefully we don't have those kinds of exposures, but to know what to do immediately. Gee, I'm not sure if some of that may be in the plan, but we talk about frequent hand washing or hand washing after touching, any chance when you have to touch a student.
We can put it in the plan if we think that needs to go in there more explicitly. I would think it falls under universal precautions, which is something we do every year. Whenever you're exposed to any bodily fluids, what you're supposed to do and the action you're supposed to take, and that's part of our training plan, and it is in our COVID faculty presentation.
To the supply question, we have nearly 1,000 face shields on hand and have more ordered.
Right.
It's more than the number of staff, or is it not?
More than the number of faculty, absolutely. But I think to Maciek's point of prioritizing for our high risk employees and students, you know, that was our plan to prioritize the face shield.
Mm-hmm.
High risk and also positions that they are working in at the time.
Talked about lunch pairs at one of the meetings.
Right.
Yeah.
Then also, this sort of relates to the bus driver question. do we have, and I don't know whether, so it's hard to know whether something belongs here in this plan or as an addendum or in a handbook. But the other question I had is about protocols for people who go home to particularly risky, vulnerable people at home. What should they do when they get home to help?
If you've had an exposure.
Well, or, you know, a teacher works all day with a bunch of students and does everything she can to, or he can. But I know that I read with doctors that they may, you know, shower immediately. What I'm just trying to get a sense of this, because the healthier they stay, they go home, those people stay healthier, they come back. And that's why I felt it was appropriate to understand in this context.
Well, I mean, the answer is distancing, but it's very difficult inside a household. So it just depends what your household looks like and who's the at-risk person and who the exposed person is. If you're 30 and you live with a 65-year-old and you've been exposed and you yourself are 30 years old, then is it appropriate to stay away from that person for as long as you can, 2 weeks if possible, and to, you know, sleep on the couch if you have to? Yes. That's an appropriate measure. But this is not going to be possible in a lot of cases. This is one of the reasons that risk mitigation needs to take place everywhere, because in some instances, 2 people sleeping in the same bedroom, I mean, it's nearly impossible.
Yeah, I guess I was looking for that in between of what extra risk mitigation you would recommend.
Obsessive hand washing.
Same stuff, okay.
Yep. All the same stuff that we've always talked about. Every single step, at this stage, every single step that you can take is a good step.
Okay.
Lori?
Just a super practical idea. This was mentioned to me by a very smart person I know. Lunchtime, we've got kids without masks on. That's a high risk situation for paras monitoring those lunch periods. Is it possible that we get giant tents for kids to go outside under, as long as the weather is warm enough for them to be eating, and then we cover for rain, we cover for bright sun, and they're outside and unmasked? Is that reasonable, or is that over the top?
I think
it's not something that we've planned for at this point in time.
But we have planned for them eating outside, but the inclement weather concern.
It's different at different schools with how we staff and supervision of lunchtime. I mean, obviously at the high school with the outdoor seating in the courtyard area, it's built into their lunchtime opportunity.
Yeah, I feel less concerned about the high school kids than I do like middle school or elementary school. Because there will be paras around those kids as they're eating indoors. And yeah, that's all. I thought it was a smart idea to get them outside as much as possible and under safe circumstances when they're not wearing their masks.
Mm-hmm. I don't know how available such tents are. I do think it would be, yeah. I mean, obviously we're looking at starting school next week, but you know, hopefully we have better weather in the next few weeks than we will.
Yeah.
Forward.
Sure.
But it's a concern that we can't always have the staff to monitor students outdoors during that time period. Okay. All right.
Can you just clarify that, Amber? Because if we have the staff watching them in the room, why couldn't they watch them eating outside as well?
That's what I was trying to understand.
I don't know the answer to that. It won't be the teacher, be paraprofessionals, and I'm not sure the ratios and timeframes. So I would defer to Vern and the elementary staff. Because you're asking a question about a lunchtime procedure, and I think it's going to vary in different schools and what the weather is on a certain day. And we have the students spaced out at least 6 feet for when they do eat lunch, and that's in the plan. As far as how frequently will they be eating lunch outside, I don't know if Vern or Deirdre or any of those guys have for K-5, if they have any information they'd want to share or not.
Hey, Bob, it's Deirdre. We can certainly take the kids outside, weather permitting. We've talked a little bit about the tents that, I forget, was it Amber who brought that up as a board member? Because of the shade with it being, pretty hot in September. So depending on the grounds and if there's a shaded area for kids to eat lunch, that certainly is something viable to get outside. And again, we can definitely keep them 6 feet apart in the classrooms because we've put the desks that way. We're gonna have to do a lot of work to teach kids to be 6 feet away, maskless outside. So although lunch outside has some advantages, there are also some disadvantages of making sure that we have ways to keep them 6 feet apart, whereas in the classroom, the desk automatically does that for you.
So then it becomes a risk balancing question, whether it's more risky to be in a classroom unmasked and in that classroom that they will need to be in later in the day too. So everyone's breathing in that classroom then.
Right, and we're trying to keep the windows open as well and the doors open so that there's a cross breeze plus the air conditioning's on, trying to consider all the aspects of the safety plan that's been put in place.
Okay. Laurel, did I see your hand was raised?
That was just, you made the point about the other risk factor being in the classroom for the remainder of the day. That came up, it may have been at the town hall.
Town hall. Mm-hmm.
But it was a concern and I can't remember, I'm sorry, Dr. Adams maybe did express that as a concern for the rest of the day. So that's the other reason. And again, what goes into the health and safety plan versus into the handbook, I'm not sure. And everything is always on as much as possible. But if that could be a goal, that would probably be helpful. That would definitely be helpful.
I guess I'd like to sort of circle back to Maciek's comment regarding how well we're able to mitigate risk for those who are most vulnerable to the virus. And I think maybe our standards for keeping schools opened or closed need to realistically reflect the ability that we have to shield those people from exposure when we do have schools open. And when we're considering school closure guidelines, obviously as part of this agenda. And I think there's an enormous amount of, there's risk that is baked into having schools open because staffing schools automatically has to involve having adults with children, from throughout the entire community. The extent to which we are or are not able to mitigate risks for those who are most vulnerable probably needs to affect how sensitive we are to looking at community spread in our community and rising case levels. And when we think about things like 5% versus 7.5%, or maybe if we're not able to mitigate risk well enough within our schools for those who are most vulnerable, then I think we need to be really sensitive to increasing case numbers in the community because that's kind of where we're able to improve that safety measure.
And I'll say, while people are thinking what to add, I mean, I think we've done a really good job so far. We've done a good job on the population end. We've got a grasp of what numbers we need to keep track of, and we've got a hold of what situations would make us believe that at a population level, we had more cases than we would like. We've done a good job on the individual level. We've taken measures for teachers, for bus drivers. And maybe now is the time to take an additional step at the individual level for vulnerable individuals, those that would be hurt by not going to school, those that would be hurt by going to school. And there's probably 2, 3 categories of people that we should include in this conversation, and any additional steps I think would be helpful.
Mm-hmm. Laurel?
Along with that, and circling back to the numbers that we talked about, and you said we have the numbers we're looking at, but some of those just say one of them, for instance, is average daily COVID specific hospitalizations. But again, without knowing how many beds we have, I'm wondering why it's a number as opposed to a percentage of available things.
Laurel, we have critical care capacity in there. And our reason to put that in was just because in our conversation with Tom Charles and the hospital is just because it could be a different concern they're having related to their capacity, not specifically to beds. It could be equipment. So we left that a little more vague in this iteration because of that.
And you're saying that capacity covers both beds and equipment? Is that what I'm hearing?
Yeah, absolutely.
Okay, but that we will have some understanding somehow of what that is that can be. What I'm concerned about is that people see if it is beginning to rise, even if it's not there, but that we and the community be able to see that trend and then hopefully see it reverse, but at least see that it's mounting. Right now we have numbers for cases and we can see that, but these other things, how will we visualize what's happening?
Well, we'll have open collaboration. I mean, we've been very fortunate for the dialogue with the hospital folks. And you know, as if they're seeing an increase in patients in their COVID care unit, and they're concerned about how quickly they're seeing that change, they'll share that with us, and that'll impact our conversations with our team and allow us to be able to respond. Obviously, we'll also be monitoring our school community closely to see if are we seeing cases as well. I mean, obviously, if we see too quick changes, we want to be able to pivot immediately.
I think that touched on my last question about this, which is the other things that might be in there, either for permanent change or relatively permanent, or even a couple of days, so that if we have a couple of days, absenteeism had been in there, but it's not in there anymore that I saw. It was stricken through.
We have number of SCASD faculty, staff, and students impacted by quarantine and other reasons for absences in the
Okay, that has been put back. Okay.
That's on the bottom part for the variables that I mentioned earlier. Yeah.
Okay. All the different pieces of paper, I lost track of it. Sorry.
No problem.
And I can add a comment here as well. We had talked about 2/3 for as a capacity that we would consider too full or too occupied to risk. And we may get there, but also if we get to 2/3 capacity, that probably means that 10 days ago we had a spike in cases. So in all likelihood, we'll see the case numbers go up first. That's probably the first signal that we'll see before the critical care beds filling up.
That's a lagging indicator.
That's right.
Dan, I saw your hand up.
Yeah, just briefly, just to follow on the question about ICU beds. I think the Department of Health tracks how many ICU beds we have and how many are available and how many ventilators are available, how many are in use. I think that's tracked at least weekly. So just to answer the question about the numbers, I think it's possible to know what's happening at Mount Nittany. I'll just throw this in as well. There is additional capacity within the region. I've heard that Lewistown Hospital has, by report of a nurse with whom I was working on a pulmonary function test, she advised me that the Lewistown Hospital has capacity for dealing with COVID as well. So there might be additional capacity outside of Center County that might be available. God forbid.
Other questions? In terms of that, the risk mitigation for vulnerable people, I think it probably needs to be an ongoing conversation as we begin school, as we start to see cases rise. I think that we're going to be living with this virus potentially for some time. I think we need to continue keeping that question at the top of our minds, and not that I just think this discussion tonight can't be the end of that conversation.
Are you guys okay if I ask one more question?
Mm-hmm.
It
Well-
depends.
What would a school do if a teacher called in and the teacher said, I'm afraid, and I saw the case numbers go up and I don't want to go into school today?
I think if we see case numbers go up and we're still in school, we have to be able to explain what we know about those case numbers and why we're still in school, right? So I think the challenge for us to monitor this and explain where we are is what we're going to have to be able to do. Because if it's in a school that has no case experience, we're going to need to explain that. You know, are we seeing it in different places in our community? I mean, I hope our monitoring effort enables us to answer those questions as to why we're still open.
Or if we are.
Yeah, if we're open.
Yeah. Laura? And then,
Sorry, the other question was about isolation and quarantine, or quarantining when people have been out of state. And whether that should, so the plan right now says that we should follow the CDC protocols and Pennsylvania Department of Health. And I was wondering whether we want to specifically outline, not these states, but at least include that link in the plan and emphasize that as a responsibility.
Our plan, depending on how you move tonight, is to communicate that out. Obviously, we need to get that out this week.
yeah. Lori?
Just one last thought from me on this. Just speaking of being able to remain flexible and continue to evaluate what we're doing to keep people safe as we go through this. Is there, I would imagine there is, but just to verify it for me, is there a feedback loop from teachers to administrators about things that are working in the classroom, things that aren't working in the classroom, so that we can sort of be as adaptable as possible to meet the needs of that just will be emerging, I'm sure, as teachers are in the classroom with students?
Well, it absolutely includes all of our principals in all the buildings with the faculty, because the principals are helping, obviously, to support and implement the plan. Obviously, they've been instrumental with Ed and his team on all the physical distancing requirements, as well as all the protocol and PPE for the buildings. Vern, if you and Will or Deirdre and Chris want to respond. I mean, Deirdre's in two roles, so she can speak specifically on how much she's talking with faculty specifically for an individual school example.
I can think, Bob, for the definitely for that first week and subsequent weeks, like my job is going to be in the building. I'm not going to be in my desk checking email. So like we're going to have to ask for, you know, support in understanding that principals are going to be out and about. They want to check in with their faculty in the cafeteria, the recess, those areas that have more students in that are maskless times, to make sure things are going okay, to see what students need, what teachers need. I ordered a bag this weekend to carry my phone, my walkie-talkie, my hand sanitizers, my extra masks, because I'm already planning to be out and about. So I feel like that's the role of the principals, that you're going to see us in the school monitoring and checking in with people quite frequently to make sure things are going okay, and then to make adjustments.
That's perfect. Thank you.
All right. Other questions? I guess, and this is a little bit in the weeds in terms of operations, but this is obviously unprecedented times. If we certainly know, you know, we've asked employees as a district for those who are, you know, have certain health conditions where they're concerned about coming into buildings, and some people have received extra PPE and 95 masks. There are already identified employees who there's reason to be concerned may be more vulnerable. And I'm wondering if there just simply needs to be some flexibility. And I know it may be hard to get substitutes, but if we are seeing rising case numbers, we haven't quite reached the point where we're going to close. but thinking about how we're going to be potentially flexible with potentially needing either substitutes or some staffing model for those individuals if we're in a situation where we're inching towards potentially, you know, having too high of a risk in the building. And I don't need a response to that, but it's something to think about. That for some people, maybe it's not all green or all red in terms of go or no go with being in buildings. And I know we'll be monitoring those numbers regularly, and perhaps those discussions might happen in that context. Laurel?
I agree with that. I am concerned still about how we're going to do things on a building by building basis. That how we did say, I believe last week, that those numbers will be posted on our website. And yet in here, I don't see that other than the piece that I mentioned in the
numbers? I'm sorry, which numbers will be posted?
If there are cases per building.
We would be emailing is what we said. We'd notify families if we have any cases. I didn't, if we create a data dashboard or something like, I mean, right now, our plan was to notify all families. We have cases. Jean, is there anything you want to say about it? I mean, to be honest with you, we're scrambling to open the district. I mean, so any last minute changes that you want, sure, we'll try to, if the board, as a board directs us, we'll do what you need. But we're scrambling, as Deirdre shared what she's trying to communicate and do with her faculty. We're a pretty flat organization, and we're trying to implement the safety plan if we're able to be in school. So, Jean, do you want to share how we discuss communication on cases?
Sure. So the plan was to notify the person, of course, and then any close contacts. We would notify the classroom, the school, and then the district overall, being very cautious not to expose any names.
Okay.
And this is a procedural question, I guess.
Mm-hmm.
Because I think we are wanting to vote on this tonight so we can keep moving. At the same time, the document that's attached to our agenda still has old numbers in it. It has question marks. And so I guess that always makes me hesitant.
I can speak to the question mark is because I want to put the page number, and I can't put the page number till I have the data, and I can't put the data till you make a decision.
So that's what I'm trying to understand is how we're going to get that.
Okay.
Well, we had been putting the live Google Doc in, Jean, and then somebody wanted PDFs because they couldn't see them. So we can put the Google Doc back in because that's live, and it might be easier for people to see the information, because Jean did make the one refinement that was brought up earlier. I saw it. I'm in the document with Jean that's live.
Okay. Gretchen, I'll take your question, and then since you haven't had a chance to talk yet, we should go ahead and wrap up this item.
Yeah, I just wanted to ask about Jean's answer pertaining to communication when there's a positive case. And so if I heard correctly, you said, Jean, that if there's a positive case, then all the families in the classroom, in the school, and in the district overall, so that means that an email would be sent out to the entire district if there's a positive case. Did I understand that correctly?
Yeah, so the Department of Health, we've been told that the Department of Health will be notifying us of all cases and guiding us through the contact tracing process. Through that they will be identifying close contacts and having those conversations. At the elementary level specifically, we would definitely notify the class because of that 6-hour question. We'd follow Department of Health recommendations. If they say just close contacts are these 2 or 3 people, we would still let that class know and honor any family who would want to quarantine based on the fact that they're in that classroom for 6 hours and eating. In the other spaces, we would talk through that process and notifying classes, middle school or high school. We would make sure then the building knows that there was a case within their building, and then we would also notify the district we had 1 case or 2 cases. So the overall district would get just a number. Buildings would get more specific as far as so that they're aware of more of where this place is, the space is. And there's cleaning requirements now by Department of Ed. Department of Ed has really put the numbers in place. So they're going to be telling us 1 case cleaning, 2 to 5 cases, 5+ cases, what we need to do in each of those situations by building based on if they're low, moderate, or severe range. So we are getting more guidance from them on actionable steps to take, and we will be told how to do that by Department of Health.
And the reason I was asking is because I have a feeling that a lot of families are listening tonight or will watch the meeting later, and they want to know, if my student is exposed to COVID, will I be notified?
Absolutely.
And so it sounds like if your student is exposed in the classroom, if someone in the same classroom has a positive test, then you would be notified, but not the entire school. You're talking about within the district and the administration of the building. So families, and correct me if I'm wrong, because I'm just trying to understand this, families will be notified only if there's a positive case in the same classroom as their student?
Correct.
Okay, thank
That
you.
is what's in the plan, yeah. And be careful about the word exposed. The exposed piece is what the Department of Health, those are going to be considered your close contacts.
And then will we have then, and this may be in the safety plan, it's, as you know, so many pages that I'm trying to keep track, but it may be in there and I didn't see it. Are there, so because of the contact tracing issue, is there then a necessity that very strict seating charts will occur in all buses and classrooms, so that if contact tracing needs to occur, then the correct people would be notified?
No, because the contact tracing, if we're having a seating chart, it's still 6 feet apart. The buses will have a seating chart. They will, upon entrance, file in the back and will stay in those same seats throughout. But in the classroom, we had that discussion many times and did not think that that was something that was necessary because of being 6 foot physically distanced within the classroom by desks. The conversation of close contacts would take place by conversation. Who have you been within that physical distance for longer than 15 minutes?
But I thought you just said that if you're in the same, if a student is in the same classroom with a positive case, they would be notified. Is that not the case?
Yes. So let me try to be clear. When the Department of Health calls us and says there is a positive case within your school, we would then need to have the conversation with that person to find out who their close contacts are. That would be a separate conversation with those individual close contacts. Taking in consideration the makeup of our day, we would then notify the parents within the classroom that there was a positive case, and those who were identified as close contacts have been notified. Okay, and then we would give them the option. If you feel unsafe, here's the steps we have taken. We have sanitized, we have followed these protocols. We would discuss honoring a quarantine for the family would want to optionally do that. We would also notify the school that there was a case within the building and we followed these measures, and we would notify the district we have 1 case. Does that make sense?
Okay, so if a student is in the same classroom as another student who tests positive, then the family would get an email notifying them that that had happened.
Yeah.
But unless there were close contact, as you describe in the definition of the document, that would only pertain to the students in terms of the contact tracing. Is that correct?
Correct. And that they would be the ones who would be identified that would need to be quarantined.
Okay. And that's in relation to the contact tracing, I'm guessing. Okay. Okay, that makes sense. I wasn't understanding, and now I do. So I appreciate you clarifying. And then the last question I have is that, we've said all along that this safety plan is a living document because, as several people have noted tonight, often we get new information just through research and experience with this novel virus. And so because it is a living document, I'm just curious, how will it occur for teachers, for example, and staff to know when it's been changed? So like, where's the most recent version that everybody knows, go here? And then how will they know what's different, because it is such a long document, than the last version, just so everybody knows which one to go to and to be up to date, as possible.
Right. So of course, we really haven't processed that, but the number one version will be on the district website, and Nabil will replace that. All teachers will have links to that in their handbooks, and so will families. As far as updates, I would think that that would follow. We might put a memo on the front like we give to the board, because I would imagine any update needs to go to the board, unless you're going to allow us to make updates throughout. Based on last week alone, we had an update on the 10th and the 13th. So that might be something we want to work through a bit more. That's not part of this document, but you bring a good point, Gretchen, about making sure that they can go straight to what the changes are. And I think that would be a brief summary with each update and what the dates are.
And Jean, this is Deirdre. Could I just add that tomorrow, as part of our in-service K-12, it's a focus on the health and safety plan. Everybody, we're bringing every para in, recess para, lunch paras, everybody's coming in top to bottom so that we can make sure everybody is very versed in our health and safety plan.
Yes, and I'm meeting with all SEAL and all bus drivers too. So it's all, and I met with all cafeteria last week.
All right, any other questions? And we'll go ahead and have a roll call vote after public comment. Okay. So to recap, oh, Laurel, I'm sorry, yeah.
Can I just ask that after we do this, the same thing that you're going to be sharing with people tomorrow and all, that be attached to tonight's agenda so that they are seeing an accurate representation? I think we're trusting that that is what that document will include the changes and suggestions in the right order and all that we've made. And I'd like, if people do refer to their board minutes to see what was approved, that the attachment reflect what we are going on trust to approve.
I'm going to do my best, Laurel, depending on what time we end here tonight, because I have an 8 o'clock presentation of this. So if you approve this now, I'll go in and start working and try to get it ready. That includes changing it in like 6 different places. So right.
But once it's ready.
Yes. Yes. Well, I want to make sure they have the most up-to-date information. So some of this, especially the data and the new identification, I would want to make sure that that's part of the presentation.
Okay. All right. Is there any, well, first I'm going to reread the action item before we have public comment. The action item on the table is a motion to approve the 2020-2021 Health and Safety Plan as shown in attachment 6A. Okay, at this time, is there public comment on this item? And I will start with Linda Waite.
Amber?
And this, yes, Jim?
Could I suggest a 5-minute recess before we go to public comment?
Before the public comment?
Yeah.
Sure.
That's 10 o'clock at night.
Sounds good. We'll do a 5-minute recess and then we'll come back to public comment. And I'll remind everyone that public comment will be.
I respectfully request that we absolutely keep it at 5 minutes because we have 600 people on this call, and they're all waiting here at 10:05, primarily probably for the next agenda item. So I think we need to be very respectful for the fact that
Okay, Scott, we'll get there quicker if we keep moving. Okay, we'll be adjourned for 5 minutes. I'll be right back.
Amber, you're muted. There you go. No, you are.
Whoops.
Well, for once, it's
You get to tell me.
Oh, man.
Okay. Well, I'm ready whenever everybody else is ready. I'm not able to see who else here because of the screen saver thing. Okay. Okay, are we missing anybody that I need to wait for? Looks like we're probably good to go. Okay, I will call the meeting back to order. And the next item on the agenda is public comment in regard to item 6A, a motion to approve the 2020-2021 Health and Safety Plan as attached to the agenda. I see Linda Waite's hand up. Linda, if you would like to introduce yourself, where you reside in the district, and you'll have 3 minutes for your comments. And you'll need to unmute yourself. Thank you.
Okay, can you hear me?
We can, thank you.
Hello?
Yes.
Okay. Okay, so I'm Linda Waite and I live in the State College Borough. I just wanted to, I have a few ideas. First, thank you for thinking about the bus drivers. We really appreciate that. When the kids get on the bus, they are less than a foot away from our face when they walk by. So there's no 3 foot, there's no 6 foot, and I know we can't do plexiglass, but I'm wondering about something like a clear plastic shower curtain that would not shatter in a wreck and has not been discarded as an idea by the Pennsylvania Department of Transportation. So that's one idea. And also, I'm thinking that there's only going to be 12 students on a bus if they're supposed to be even 3 or 6 feet apart. I can see how you'd put a student by one window and across the aisle, another student by another window, you would get your 6 feet and certainly your 3 feet. But the students one behind another would not be 3 feet apart. If they're wearing a mask, maybe that doesn't matter, but we won't have that distance from front to back. There is not 3 feet. And for cleaning the bus, if a bus driver has to do it themselves or whoever has to do it, I would just like to remind about latex allergies and maybe having some latex-free gloves. I don't know if this is part of the agenda or bus garage people, but that's what I had to say. Thank you so much.
Thank you for your comments. And maybe we can file the idea about a not plexiglass, some other kind of plastic barrier, and see what the state would have to say. Adam Seitz, I see you have your hand raised, and if you would unmute yourself, introduce yourself and where you reside in the district.
Thanks. Adam Seitz again from State College. I'm a proponent of using the best available science to inform public policy decisions. We must react to, but cannot be paralyzed by ever-changing data. However, many in our community lack the luxury of being nimble, and not everyone is able to pivot quickly. Unfortunately, we do not live in a society that permits an ideal response based on science. I wish we did, but we have to work with what we've got. The welfare of our most at-risk populations depends on maintaining the option, again, option of holding school in person as long as possible based on the district's health and safety plan as communicated to the community prior to this meeting. When I say at risk, I mean the kids being abused at home, the kids suffering from mental health illnesses, the kids that have special needs, the kids that are food insecure, the kids that are homeless. They are all here. Many of us have the privilege of not seeing them, but they are here. They are in our community. Not everybody is going to live through this year or otherwise emerge unscathed. We're not. However, I will prioritize the best possible, not perfect, well-being of the upcoming generations over mine any day. I understand not everybody shares this opinion. That's okay. I respect your opinion and value your life. Teachers, bus drivers, cafeteria workers, and all district staff are a treasure. Your jobs are amongst the most valuable to all of us. Yours are the jobs that move us in a direction of being able to mount ideal responses based on science in the future. There is not a good solution to any of this. I hope all school district employees could be afforded the option to not return to their jobs this year with appropriate societal support to do so. Unfortunately, we support economy, and not people so well. That said, if school staff are uncomfortable teaching or working in person in the current environment, I understand completely. But perhaps this is the year for you to make the choice not to teach, drive a bus, work in the cafeteria, or otherwise. I hope that would not be your decision, but it is your decision. I have a full-time job, but if I don't feel compelled to work tomorrow, I can quit. I won't be able to pay my bills without another job or appropriate societal support, but I can quit. I don't want that for any school staff, and I do not intend to belittle any school staff's views, devalue your life, profession, or livelihood. Your job is way more important than mine. Thank you for what you do, but these are hard times, and there is no great outcome. Everybody has hard decisions to make. I ask the board to prioritize the well-being of our children as best as possible in this imperfect situation and maintain the option for in-school instruction as long as possible. Thank you all very much.
Thank you for your comments. Thomas Marshall, I see your hand up. If you could introduce yourself, where you reside in the district, and you'll have 3 minutes related to the health and safety plan. Thank you.
Hi, this is Tom Marshall. I'm in Ferguson Township, have a high school child and a junior high child and a Penn State student. So I get a little bit of, the best of both worlds. But I just wanted to say, work the plan. The idea of stopping after 2 weeks makes 0 sense. You have a range and a parameter, you have a plan. I've been part of it with the athletic side, seeing how hard they've worked. I've seen the State College team work very, very well on this plan, but please work the plan. Don't go remote. The kids are looking forward to some type of normalcy. The kids are looking forward to seeing their teachers. The kids are looking forward to learning. Some kids are not good at remote learning. So I just ask, please, do not do your decision of not having kids go back to school. We will respect when the numbers say that kids can't go to school. We can't respect when there's 1 case, 2 cases. That just doesn't make sense to anyone. We'll back and support this board as long as you're making the right decisions. And the parents have spoken. You asked and you gave a choice, which is the way it should be. A parent should be able to choose for their child what's best for them. School board shouldn't override it unless the data says that school isn't safe. And at this point, that data doesn't say that. So please do us all a favor. Go with the plan. Don't go with the remote. Don't go with the remote in 2 weeks. Because my kids said, what sense does it make for a kid to go every other day for 5 days to be sent home remote? It just doesn't make sense. If the data says it's time to shut down schools, shut down schools. But don't do it because of feelings. Don't do it because of fake fears. Because that's what a lot of this is fears. That we see a story in North Carolina. We see a story in California. We hear about something. We need to look at the data from State College. That's where we live. That's what we care about. That's our community. Thank you.
Thank you for your comments. Michelle Rodino, if you could state your name, where you reside in the district, and unmute yourself. Thank you.
All right. Hi. Yeah. Thanks again, everyone, for all of your work and decision making. I really like Gretchen's plan a lot because it kind of satisfies a lot of the views and concerns that I've been hearing and that I have myself. By starting in an all remote mode, we're actually starting in the safest way possible while also making school much safer for students who must attend and for students whose parents must leave if they're essential workers or first responders or healthcare workers. My child is old enough to be left alone in the house if need be and to attend school, okay, remotely on their own, but I understand some kids are young enough or just not able to do that. And it sounds like Gretchen's plan actually has a plan for that. So I really like that. So kind of default remote for everyone except those in need. And then I just want to say, I really think we should break out of this kind of feudalistic mindset. I hear a few parents saying that, you know, we're just going to have to wait for numbers to rise. I think we should take an aggressive stance on prevention and on preventing spread. And I mean, this isn't just in State College area school district, but I think we would really get to the other side of this a lot faster, and I'm sure we all want to, if we would take a very aggressive stance on spread instead of reacting to numbers rising where there'll be increasing hospitalizations. And by the way, the latest CDC report shows that a third of all kids who are hospitalized end up in the intensive care unit. So it's nothing to be messed with, you know, for kids or the adults they might be spreading it to. Finally, teacher choice, para choice. I think that we really, and bus driver choice. I mean, we need to think about everyone that we're asking to come in. And to the comment that if you don't like it, you can quit. I really don't think we should have a plan that makes our very experienced teachers and educational support workers choose between their lives and their livelihoods. And finally, I'm going to say the dangerous number is 1. The loss of 1 life in the district is too many. Having a physical disability that would have been preventable is 1 too many. Let's all stand together right now for all of us.
Okay, thank you for your comments. Rachel Malik, if you could restate your name, where you reside in the district, and you'll have 3 minutes as well. Okay, I think Rachel dropped off. Melissa and Michael McNeely, if you could just state your name, where you reside in the district, and then 3 minutes. Thank you. Oh, and you'll need to unmute. I think you're still on mute.
Oh, hi. We weren't looking to make public comment. We were just listening for informational purposes only.
Oh, okay. I'm sorry.
I think we might have accidentally raised our hands. Excuse me.
No worries. Good to hear from you. Okay. Sarah Blows. Okay. If you could unmute yourself and just introduce yourself and where you reside in the district. You'll have to, the unmute is the bottom left-hand button. Okay. Sarah, I'm not sure if maybe you didn't mean to have your hand up. I will come back to you if you're having difficulty with the mute situation. Shaylin Son.
Hello, can you hear me?
I can hear you. If you could just introduce yourself, where you reside in the district, and then you would have 3 minutes for comments. Now we are not able to hear you. I'm sorry. I can see that you're not muted, but it's not working.
My little sister is going in fourth grade at Grace Woods Elementary School, and she misses her friends. Learning at home is not the same. We hope you allow us to learn in person and see our friends and teachers. Thank you.
Thank you. Sarah, okay, she's dropped off. Joseph Clark. And if you could just state your name, where you reside in the district, and then it's 3 minutes for the health and safety plan item.
Yeah, my family lives in Oak Grove and College Township. And I have 2 sons who graduated from State High recently. And my daughter is a rising 10th grader. And I just, normally I just stay quiet and try not to get too involved and let people do their job. But this is too important to me to stay quiet. I think we really need to start back to school while the COVID numbers are low and then monitor them daily. Just arbitrarily stopping after a couple of weeks while it still could very well be safe just doesn't seem right to me. And then ignoring all the local COVID stats and replacing it with fear is no way to lead our district. There's really no guarantee either way on what's going to happen once the students return. At the same time, all the locals have been vacationing, traveling all summer, including teachers, students, staff. Kids have been playing youth sports, traveling with club teams all summer. Most local businesses have all reopened. Hundreds of PSU athletes have all returned, and they were specifically tested with very few positive cases, and none of that has seemed to lead to any community spread. It seems the parents who are pushing to keep the schools closed are likely not adversely affected by that decision. They already chose remote learning, and I think that's great they had that choice, but maybe they aren't a single dad or single mom. They aren't dual income families that would be adversely affected with the financial stress of having to stay home. So if the district does go full remote, do we still need the same number of teachers? Would the extra teachers, the supporting staff, all the bus drivers, etc., would they get furloughed? What happens to all those jobs? I'd like to also just say the school board should represent all the members of the community, and what recourse do we have if the board's decision is to go remote only? That would be against what I consider a fairly large mandate to the board by the vast majority of the parents in our community, and is our only recourse voting in new board members. And sorry, but if that's the case, then consider it done. Thank you.
Thanks for your comments. Carla Myers, I see your hand raised. If you could just introduce yourself, where you reside in the district, and it's 3 minutes for this item, the health and safety plan.
Hi, I'm Carla Myers. I'm from Boalsburg. My daughter is a rising 9th grader. So I really think tonight has been an amazing and intelligent discussion of the plan. I'm struck by one part, though, that I feel is missing, and that's that we haven't heard teachers' voices tonight. A board member mentioned earlier that the success of the plan is based on doing things the right way. So because I'm not a teacher, I don't know if these things can be done the right way. I respectfully request hearing from a cross-section of teachers and staff, since they are the experts concerning what happens in their own classrooms. I want to know if they think the plan can be carried out in practice and not just in theory, as we've discussed it this evening. Thank you.
Thank you, Carla. Thanks for your comments. Michelle Davidson, I see your hand raised. If you would like to, if you could just introduce yourself, where you reside in the district, and then it will be 3 minutes for discussion.
Hi, yes, thank you. My name's Michelle Davidson, and I live in Pine Grove Mills. I have 3 children in district schools, a high schooler and 2 middle schoolers. My major concern is that with all of the communications that I've read and seen, I do not see a comprehensive plan for how you will be dealing with students with severe special needs and disabilities. I think that the board needs to consider that these children are already behind, way behind their peers in terms of academic development. And I have yet to see how the board and how the school district plans on meeting their IEPs and how you're going to meet their progress goals. There are very specific things through IDEA and the law, and I do not see how this plan is going to serve those students. So I think that I would respectfully request that you table the vote for tonight. I think I've heard some good recommendations from other people about hearing from teachers in their classrooms. I would also like to hear from the special education coordinator and the administrators about how they're going to comply with federal law and state law in making sure that we are taking care of these kids with special needs. And just as a side note, to keep in mind that for some parents of children with disabilities, their only respite is when their child's in school as well. And I'm not quite sure that pulling students from school after 2 weeks because we're afraid something might happen will best serve those students' educational needs. Thanks so much.
Thank you, Ms. Davidson. And for any particular concerns about particular children, I know that your remarks were general, but I know our special education department is would be happy to talk with you about any particular concerns about, if it's regarding a particular child. Eileen White, I see your hand raised. If you could unmute yourself, introduce yourself and where you reside in the district, and then 3 minutes per comment.
Hi, my name is Eileen White and I reside in Ferguson Township. I have 2 grandchildren who attend one of the district schools, and I would like to really say that I think for all those parents who chose the option of attending in person, you need to give that a lot of weight. I have talked to many of my neighbors who have children. My son and my daughter-in-law made the decision to have their children, my grandchildren, go in person. And I think the parents carefully weighed out what they knew is best for their children. I think also the idea of going to remote is going to create a hardship, not only, as Ms. Davidson said, for students with special needs, but also for the parents who may be needing to go to a job. I know that Ms. Brandt mentioned about care centers for IEP students and special needs students. I taught for 34 years with the district, not locally, and I'm not familiar with what care centers are, but I'm 68 years old, so maybe that's why. But she also mentioned about having care centers for students who would be alone. I know for a fact that there are many parents who work at Penn State or other places, and they're not quite sure what their schedule is going to be, or maybe their schedule is every other day. What's going to happen to their elementary age children who may be home with parents on some days, but not have parents around on other days? And I can only picture a household with two parents working from home, or maybe a single parent working from home, and 1, 2, or 3 children who are also trying to do remote learning. I helped out, I pitched in from March till June, and it was nowhere near as helpful to my grandchildren. When I tried to work with my 5th grade granddaughter on math, even with my 34 years of elementary experience, her comment was, "But Grammy, that's not how they teach us at school." Even those of us who have backgrounds are finding it hard to work with students when they are not in the classroom. I respect and admire all of you on the Board of Education who have worked so hard to put together what seems like a comprehensive health and safety plan. I greatly appreciated Maciek, and I hope I'm pronouncing his name correctly. His input, I found it fascinating and very helpful. But please stick with the plan that is currently in place. The children are so much looking forward to going back to school. And please remember, the parents have been working with their students, with their children. I don't know of any parents who have not been reviewing how to put a mask on, keeping your distance. My grandson has only probably had 3 play dates this summer with friends of his. He is very excited about just seeing his friends. He knows he'll have to wear a mask in 1st grade. We've practiced that. We've done hand washing. They've already had backpacks ready to go with hand pure sanitizers in.
Ms. White, thank you for your comment.
Okay, thank you.
We reached the 3 minutes, but if there was anything else final point you wanted to make, that would be fine. Okay. Yeah, thank you so much for your comments, Ms. White, and for working with your grandchildren too. Lisa Harpster, if you could introduce yourself, where you reside in the district, and then 3 minutes for the comments.
Hello. Can you hear me okay?
We can. Hi, Ms. Harpster. Thank you.
Yes. First of all, thank you all so much for doing all of this work. I am a teacher in the district. I teach at the high school, and I just wanted to respond to an earlier question that was posed about what teachers were thinking about what was going on and how they felt about safety. And so I was wondering, we were polled earlier. I'm just wondering if there's any way that those results could be made public, or is that not an option?
I think, do you mean the polling results that from the association when they did polling?
Yeah, is that possible for our union to make that public, or is that not a possibility?
Yeah, actually, the union president read a statement at a recent board meeting, and so that was part of should be part of the minutes from that board meeting. But she did discuss that in the board meeting.
Oh, okay. Okay, thank you.
Right, thank you very much. Josh Weed, I see your hand raised. If you could introduce yourself. Oh no, your hand went away. Okay. Anyone else with a comment on this item? Oh, Josh Weed. Okay, if you could unmute yourself and then just introduce yourself. Thank you.
Yeah, so I'm Josh Weedy. I'm living in College Township, have a 10-year-old daughter who's going to Delta next year. And so I will say that I haven't been following everything that's gone on in this meeting, but I have been heavily involved with the university's plan in bringing students back. And it's fairly clear that their testing plan is not sufficient to measure spread within the university community, which has a direct impact on the larger community. And I have real concerns that, as we bring 40,000 students back to the community, that we are going to have a fairly large increase in cases that might not be detected for a while. And so I hope that the school district considers the impact that the students will have the students will have on the community spread within State College in the area.
Okay, Josh, thank you very much. We are, I think, trying to make sure that we understand their testing turnaround in a real-time basis to be able to be sure that we know how well we're able to estimate that effect on a day-to-day basis, if that makes sense. Okay. Sandra Elaine, if you would like to introduce yourself and where you reside in the district, and then you would have 3 minutes for comments. Okay, you will need to unmute yourself. Okay. I'm going to go ahead and call on Jen Norse. I see your hand raised. If you would like to introduce yourself and tell us where you reside in the district, and then you would have 3 minutes. Ms. Norse. Okay. All right. I will move on then to CP Price. If you would like to, there we go. Now you're connected.
Hi, am I on?
Yes, you're on. If you could introduce yourself, where you reside in the district, and then you would have 3 minutes for comments.
All right, I'm Connor Price. I'm going to be a senior this year at State High. I just want to say, I was going to be a senior this year, or I am a senior this year. I was going to have my senior year of cross country, and I'm not disappointed that I'm missing out on it. I did not want to see any of my teammates die, any of their family die, anyone in the sport die, and I'm not disappointed I'm missing out on this year. I'm advocating that we do not start in person at all, and that it's not an option this year until everyone can go back safely. I'm just scared that I'm going to see my friends die, that my teachers are going to die, and that their family will as well. Just because the numbers right now are low and the numbers may remain that way doesn't mean they will at all. The students coming back to Penn State is not a good sign. I'm working a fast route right now, and all the students don't really seem to care about guidelines at all. The cases are going to go up no matter what. And I just can't see a safe option to return back to school this year. I'm not afraid of missing out on any school experience because I do not wish any bad doing to anyone in my community. So that's why anyone listening to this right now, any teachers at all, I'm asking for you to come together and strike against the school. They can't teach school if there's no teachers to teach at all. Anyone listening, just come together and don't teach. There's not an option. All the teachers I know aren't teaching this year just because they can't advocate for any harm to their students at all. So please, please just go all online. Thank you.
Thank you for your comments. Tara Rocco, I see your hand raised. If you could introduce yourself and where you reside in the district.
Hi, can you hear me?
We can.
Hi, Amber. My name's Tara Rocco, and I live in Ferguson Township, and I have a son going into middle school at Mount Nittany, and my daughter is going into 9th grade at the high school. And I would just like to echo, well, first of all, I guess I would like to lend my support to Gretchen's suggestion of delaying in-person school. My concerns fall into line with Josh. I believe he spoke a few minutes ago, that is familiar with the testing at Penn State. My concern is that we do not know what is going to happen with the numbers in the community after the students come back. I feel like we're in a wonderful place now, but I don't feel secure that we will stay that way. And I'm not asking to go for a fully remote school year, but a fully remote start until we see how that plays out. I would hate for us to put our kids back in school in person only to have the numbers spike in the first few weeks and then have to close the school. What would the purpose have been for that if people are getting sick that didn't need to, when we would be able to possibly start fully remote and maybe 4 weeks, 6 weeks, maybe less than that, see what happens with the Penn State students coming back, and it does not affect the numbers negatively, then start school then.
Thank you so much for your comments, Tara. Okay, Mike Duffy.
Hi, Amber, can you hear me?
I can hear you. Hi, Mike, how are you?
Okay, so with apologies, I need to start with two questions. Are we currently commenting on the 0-week return or the 2-week return?
This is time to comment on the health and safety plan itself.
That's okay. That's what I thought. I'll jump ahead since I think everyone else did.
I think so.
Yeah. In either of those plans, and I only have the 2-week window to read. It says that after moving to fully remote learning for blank weeks, we've been presented with several options. when you say fully remote learning, which option is that?
That would be the synchronous remote option.
Okay.
With all students.
Thank you.
Yeah. Mm-hmm.
Yeah. So that would be SCASD teachers delivering that education.
Yes.
Okay. There have been a lot of great points. No one this year is going to get what anyone wants. We can't. There was a comment about making the risk less than zero. We're already in life at a risk above zero. We have a remote option that is absolutely available. We have 60 pages of safety guidelines to take really good care of people based on our local environment. And I think that's great. And I want to say that I'm a huge proponent of public education in SCASD. It's one of the reasons we moved back. But having said that, online education is challenging. Based on an evaluation of what SCASD offered compared to several other Pennsylvania school districts, as well as 3 other states, the content delivered that I saw was, to be honest, the bottom of the barrel. And everyone was working off their back foot with no warning. It was a surprise to everyone. Given that we have a 60-page safety plan, I've seen a 0-page academic content delivery plan from SCASD. There are probably at minimum 500 SCASD parents that have worked through the university to develop and deliver online education. I haven't seen SCASD reach out to anyone to try to pull those resources in, at least as volunteers. I don't see any good reason to suggest that SCASD is ready to deliver a fully remote, well-developed online education at week 1. I hate to say that. I want very much for my kid to go to SCASD, but we have to balance the safety, and we also have to still deliver education. So I wish you all the best of luck. This is going to be a tough year, but please make sure you're balancing safety and education. Thank you.
Thank you, Mr. Duffy. I appreciate your comments. Tina Powers, I think your hand is up next.
Hi, good evening again. Hopefully I'm not prolonging this. I just have a quick question and a quick comment. First, I want to comment that Dr. O'Donnell and team have done a phenomenal and seemingly impossible job of creating a safety plan for everyone. And I hope the board allows Dr. O'Donnell to execute this plan. I tried to find the info in the 72-page safety plan, however, was unsuccessful. I did see, across the country that some schools are rotating teachers from classroom to classroom versus having a mass of students in the halls, even under controlled numbers. And I'm wondering if this is, maybe it's minutia that we don't see in the plan, but is this an option, and the reasoning either way?
I'm sorry, Jean, would you be able to speak to that?
Sure. In some cases, we are having teachers come to the students, and that would be like in specials and in the elementary level. Because of the numbers at the middle and high school level, it's difficult to have teachers travel. The students have so many courses that they can't really cohort them. And so that's why they've made the every other day model, so that we can keep those cohorts actually smaller.
We have instituted the 4x4 block. So especially at the high school level, a semesterized block is a big change for us, so that we reduce the number of contacts in the secondary schools. So I just wanted to add that. Thanks.
Thank you. Okay. Stephanie Fink. And if you could introduce yourself and where you reside in the district.
My name's Stephanie, and we live in Ferguson Township. And I'm speaking on behalf of also my sister, who also lives in Ferguson Township. Between the two of us, we have 5 children, and already I've sat here for a 4-hour meeting. I'm 34 years old, and I'm bored. And we're expecting our children to sit 6 hours a day in front of a computer with no social interaction and still maintain their desire to learn. It's not feasible. My sister has 3 autoimmune diseases. My mother has an autoimmune disease. I live with my elderly grandfather, and we made this decision for the best interest of our children, knowing that sending them back to in-person schooling, knowing that it poses a risk for 3 members of our family. My youngest son does not have a IEP, but he threw temper tantrums and fits and refused to get onto his remote learning, which was 1 hour a day, 3 days a week in the springtime. My niece had no issues in school and stopped doing her homework. I have my nephew who's starting kindergarten, and he is not the type of kid that's going to sit in front of a computer to do remote learning. And I'm afraid that this is going to be his experience going into school, and you're going to lose them. Elementary is when you develop their desire for them to have a lifelong goal of learning. And I just don't feel that making a preemptive decision to go back for 2 weeks and then going to fully remote learning when 70% of the parents have said, yes, we want in person. It's not fair to the 70% of parents who want in person. Thank you.
Okay, thank you, Stephanie. Cassandra Mosier, I see your hand raised. And if you would like to unmute yourself and then just introduce yourself and where you reside in the district.
Hi there, my name is Cassandra Mosier. I actually reside in Bellefonte School District, but I'm a teacher with State College. I teach at Mount Nittany Middle School. This year I'll actually be teaching with our virtual academy. Because of some health concerns, I was able to have that accommodation made, and I'm very grateful, but I'm still interested to know what will happen for my colleagues. I wanted to touch on a couple things that other commenters had shared. First, Mr. Duffy had expressed a concern that while we have a 60-page plan for health and safety, we have no academic plan for remote learning. And I wanted to ensure anyone who's listening that all teachers have been planning, I would say all summer, under the assumption that we could go remote at any day. And every teacher in our district is prepared to present our content in a remote fashion at a moment's notice if necessary. So we certainly have a solid academic plan, whether we're teaching remote or in person. The other thing is that a few people had mentioned they'd be curious to know what teachers' input was on this. I went back and looked to Shay McGowan's, her statement to the board at the very beginning of August, when she had polled the union members on July 29th and 30th. Of those that responded, 89% of elementary professionals would choose to be fully remote. 79% of secondary professionals who were polled would choose to be fully remote. 5 teachers had directly stated to the association that they would avoid in-person teaching and seek early retirement, unpaid leave of absence, or resignation if necessary. And I wanted to mention too that of the 70% of parents who have decided to put their children in an in-person model, some of those are in fact State College area teachers who had to put their children in an in-person model because they were not being given a remote option to teach themselves. Those are just some pieces of food for thought. I am personally in favor of the proposal that Gretchen Brandt shared at the beginning, but like I said, I'll be in the virtual academy, so it has less effect on me personally. I'm just concerned for the safety of our community.
Thank you for your comments. Thank you. Amanda Naberezny, I see your hand raised. And if you'd like to unmute yourself and introduce yourself. Miss Naberezny, are you able to hear us? The unmute bottom is in the bottom left-hand corner of the screen, of the Zoom screen. Okay. I'll call on Ashley Holloman then, if you would like to make a comment.
Hey, thanks again for the opportunity to comment. Yeah, I just wanted to agree that the plan we've got is great. Appreciate all that Dr. O'Donnell has done and his team. Want to give that plan a chance to work. And we've got a great process in place should we need to pivot in the future. And I don't see why we wouldn't give that plan and that process a chance to work. And instead, I do not support us making a rash, quick, unfounded decision to close at the beginning or to give 2 weeks and then just automatically close after 2 weeks. And it seems clear from the survey you did early and from the responses from tonight and the fact that we're now almost 5 hours into this meeting and people are still speaking, that there's a desire by the parents of the community for there to be the option of being in person. So wanted to just communicate the plan is great. Let's give it a shot. Let's give it a chance. Let's stick with it. We've worked on it the team has worked on it for a long time, and there doesn't seem to be any really good reason other than just unfounded fear to abandon it at this point. Thank you.
Okay, thank you for your comments. Amy Schoen, I see your hand raised. And if you could unmute yourself and just introduce yourself and where you reside in the district.
Hi, can you hear me?
We can hear you, thank you.
Okay, great. I am going to ask for a no vote for approving the amended remote option, either of them, for the health and safety plan, and here's the reasons why. Kids have been safely congregating, protesting, playing organized sports, working, generally interacting with other kids for months. This has happened with less than 5% of the county positively testing for ages 5 through 18, or about 20 kids since March. A comprehensive safety plan has been crafted by highly qualified individuals who've indicated in-school learning is ideal and possible for those who choose it and follow the plan. In-person instruction was carefully chosen by an overwhelming number of parents who were very well informed, and they chose that for a variety of reasons. Please do not dismiss these reasons as simply because they knew remote was an option. Changing the plan at this late date appears not based in facts. Meanwhile, kids are struggling with depression, anxiety, obesity, and substance abuse. That should not be overlooked or downplayed. Organized sports should continue as scheduled at all levels, whether schools in person or remote. Voluntary practices have been occurring on a regular basis for over a month, and all parties have demonstrated compliance with the agreed upon plan. Physical activity and team sports are enormously important for the hundreds of kids in the district who participate. There is no do-over for a senior year. I also think consideration needs to be made for the career and technical center programs separate from the high school. These are small classes, and barring a high positivity rate among those classes, in-person learning should be the expected norm throughout the year, 5 days a week. Access to these programs can be made external from the main high school building, and for some kids, these aren't just electives, as graduates are qualified to enter the workforce upon graduation. A year of remote learning will greatly lessen the skill set. In closing, I strongly oppose the proposed remote options to this health and safety plan because kids need to be in school learning, playing sports, and gaining hands-on experience as long as possible without breaks. Thank you.
Thank you for your comments, Ms. Schoen. Ms. Reed, I see your hand raised. If you could introduce yourself, where you reside in the district, and unmute yourself.
Hi, my name is Dr. Jen Reed. I teach in the Career and Technical Center at the high school and just had 2 kids recently graduate from State High. Just wanted to qualify the earlier comment about the teacher poll and the percentages. It was specified that that was a poll of the number of people present, which again, I just want to qualify was a minority of our members. So I just didn't want that misrepresented and the public to think that the entire union was polled and those results were reflective of that, because there are many of us that are wanting to be back, ready to go back, and eager to see our kids next week. Thank you.
Thank you. Thanks for your comments. Marcela Soto, I see your hand raised. If you would like to unmute yourself, introduce yourself and where you reside in the district.
Hi, so my name is actually Alexis Soto. I'm Marcela Soto's daughter. I'm actually an alumni of the school district. I'm a rising senior in college. I have a little brother who attends Mount Nittany Middle School. And I just want to make the point that I think a lot of people are talking about returning to the norm. And as a rising senior in college, I understand that. I would love to have a normal senior year, but we're not living in normal times. And I think when we are making these gambles, it's really easy to make them and talk about like the statistics and the low numbers, but like we are gambling with people's lives. You don't know whose lives those are. Those could very well be your own family members' lives. I know my family, like my abuela lives with us and she is high risk. She has diabetes. She's in her 70s. So if she were to get ill just by one of us going to the grocery store because we are introducing those germs to this town, that she could very well die, and it could be any member of any of our families. So it's not just a gamble with, oh, people could get sick, people could die. And I think it's very important to remember that. And it's also important to remember that by isolating, by preventing an excessive interaction between people, that is the fastest way to return to normalcy for good. If we are able to, as a community, mitigate these risks and ensure that our numbers are down as a whole before we actually introduce interaction, we can hope to return to normal life as a whole and permanently. So I think it is important to think long-term and not just in the current next few weeks.
Thank you. Thanks for your comments. Gretchen Koldow, I see your hand raised. And if you'd like to introduce yourself, where you reside in the district, and then take 3 minutes for comments. Okay, and there you go.
Koldow. I live in Ferguson. Okay. I have a student going into 11th grade and another into 6th grade. And I wanted to give maybe a different perspective on those families that have chosen in person for their children. We have chosen in person. My thinking is that I want my children to have the opportunity to meet their teachers, to have probably a pretty short time to establish some community within their classrooms. And, but I fully expect that things will get shut down because cases will rise because of the return of students to Penn State. I would like to speak in support of the plan to hit the pause button after 2 weeks to evaluate the data. I believe that a science-based approach is a good one, and this is a science-based approach. It might be that after that pause button is hit and things are evaluated, that we look and say, okay, we can go back, and that would be fantastic. That would be the best case scenario. But if it's not, then that's what it is. And this is extremely difficult, and I super appreciate how so many people within our community will be negatively affected by the lack of in-person school. But if I were on the school board and I were sitting in your shoes, I would not want to have to make a decision that might risk the long-term disability or death of any student or staff or faculty member within the district. So I think this is a sound plan and I support it. Thank you.
Thank you. Thanks so much for your comments. Malcolm Hummel, I see your hand raised. If you would like to unmute yourself and introduce yourself and where you reside in the district.
Yeah, I'm Malcolm Hummel. I have an 8th grader, well, I guess a rising 8th grader, going to Park Forest Middle School. And I am in support of in-person education going back to school. I'd just like to reiterate the 0.00045 death rate in the country. And I think it's a matter of, free choice. I would not hold the school board responsible for any illness, for any death. Everybody makes the choice on their own. And if you have somebody with an underlying condition, in that case, it might be good to go for the remote learning option. But judging from the amount of people that weren't able to figure out even how to unmute themselves to make this Zoom call, how many parents do you think can really effectively help their kids with the online remote education? And I just think we have whipped ourselves into a frenzy over, practically nothing over the coronavirus, to tell you the truth. The Spanish flu infected a third of the world's population. The bubonic plague, I believe, wiped out 2/3 of the world's population. Maybe less than 1% of all the species that have ever lived is still alive on the earth today. We care a lot, and we want to protect everyone. We want to guarantee everything, but there are no guarantees in life. Anything could happen at any moment, and that's just the way it is. We cannot control everything. I would ask you to hold school as normal and monitor the situation as it goes. I would not hold anybody liable for that. Everybody would make their own choice and protect themselves. And that's about all I have to say. That most people, voted for the in-person school, and please follow along with that. That's it.
All right, thank you for your comments. Christy Franz, I see your hand raised if you'd like to make a comment.
Hi, I live in Ferguson Township, and I have 2 children in the district. One goes to Park Forest and one goes to Radio Park Middle School. We recently relocated with about a year and a half ago into the district from another Center County school district for, what we thought was the superior education. And my kid's father also teaches in the district. And so this is another reason why we came up. And, for the first time, I'm regretting my decision. It seems like we unfortunately have a school board that is working their own agenda and that isn't representing what the students and what the parents elected. I ask you that you stick to the plan that Mr. O'Donnell put forward. I think it's extremely unfair that I found out about this, even though my kid's dad works in the district, that I found out about this via Facebook a couple days ago. It's outrageous to me. And I think, all summer long, I had been bragging to my friends and my family from across the country that State College put forward a plan very early and a plan with many options, and that it feels like now that plan for in-person is being ripped away. And I do have a question. So if this 2-week illogical, in my opinion, option is put into place, after 2 weeks, is it going to be public what has to occur for us to go back to school? Or is it going to end up in another 4-hour debate? How will we know after 4 weeks, after the 2 weeks are up, that we're clear to go back? Like, what exactly are you looking for? Has those perimeters been defined?
Those parameters are not defined at this time.
when will they be defined if you select for that option?
I would not be able to speak to that at this time, but perhaps during that discussion, there may be some discussion around that.
So it's fair to say that those options are ambiguous at this point. So you're voting on something tonight that has really no end.
So just to be clear, we are going to need to develop parameters for reopening schools in case of closing schools for any reason. So that is a matter that still needs to be developed with our safety team.
I would ask before you make the decision as a school board to close schools after 2 weeks, to look at the guidelines or look what's going on, is that at the very least, you have perimeters in place that says this is what has to occur for us to open and continue. That, you know, that just seems logical.
Okay, thank you for your comments, ma'am. Dennis Walter, I see your hand raised. Whoops. Steve got off. I think now I see your hand raised and I think you're on.
Thanks, Amber. Just a few notes as I'm listening to the discussion tonight. We have a really well-developed safety plan, and I appreciate the work, all the people that contributed to that plan and the time they've made to that. But I did hear from the doctor, we're 5 to 10-fold away from making any type of decision like that with our numbers. We have, my understanding, no Penn State University interns. We're not a college, we're a high school. And parents have made their choices. And I respect the choices of the parents that felt it was best for their children not to attend school. I totally respect that. But by the same token, I'm asking those parents to respect the wishes of parents that do want their children in school. You know, I'm a little bit concerned that I haven't heard anything about the American Pediatrics Association recommendation that all students return to school. You know, I question, you hear about people not following the science, and I think that's really important coming from that organization. State College has worked diligently to address the achievement gap that exists in our school district. Every day we are not in school reverses any gains that have been made over the years in that regard. Not going to school is not going to impact my rising senior. He did well with the online. He'll do well with, he's got parents that are supervising him, require him to do work. I can assure you that's not the same across the board. And my point is, not going to school disproportionately impacts our neediest students. I'm equally concerned about the social isolation and the subsequent mental health issues. Not attending high school and participating in sports and clubs is very similar to putting the entire student body in out-of-school suspension. There's a reason why we reserve that consequence for the most egregious disciplinary violations and limit the application of that punishment. In short, you know, Altoona just in their school board tonight went ahead and allowed fall sports to continue. That's really important that we make that, whether it's sports or band, find a way for students to remain students under these conditions. And finally, I want to finish up with, this is an opportunity for the State College School District to shine, to educate their children in the face of adversity. And I don't want to see us shirk from that responsibility and great challenge. Thank you.
Thank you for your comments, Mr. Gutoff. Are there any other public comments on this action item? Okay. Board members, any final comments before we vote on this? Okay, then we will have a roll call vote.
Mr. Hutchinson?
Yes.
Mr. Leos?
Yes.
Ms. Zidney?
Yes.
Dr. Bader?
Yes.
Ms. Bedell?
Yes.
Ms. Brandt?
Yes.
Ms. Concepcion?
Yes.
Dr. Duffy?
Yes.
Mr. Fazzard?
Yes.
Okay, so that item has passed. Okay, moving on. Item B under action items is a discussion of a motion to approve to approve in-person school being in session for 2 weeks beginning August 25th, followed by moving to full remote learning for X weeks to obtain a greater understanding of the COVID-19 prevalence in our community.
Amber, I just wanted to note that I'd like to make a motion after we finish with item B.
Okay.
So moved. Bedell.
Second, Brandt.
Okay, that item has been moved and seconded. So now, I guess this will be the time for any discussion among board members on this item. Lori.
So I just want to share that essentially I have two key priorities as we try to provide the most excellent educational experience we can for our students. First is that a priority is staying ahead of the curve so that we can keep our school and wider community safe. So that's number one. And secondly is to make sure that we can care for our kids and families for whom there is no safety net, or kids who attend CTC and have an absolute need for hands-on experience. And when I talk about kids and families who don't have a safety net, or I'm talking about special needs kids, kids who absolutely need professionals in their lives. I'm talking about families who have, who the parents of whom are either single working parents or parents who do not have a safety net or support network for their kids. I think it's imperative that we make sure that they are taken care of. And the last point that I'll make is just the food for thought about recent data coming in from Notre Dame and coming in from UNC. And, you know, we can talk about the validity of that in terms of State College if we like, but, you know, the rate of spread in at both of those universities, one a small university and one a large university, is significant. In particular at UNC, we watched cases jump from, you know, in 1 week, 29 cases, and then from Friday to Sunday, they went to 58. So when we talked about exponential growth and we talked about the example of the lily pad in the pond, I think Sunday is probably a really good example of that happening at UNC. And, you know, I think the writing was on the wall. So, you know, as we look at Penn State coming back, I really think that staying as far ahead of the curve as possible should be a priority for all the reasons that I've mentioned. Thank you.
Dan?
Well, you're ready. Good. Yeah, I just, we just spent about an hour and a half talking about the safety plan. And Maciek did a great job of working with us to refine and present and define the criteria that he feels are relevant to the question about making decisions about our capacity to be able to continue to keep schools open and to reduce, if not eliminate, the risks to the people involved. We talked about the significance of our mitigation plan, and all of these initiatives are framed around providing the kinds of experiences that 75% of our parents asked for, which was in-person instruction. And so I don't think, you know, essentially when I first saw this, it was well-intended because it was based on the concerns about the availability of data. And this evening, we've had a presentation that indicates that we can get maybe not 100% of the test results, but we can get a significant proportion of the assessment results available to us within 24 to 48 hours. And that kind of undermines the reason for this motion, because this idea came from the idea that we had to really anticipate the events in the community. And now we're going to have real-time, almost real-time access to what's taking place. I don't think this motion is in any way relevant, given all the work that's gone into involving the community, giving people the choice, providing opportunities for in-person instruction, doing all the things we're doing in terms of mitigation. There is so much work that's gone into this. And I happen to live with someone who is already invested in trying to move forward with the in-person experience that she's planning along with her colleagues. Don't underestimate that. Don't underestimate the importance of that planning and the trust that comes in their relationship with us about these kinds of decisions. So on this, I think, though, it was well intended. This evening, it's pretty clear we have the data to be able to make real-time decisions about what's taking place, and that the safety team will inform us accordingly. That's my take on this particular item.
Okay. Amy?
Yeah. Okay. So here's where I am. So for the large number of people in attendance who may not know me personally, I'm trained in veterinary medicine, and there's something a little different in our experience and background when we go to school. Population medicine, epidemiology, and public health are all a really big part of our curriculum. And being married to a physician, I know that we receive more training in that than our fellow physicians. So I feel really comfortable with a lot of our conversation with Maciek and having a good understanding of the things that he has shared. Secondly, the thing I want to state is that Dan used a word about invested. And I think that's a really good word to talk about really quickly. I think that in a high intense situation like this, it's very easy to become invested in one choice or another and feel the need to cling to it. And I have been working really hard as an individual and a board member to try and not become overly invested in any one particular plan, because I feel like it's my duty as a community member, a board member, and a scientist to follow factual data. So that's my approach to this. So I know there were people in the community very upset about the addition to this item to the agenda, and I'm certainly hearing that people are unhappy about the addition that Gretchen suggested as well. And I have to concur with the ethicist that spoke at the beginning. I think that we cannot become overly invested in one particular plan, no matter how much phenomenal, amazing, wonderful effort was put into it. We need to consider everything as we get to this crunch point. But that said, I was curious in support of the 2-week plan because I had immense trepidation about data being real time and our ability to get quick turnaround on testing. Currently, the information we have today is that that is not the case at this moment, that testing turnaround has picked up and is pretty positive right now in our community. And that gives me a lot more confidence that the data we're looking at is informational. So that's changed my perspective about this particular motion, because I feel like the big linchpin for me was turnaround on testing time, which had historically been pretty poor or reported or anecdotally told to be poor. And now we have evidence that's not the case, that the majority of our biggest providers seem to have quick turnaround. That gives me confidence in decision making. So the other big thing that for me, it was the linchpin, is what the thresholds we set. And so because we chose thresholds at the lower end of the state's ranges, I feel comfortable that that puts us in the ability to catch things at an early time point. And I think that's our responsibility. Another part of being a veterinarian is we take an oath just like a physician. And I can't recall, honestly, because it was over 20 years ago, whether do no harm was formally part of it, but it certainly is something that we in our profession espouse, just as our physician compatriots do. And so do no harm is a big part of my perspective in taking on this vote. And I think there's no way for me to not do harm. There will be harm done no matter what decision we make as a board. There are too many competing priorities for us to make a decision that doesn't put someone at risk. It's horrific, and it's no one in this board meeting or in this district's responsibility or fault. It lies at the feet of higher level governance agencies at the state and federal levels who have not done the proper job in their roles. And so now we are here left with a decision that is likely to cause harm to someone, whether it be students with special needs, students in CTCs, teachers who are at risk. And I feel that my responsibility is to make the best balanced choice that I can. And currently, based on the availability of the data we're going to get, I feel comfortable moving forward with our safety plan and the thresholds that we've set and the phenomenal experts that we've been blessed and fortunate, like Maciek and the others, to have participate and give up their personal time to help us make these decisions. So for that, I'm forever grateful. And that's all I have to say.
Thank you, Amy. Gretchen?
Yeah, thanks. I wanted to just sort of at this point echo a few things that other people have said and add a couple things. I do believe, as Maciek actually pointed out, that the most at risk, the high risk, especially adults in our district, there is no safety plan for them. They have to go to work and they have to go into the buildings and potentially be exposed, even though they don't know what will happen to their life potentially, and then any long-term health effects or disabilities. It's unknown because this is a novel virus and we don't know what will happen in the long term. So we're putting people's lives at risk. This is how I view this vote. And I was thinking, I've been talking to a lot of people about this over the past few days, and someone brought up to me, you know, how many people will die because of school going back into session? Will it be a student? Will it be more than one? Will it be, what's the number? Or staff, teachers, or grandma that someone lives with, or grandpa that someone lives with? Who and how many? And like, in addition to that, how many will suffer from long-term disabilities because of the exposure to COVID that happens in the school district? And what will that look like? And what will that be like? And what will the quality of life for those individuals be like in the long run? Another thing that has been in the back of my mind during this entire process is that because this is a novel virus, we don't know what the long-term effects might be. And I keep thinking about things like chickenpox and shingles later. What could it be? Could it be something worse than shingles? And then we don't know it, but then when these kids are 30, 40, 50 years old, what happens? We don't know, because this is a novel virus. And so it really has to do with one's personal level of risk acceptance. And when it comes to life, my personal risk acceptance is maybe not where other people's is, because I really value people's lives and also quality of life in terms of long-term disability from the virus. We know that some people, many people, I've heard up to 40% have permanent lung damage after COVID infection. That's something that I'm thinking about. Actually, the main reason that I brought up the motion that I did and that I will vote the way that I will on this item is that teachers' voices have been absent from this process. And I'm not exactly sure why that's been the case, but we have not heard, this is my opinion as one person, I have not heard much about teachers' voices from the union. I've had many teachers contact me personally and are terrified, and they're making out their wills and they don't know what to do because they're scared. And I've noticed throughout the work sessions that, yeah, we had two pediatricians on that committee that came and talked to the board, and they both said very upfront and honestly that their perspective and priority was that of the student. We had no representation by any doctors who were prioritizing the adults in the district or the teachers. And I think that had we had that representation for their input, that would have brought the conversation and perhaps the outcome eventually of the process to a completely different place than it ended up being. And so that has just really weighed on me, that I have not heard the needs of the teachers I've not heard that input. other than personally when they call me and say, don't say my name, but this is what's going on. Or when we heard about the 89% vote where they did not feel comfortable going back into the classroom. And as far as the 2-week component of this agenda item, the reason that I think this makes sense is because I understand exponential growth. And I actually participated in a study where I had to watch videos on exponential growth and answer about 2 hours worth of questions on exponential growth for about 6 weeks. And so I became extremely well-versed in how this works. And exactly in the time when you don't see a lot of infection is when you have to act. And that's because of how exponential growth works. And I know Lori mentioned the lily pad, the lily pond example. I urge anyone who thinks that it's a good idea to put everybody indoors for 7 hours a day without knowing what the exact numbers are for the quality of the air ventilation, which Ed Poprick told us tonight, we don't know those numbers. To watch that lily pond video, you can just Google it on YouTube and you'll find it, because it very visually and simply makes you understand how exponential growth works. And exactly when you're not seeing the infections is when you need to act. When you see low numbers of infections, that's when you need to act. And by the time the numbers get high, it's too late. It's too late. And so we won't know. And so that's exactly my thinking in supporting this particular agenda item, is that you have to get ahead of the curve with exponential growth. There's no other way. Otherwise, it's too late. So that's why the 2 weeks makes a lot of sense to me. And I will stop now. Thank you.
Laura?
Thanks. I've made some notes, so this may not come together as smoothly as I would have liked, but I'll try to hit all the points. First, going back to hours ago, one gentleman spoke who berated us for this idea that we were talking about closing schools for 2 weeks to educate people about COVID. That was never the idea. The idea was more to catch up with and make sure that we are in a safe community. So I want to make sure that people understand that. We're not trying to, we trust our community. We know they understand COVID. The question was, would we have reliable data on how things were spreading, given that we do have a reliable way of of expecting that there will be more spread. So that was one thing. Other people have said this was absolutely inappropriate to even suggest, and that's not true. It is our job to be looking at things and to be thinking ahead. I do wish we had better communication with the community. I think we need to do a better job about that, about letting people get update, have us proactively send them summaries of board meetings instead of them having to go look for it or find it on social media. That is a real concern. But given that, we still need to act. And when we saw concern, I appreciate the people, several now, who have brought this up as a possibility. So it's appropriate for us to consider. For me, the reason that I initially liked this idea, well, let me back up a minute. I'm not thrilled with the options that we have. We still don't have a 5-day-a-week option for secondary students, and we have some secondary students who are 10 years old. I think this is a problem. I'm extremely concerned about the teachers who are worried about going back. I'm also concerned about the lack of teacher voice through the summer and the lack of parent voice. We did not have parents on our committees looking at our education models who were not also employees, and I think that's a problem. This plan, though, doesn't address any of those things. This is just about taking the model we have and interrupting in 2 weeks. The reason I liked that idea initially is that it would have given people a chance, the opportunity to plan ahead, just like they know that we're going to be closed Labor Day. They know we're going to be closed over winter break. And by saying up front, we're going back, we will be closed, people could plan. I also supported and still support going back. It is risky. Everything is risky. There are most of the districts I looked at who are sort of in our cohort are starting all remote. But in this community, we have a fairly low rate right now. And we have an opportunity to get kids in and get them acclimated. I think that's makes sense. And that's why I supported going ahead and opening early, not delaying as many communities have done. By the same token, at this point, I think we have learned that there are fairly accurate turnaround in tests, and we should be able to react very quickly. I do want people to be aware that even if we don't plan to close in 2 weeks, what we heard was that the indicators could give us as little as half a day. So parents need to know that we might be going to full remote for health purposes, for the public health, with very, very little notice, as opposed to giving them 2 weeks notice. So I think I've hit most of my points. If I haven't, I will speak after other people. But.
Thank you, Laurel. David?
So I will try to be brief because I don't know how long I could speak at 11:38 and be coherent. We have a plan, the plan that we've spent an incredible amount of effort and time putting that plan together. It's based on science, it's based on data. And at the end of 2 weeks, if the data is telling us that we need to wrap it up, then that's what we'll do. If that happens at 3 weeks, that's when we'll do it. And so this plan that's been proposed here honestly does not make any sense to me. And I think it's really disrespectful to the vast majority of our parents who want to give a shot at in school.
Scott?
Yeah, bear with me because I have a number of notes as Laurel did, and I'm going to try to not reiterate what's already been said, at least not excessively. I still am just fundamentally uncomfortable with the way this occurred. I stated it with the prior conversation about the motion that was brought up at the beginning of the meeting. I fully get that we are completely within Robert's rules and, by the book, so to speak, but we're certainly not following our past practices as some of these have come up. But on the other hand, I can't be hypocritical and try to say that, one of the things that we need to maintain through this process is flexibility, and we have to be able to be nimble and react to things as they come up. Now, I do not think that this is something that has just come up, but I would be disingenuous if I tried to say everyone else needs to be flexible, and because an idea came up at the last minute, supposedly, that I shouldn't be flexible. So, hence we're here entertaining this, and while I do not support it, I do think it's a good conversation. As has been previously said, whether by community members or otherwise, there's no actual data to support doing this. We're just extrapolating guesses and estimates. I haven't heard any support of this model from the administration. I haven't heard any support from the safety team, who has done an incredible job with our plan. There's been a couple different references to UNC. I can't comment on Notre Dame. I hadn't seen that data previously, but the UNC reference really is comparing apples to oranges. I mean, UNC is 10 miles away from Duke, 11 miles away from Durham, 25 miles away from Raleigh. We're no miles close to anything. So yes, we're a large university, but they are different. We are in a completely different situation than UNC. We don't know what the impact is of the Penn State students coming back. I shouldn't say that. We don't know the magnitude of the impact. We do know there's going to be an impact, but we don't know the magnitude. It's good to hear that testing turnaround is, appears to be quote unquote quick, viable, timely, whatever. And I think we need to be able to rely on that data. With respect to teachers, I fully get the situation. However, we have innumerable essential workers throughout our community, and they're going to work every day and they're taking precautions, and they're in Walmart and they're in Wegmans and they're in Giant and they're in, every place that we are maintaining our lifestyle in. These are the people that are supporting us, and they're health care workers, et cetera. And teachers are equally as essential and potentially more essential because they're the ones that are contributing to the training of the next generation of leaders. And I just think that they are essential workers, and they're essential to the success of this community. And I get the concern, but these are essential workers for us. I guess, I actually went through and counted, and we've received well over 180 and I think approaching 200 emails over the past 2 to 3 days since all of this got out via Facebook and social media, which goes to the whole question of how this occurred. And I think it was interesting because I actually took the time and went through and counted all of the emails that were either in opposition to this 2-week pause idea or that were in favor of it. And it kind of closely mirrored where the breakdown was relative to those who chose an in-school option or remote. Not exactly, but by my numbers, and I could be off, even if I'm off by 5 or 10, it doesn't become material. It's basically 64% and 36%. So we're hearing the same thing is my point. We're hearing the same thing in the emails that we heard from the family surveys relative to what people want, and they want their kids in school. I've had many teachers and community members contact me, and I haven't had a single person say they wanted remote, and I haven't had a single teacher who's talked to me say that they didn't want to be in front of their kids, but they all recognize the risks and the concerns. And my last point is, I think we have to remember that the way this plan was developed, the safety plan, and the way the learning options were presented, every family has the ability to go remote at a moment's notice. So it is a personal decision that you are able to make at any time if you feel that your situation is such that it warrants, a more risk mitigation or a more cautious approach. And I think that's important that everybody understands that going a route of this hybrid model does not take away personal choice for any family to be able to be fully remote. And I just think that that's something that can't be lost on anybody who's either listening or making this decision, et cetera. And I just got to say, I'm just terribly impressed with the community that has still over 500 community members on at 11:45 because this is obviously of extreme importance to them. Thank you.
Okay, thanks, Scott. Lori?
Yeah, thank you. And I will be finished after this. I apologize for following up. So first of all, I think I misspoke. UNC is the one that had 177 cases. Notre Dame had 58 cases. So just for clarity's sake, that's both in about a week's time. And to the point about UNC being different, I would simply say that, yeah, it's close to other big centers with high populations, but essentially those kids are coming from all over the country, much like the students at Penn State are coming from all over the country. So just, maybe just a slight difference there in terms of that particular point. I do want to say that I absolutely agree with Dan and Amy and Scott and David about the quality of this plan. I feel very good about the trigger points that we have put in place. I think that the 5 to 7.5% range where we sit down and we look at all the facts, I think all of that is great. And I feel very good about those things. So I don't want anybody to think that I'm disregarding the quality of that information. Again, for me, it's about getting ahead of things. And what's happening as an undercurrent that might be difficult to see at first, even despite great testing, because so many people are asymptomatic. But I just want to say that the point of closing at that point is so that we can stop and take a look and see what infection rates look like. And you know what? If we were wrong, hallelujah, let's get back into the classroom. But if we were right, the potential that we will have kept that out of our schools and away from our bus drivers and teachers and families, I think that's a pretty powerful argument for getting ahead of it. And you know, somebody might say, why even go in for 2 weeks? Well, I think I think it would be wonderful for kids to go in, to meet their teachers, to develop a personal connection, and then when it's safe to go back, to jump back in and revisit that. And then my very last point is, you know, I think that David made the point that, you know, to bring this up is disrespectful. And I just want to push back on that a second. I don't think it's disrespectful to parents to air as much of the questions and insight and points of view that we have on all of this. We've been thinking about this a really long time. Nobody's taking any of the information or the safety plan for granted. I am always in favor of talking as transparently and as out in the open as possible about things so that people know where we're coming from and know that we have weighed all of these options. You know, and so, yes, this 2-week plan came later than the rest of the plan, but it was still talked about in meetings in previous weeks. And I think the reason it showed up on social media is because people looked at our agenda. So it's not like it was a secret that was hidden. We did everything we could to be as out in the open as possible. And when we get new ideas, we want to present them to the public and hear one another's points of view in an open setting. So that's all. Thank you for listening.
Thank you, Lori. Jim?
Thank you, Amber. I'll be quick. I do think we have a great plan, and I am also fairly certain that sometime during the semester we will be shut down or have to go all remotely. So my point is that I think we let the plan decide when that is rather than taking the 2-week. And I do want to reiterate something that Amy said is about the faster turnaround. This is a new data point. The faster turnaround with the tests makes me more confident that the people that are making the decision, our medical professionals and our epidemiologists are better informed to make that decision. So while I'm confident that we will go all remote, I'm not in favor of scheduling to go all remote. And I'd like to thank all of the people that came up with a plan. And I do think that we need to have this discussion. I think like our ethicist, Dr. Miller mentioned that about the different possibilities. So I appreciate Gretchen's motion about going all remote, and I appreciate this. But right now I'm looking at following the plan and basing it on decisions, based on data. So thank you very much.
Okay, thank you, Jim. Laurel?
Thanks. The other part of the plan and the other thing that I think is very good is not just the plan for when and how we'll decide if we need to go remote, but also the mitigating plan actions in the school. And that is very thorough. I think that's as a result of hearing from and listening to many experts, and I do appreciate their input. So that is also part of this plan. And we have been very firm, all of us, on the need to do that for the people in the school. That still will leave risk. Risk is there. The other thing that I wanted to address is that several people have brought up the idea that people voted, 70% voted to go in person. That is true. I also think that many of those people did so thinking, well, we'll get started and we can always switch to remote. So we never did a poll where we said, what do you think would be ideal? And frankly, even if we had done that poll, as the summer went on and things changed both in our community and around the nation, those answers may have changed. So I do give a lot of credence to the 70% in realizing that many people feel that there is a way to go back safely and that they want that for their children. But I don't think that means that we should necessarily assume that the 30% who picked remote would never set foot in a building, or that all the people who picked in person were entirely thrilled with that option. And we have changed what that option looks like a couple of times. We've changed it in response to what we've heard from the community. So those were my additional points.
Scott?
Yeah, so I guess just a quick question as a point of order. So the action item was a board consideration and a discussion, but we had a motion that was seconded.
Undefined. Yeah, it's undefined in terms of number of weeks.
Yeah, so I just want to make, so what was, I'm assuming the motion was to follow through on this action, not to approve a discussion that we just had. And if that was the case, then as you just said, Amber, at this point, it's a motion that's undefined because there's a blank for the number of weeks that we would hit pause if this was approved.
Lori, were you the one who made the original motion, or was it Gretchen?
I was the one who so moved. Yes.
Okay.
Yes.
Dr. Etter, is the appropriate route at this point to ask the person who made the original motion if they would like to fill in that blank?
That's what I would say, yes.
Okay. Lori, do you have a particular number of weeks in mind, or did you want to discuss it or ask any questions before?
Well, I guess, and earlier I was thinking, poor Maciek should probably go home, or he is home, go to bed. But if I could just ask you, Maciek, thank you so much for being up with us so late. Let's just say we take a pause at 2 weeks. Would you think that an additional 2 weeks would give us a sense for the rapidity of the spread at that? Would that give us enough of a gauge, given that that would have us at 4 weeks in?
So, I mean, part of the question is how many weeks of a pause will give us some information so that we can then make a better decision? Is that the question?
Mm-hmm.
I don't think we can say that. Okay. I think it's unpredictable enough that we could have a lot of bad news after 1 week. We could have good news after 4 weeks.
Mm-hmm.
I don't think any of the choices are better than any of the other choices. I don't think we have enough information to say.
Yeah.
Yep. I mean, do you guys mind if I go to bed?
That would be fine. Thank you so much, Maciek.
Sure. Amber, am I allowed to contribute something to this discussion?
Absolutely. Yes, please.
I mean, so with all the board and the parents and everybody that's been calling in, I mean, it's an open or not discussion at this point. So, I mean, I think the right path is going to be if we choose to open, then we, begin to put in place additional safety measures for all the individuals that need them. And then if we choose to not open, we begin to put in measures to improve the mental health outcomes and risks that children face because we haven't opened. So the open or not open is a large scale population measure that would get us some course outcome that we like. And I think after you guys make that decision, the next step is to make sure that a lot of the individual odds and ends are tied up for the 2 to 4 categories of people that are going to be at very high risk of some type of detrimental health or educational outcomes.
Thank you, Maciek. That's a helpful way of framing it, I think.
Guys, thank you so much for all the work that you're doing on this.
Thanks for all your work.
Thank you.
Yeah, thank you. We really appreciate you. Thank you.
Talk to you guys soon.
Yep.
Yeah.
Thanks, Maciek.
Well, I would say that given what we just heard, and also reflecting back on Dr. O'Donnell's point that to get learning centers up and running would probably take 2 to 3 weeks to do that. I think I would lean toward just a 2 week close as we reevaluate the current situation. Unless somebody has another thought about going longer, but I would hesitate to go too long if things are looking good.
Mm-hmm.
Anybody else want to feed me an idea?
Scott, you had your hand up, but I wasn't sure if it was for this.
No, sorry, I either clicked it incorrectly or never lowered it in the first place. Thanks.
Oh, okay. Dan?
So conceivably, we'd be losing 2 good weeks. In other words, if we're going to shut down, regardless of the data, we could conceivably be losing two weeks in this way of thinking, which might have otherwise been very positive for our kids, anticipating, as we've been suggesting, that within another 2 or 3 or 4 more weeks, we'll be shut down for a longer period of time. So we're willing to sacrifice 2 weeks out of caution for when we have no data to indicate that there'd be a problem, and sacrifice those days, which we might have really benefited from as building a foundation for the rest of the school year. Just saying.
I hear you, Dan.
Okay.
Thank you.
Is there any other, anyone else want to make an input on who's in favor of, I guess it would help if somebody was in favor of this motion, if they wanted to have input on the number of weeks. Gretchen, since you seconded it, do you think?
Yeah, I agree with Lori that, I mean, the entire time we've had this conversation about this idea, it's been 2 weeks. And so when Lori, when you said 2 weeks, that made logical sense to me, especially since Maciek said there is no specific number that would be better or more accurate. So the 2 weeks seems to make the most logical sense.
Okay.
Okay. Yeah, so then the motion is that we would be in session for 2 weeks beginning August 25th, and followed by a fully remote learning for 2 weeks to obtain a greater understanding of the COVID-19 prevalence in our community.
Okay. Does anybody else have any comments? I didn't speak yet, but I'll
Just to restate the motion before we vote.
Okay. So I think originally I had brought this idea to the table a couple meetings ago. One of the big concerns that was at the front of my mind in bringing this idea was the concern about test turnaround and being sure that we had real time or data that was meaningful in terms of being able to make a decision about when to close schools. It's really encouraging to hear that our data turnaround is relatively swift now. And so I certainly don't feel any regret for having, pushed this conversation along. I would take issue with anyone who would want to say that it was disrespectful to put this idea in front of our community and as an idea in front of our parents, because in fact, we've been struggling with how to deal with this pandemic in this country for 6 months now. And I'm not sure that I see really good evidence that decision makers so far have a great track record. So my motivation in bringing the idea to the table at all was to make sure that we could get some information about testing turnaround, that when we make a decision to open schools, that we're fully informed as to what the constraints are on the data that we need to use to make decisions to open and close. And I've heard a lot of people say you need to follow the data, who are saying that we should go ahead and be in school and stay in school and not pursue this either a 2-week closure or to start remote from the beginning. To follow the data, you have to be sure that you actually have meaningful data and that it's fresh and new enough so that you're going to be able to see spikes beginning before they're likely to go from, I think, the most concerning situation from the Penn State community and student community into the SCASD community. So it's very encouraging to hear that we do have quick turnaround on tests. And that does change my perspective on how useful this would be. The other component that has changed my perspective a bit is hearing from Maciek about how there's an extent to which there's an element of randomness. This 2 weeks that we might take off might not be the 2 weeks that are the most concerning. By going for 2 weeks in, we might end up closing during that first 2 weeks anyways. If we can continue to have quick testing turnaround, it seems like that's going to be the best way to guide our decision in terms of being in school or out of school. And we start to see testing turnaround lag, then we need to consider whether or not we have the information we need to be able to keep schools open. I'd like to kind of address the comment that has been made by a number of people in the community, as well as at the board table, about teachers being essential workers. And yes, teachers are absolutely essential workers in our community, and the function that they fulfill is absolutely vital. But I think that when we've used the term essential workers in the context of this pandemic, it has been in terms of keeping life-sustaining enterprises open, such as healthcare facilities and grocery stores. And those are not, and that by keeping those facilities open, you are not contributing any more than absolutely necessary to the spread of this virus. It remains to be seen whether having schools open will contribute to the spread of this virus. So I'm just not even sure that the frame of talking about teachers as being essential workers is even a useful framework, because it doesn't get at the question of whether or not it's safe to have schools open. We had hospitals open because we had to have hospitals open, and we had to have grocery stores open. I'd also like to note that when we asked parents to select an option for their children, we were not asking them to vote on whether the district would be in-person instruction or remote instruction or a virtual academy form of instruction. We were an option for their child from among the limited number of options available. We were not asking them to vote on what the entire school district was going to do. So many parents, simply tried to make the best decision that they could make for their kids at the time they were asked to make the decision. And for many people, it was a wrenching decision, and they may have changed their mind 10 times before they actually clicked the button on it. And considering the safety of the model, I am incredibly impressed and amazed at the work that our safety team has done. And I would actually really particularly like to recognize Jean Knaus and her work. Jean has been I think, gone above and beyond what anybody could imagine that we would expect from an employee over the summer. Obviously administrators work over the summer, but her effort and the attention to detail that she has brought to this, and her effort to keep on top of changing science on a day-to-day basis, has been just awe-inspiring. So I'd really particularly like to note her efforts and those of everyone who has been working on the educational models. I think it's also worth noting this model, this safety model for reopening schools has not been tested. So we can say that we think we have a really great safety model, and it's guided by the science that we have so far in terms of how we think this disease is transmitted, and that we're mitigating as much of the danger as we possibly can and still be gathering indoors. But the model itself has not been tested in an area with the degree of COVID spread that we currently have for any sustained amount of time. And it hasn't been tested in areas with higher levels of COVID spread. So the lack of testing of this model, I think, that's a point of concern. And that's why I think we need to be really careful as we watch the numbers of cases in our community to not be reluctant to go ahead and close schools, because I don't think we want to rely on a safety model that has, simply, we don't have enough months of data from anywhere in the world on schools being open in this pandemic to be able to be sure that this model is going to do what it needs to do if we have significant community spread. Okay, that's all I have to to say at this time on this item. Does anybody else have any more comments before we go to public comment? Okay. Tamara, I see your hand up. If you would like to make a comment and unmute yourself and introduce yourself and where you reside within the district. Tamara, were you able to, the mute button's in the bottom left-hand corner. Maybe you didn't realize you had your hand up. Okay, I'm gonna move on to Karina Howell. Karina, if you would like to unmute yourself and if you could just introduce yourself and where you reside within the district. And we have 3 minutes for each comment.
Hi, thank you. My name is Karina Howell, and I have a 4th grader at Grays Woods and a 7th grader at Park Forest Middle School. And we reside in Grays Woods, right across from the elementary school at Grays Woods. I just wanted to say that we chose in person for our kids, but for my 4th grader, it was our second choice. We actually planned to have our 4th grader do remote learning when the plan was for those remote classrooms to be populated with a teacher from the beginning, and that they wouldn't have in-person video. When the plan changed, that all the teachers in SCASD would have webcams in their classroom and broadcast, we switched my daughter to in-person, and we're not thrilled about that. But we're hoping that the school district would make a good plan for closing when cases started to spike. However, because of testing and things, I'm not sure about that plan. And when I heard about this 2-week closing after 2 weeks, I was happy about that plan and on board with it, what this motion is. We were much more comfortable with middle school and high school going every other day. It's concerning to me that more than 300 students will enter the school at Grays Woods and go to school every day. I'm not sure. I know I've read through the safety plan and I think it is really well thought out, but having more than 300 people together in a building each day seems very concerning to me. Now you might say I can just have my child go remote, but I'm also a biology professor at Lothian University, and we've been training for months on how and have thousands of dollars worth of technology that honestly our university can't and our system can't afford with the budget cuts that we've had over the years from the state. We've had training for months and have this amazing technology in our classrooms to be able to allow us to do what's called high flex, being in the classroom and remote at the same time. I'm very worried for the teachers and how they're going to, and many of the 3 through 5 and 6 through 12 who don't have any paras or help in the classroom in order to manage students at home and in person at the same time. I appreciate the school district trying their best to make everything work, but it seems like an impossible situation to me for the teachers. Now, according, with the data and the high turnover, being a biologist, I really understand exponential growth. And basically, when you start seeing cases rise, you don't start seeing the cases rise in the data. It happens basically overnight and you can't control it. That's what we've seen in the communities with large outbreaks around the country. Even you can't see that the cases are increasing until it's already there. Once cases start increasing, you lose the ability to have widespread testing because the tests aren't available, and you lose the ability to have those test results be done quickly. So sure, test results may be able to happen quickly right now in Pennsylvania and our communities, but that's because there's a very low rate of infection. So I wish I could give more substantiation into the data that we will get, but basically you can't predict information from data that you don't know or that's inaccurate. The final thing I'd like to say is that we haven't heard a lot from the teachers because, as I understand it, the teachers' voices have been silenced. They are not able to talk about what they feel, except that there was a vote, and I don't remember the exact numbers, but 80% or so of teachers aren't willing to go back in the classroom. Or are not. They are willing to go back in the classroom because they're being forced, but they prefer not to. So I'm would be on board for the 2 weeks going to school and then online. After that, it's a real problem for our family to be able to do that with both parents working. But I think that we are not a typical community, that 40,000 people are coming into our community from all over the state and the country and internationally. And I would be very comfortable sending my kids to school with the community that we have right here today in State College. But the community that we have next week in State College is vastly different than the one we have today. Thank you. And thanks to everyone on the board and everyone for everything you've done. I think you've done a fantastic job, and I'm so proud and happy to be in the school district.
Thank you, Karina. And that concern about the community that we have today versus next week is kind of what's been driving these discussions for the last couple weeks. I see a call from GK. If you would like to unmute yourself. And if you could introduce yourself and where you reside in the district.
Hello, my name is Natalie Kawahara, and I'm a 7th grader at Park Forest Middle School, and my brother is a junior at State High. My parents are both Penn State staff members. Earlier this summer, my parents asked us if we wanted to do virtual school or in school. We both decided to attend school in person. We wanted to be in school because we both miss seeing friends, and we wanted to meet our teachers in person. If we closed school, we would miss that social interaction. I appreciate my parents' support in this decision, and I look forward to seeing our teachers and everyone next week. As an orchestra student, I would also like to know what the school district's plan is for orchestra. Yesterday, when I looked at my schedule, I noticed it was not listed. Does this mean that the district does not plan to do orchestra at this time? I look forward to continue my development in orchestra and hope the school district will continue their support in this year's journey. Thank you for the board's work along with our teachers' efforts in making our school year successful and safe. Thank you.
Okay, thank you for your comments. And actually the question about orchestra is probably part of the one of the items next on our agenda, which I'm not sure we'll get a chance to get to. But I hope you get some sleep soon. Okay, Mike Dawson, I see your hand raised, and if you could just reintroduce yourself and where you reside in the district, and comments of up to 3 minutes.
Hi, this is Mike Dawson. My wife and I live in College Township. Our children attend Spring Creek Elementary and Mount Nittany Middle School. I wanted to thank the board and the administration for all their hard work to put together the health and safety plan. I'm sure it was a monumental task and surely a thankless task, as you can see with all the different opinions in this community. But I just want to say that some of the board members, it sounds like you don't get it, what it's like to be a parent in the district. We aren't all sitting through these board meetings. We don't know what goes on. So for you to say that we've talked about this for weeks, well, I have seen nothing about it. I'm a voracious news consumer. I have Facebook account, all these things. I have seen nothing about this. I've heard nothing about this. So of course you do, because you're in this, you live it. We do not. And it doesn't seem that some of you get that. So this news took many of us by surprise, and we can certainly support it. Give us the chance to get behind your move. After all, we did vote to give you financial support to build a new high school. We were the first school district in the state to approve that funding. So I think we could do it. We just need time. Please do not talk down to us, and please do not dismiss our concerns that we do not care about people.
Thank you for your comments. Shay McGowan, I see your hand raised. And if you'd like to just introduce yourself.
Hi, Amber, and the board. I'm Shay McGowan, the SCAA president, representing over 638 professionals in our district. You have heard from a number of teachers tonight, and it is clear that we have members on both sides of this issue. What is abundantly clear to me is that professionals would have loved to have the choice to go either in person or remote. If that would have been possible, that would have been nice. Given a choice to professionals would not have been possible with what our community wanted for their children. Much of the uncertainty and anxiety for our members lies in whether the very robust health and safety plan can be carried out with fidelity. Thank you. Thanks everybody for everything you're doing.
Shay, thank you. And thank you sincerely for everything you're doing as well. Karen Williamson.
Hello. I accidentally hit the hand wave.
Oh, okay. No
so
worries.
I apologize, but I will tell you I work in a neighboring school district, and my daughter teaches in your school district. And it is, thank you, because I know how much work it has gone to try to meet everyone's needs best. But as one of the board members said, someone is going to be disappointed. And using science is a good thing. One of the schools that I have also listened to and been helped advise took data from the 4th of July weekend and imposed that as if it was going to be repeated for Labor Day. And as a way to, you know, what will next week look like kind of thing, if you're looking for data. But that is one consideration. The other consideration is why not return with every other day or a hybrid program, so that there will be more space in the building and more time with teacher-student time. Either a half day for one group and the afternoon for the other, and vice versa, or every other day. One group of schools said, go to school for a week and then off for a week. Parents thought that was better. But, you know, the alternatives, have you considered all of them? And if you delayed 2 weeks, I know you'd be missing 2 weeks of school, and you wouldn't then be able to leave until mid-June. But that seems like a good bet for a good outcome. And if you lose, 2 weeks isn't earth-shattering, especially once you do return and get into the groove of things. So my vote is to go virtual, as most of the schools in Pennsylvania have. Thank you again for all your dedication to kids. The gift of time to children is goes unnoticed, but I notice it. Thank you.
Thank you for your comments. Adam Seitz, I see your hand raised. You didn't comment on this item yet, right? But you've commented on others, correct?
Sorry, I'm going to lower my hand. It's too late.
Okay. Dia Segroy. If you could unmute yourself and introduce yourself.
Hi, my name's Dee Scroy. I have a son in Park Forest Elementary. He is part of the IEP program, which we just recently finished and finalized his IEP plan, maybe about 2 months before the end, or what became the end of school. I think that everybody's voice and opinion here is super important. I do wish that we had had a deeper line of sight to what the teachers needed and what their thoughts and perspectives were earlier on. I think that maybe having that voice earlier could have helped us define and shape our thought processes and decisions a little bit more. With that being said, I've been following the plan, and I believe in the plan that was set forth. I have a theory of science and not fear. And the science that I've seen and heard supports what the school has put in place. I know it's scary with students coming back, but I also have been watching and listening closely into Penn State and what their mitigation efforts have been. The one thing that scares me the most, just speaking personally, is the transition period for my child. The world is scary enough for him as it is for everybody's children right now. And all that these children want is some normalcy. I have my son begging to go back to school just to get that normalcy back, and to go back and then have it pulled out from them. And then who knows, maybe reinstated 2 weeks because it's safe, but then maybe pulled back out after because it's not safe. That troubles me. I know it's a fluid situation and we have to adjust with the times, but I feel like we've chosen our models. We should be allowed to continue in our models until we have reason to pull out. I don't think a practice pull out 2 weeks in just because is the right way to go. So with that, I do urge the members of the board to please not allow the option of going remote in 2 weeks come into play, and continue with your health and safety plan as is. Thank you.
Thank you so much for your comments. Sophia Peters, if you could unmute yourself and just introduce yourself and where you reside. Whoops. Rhonda, I think Sophia dropped off. Rhonda Honekel?
Hey, this is Rhonda Honekel. I am a paraprofessional at Ferguson Township Elementary School, as well as a parent of a rising 6th grader and a rising 9th grader. I want to start with that we chose in person because I have to work every day. We are concerned about them being there, but I have complete faith in our administration team and you guys as a board. I do want to make it known that the district has not silenced any of us. I have always felt like our voices are heard with our administration team. If we have questions, they're there to answer them. They may not always have the answer, but they have done their best to help us as best we can. I think that all of us staff members and teachers are concerned and anxious for a variety of different reasons. But I think that if we can put our faith in the administration and our faith in the community, and the community puts their faith right back into that administration, we can all do this together. I think if parents can make sure that they're checking and following the guidelines with checking for symptoms and not sending their kids to school sick and being completely transparent with that, quarantining if you travel, being transparent with that. I really think that if we all work together, we can make the safety plan work. Like I said, I just put full faith that you guys are doing what is best for us and giving us all the safety equipment that we need to do this. So I personally think that we could lose vital time and would prefer just to continue on and continue to watch the number as the safety plan calls for. I appreciate you guys for everything that you're doing.
Thank you, Ms. Honekel. I appreciate your comments. Sophia Peters, if you would like to speak. Okay. I think she didn't realize she had her hand up. Oh, wait, there she is. Okay.
Hi. I'm a 7th grader at Mount Whitney Middle School. And I just want to come on and kind of just say that, I wanted to go back to school, but I'm also just scared that if we all go back to school, I'm scared that my teachers and my friends are going to get sick, and they're going to either die or they're going to get really sick. And it's just, and I have spoken to some of my friends about it, and they just feel the same way, that we don't want our friends and our teachers to die just because, and it's hard to, that decision is hard to make, but I think that it's just not safe to go back to school. So thank you.
Okay, Sophia, thank you for your comments. I hope you get some sleep soon too. Okay, with that, I think we've run through all the public comments. Board members, anything else before we vote on this item? And Gretchen, you said you wanted to make a motion after this item?
Yes, I do. Yes.
Okay. All right, so at this time we'll have a roll call vote. And I'm sorry, I'm going to reread the motion before we do the roll call. This was a motion to approve in-person school being in session for 2 weeks beginning August 25th, followed by moving to fully remote learning for 2 weeks to obtain a greater understanding of the COVID-19 prevalence in our community. And that's been moved and seconded already. So we're ready for a roll call vote.
Mr. Leos?
No.
Okay. Ms. Zidney?
There we go. Sorry. No.
Dr. Bader?
No.
Ms. Bedell?
Yes.
Ms. Brandt?
Yes.
Ms. Concepcion?
No.
Dr. Duffy?
No.
Mr. Fazzard?
No.
Mr. Hutchinson?
No.
Okay.
Okay. So that item.
Conversation. Yeah.
Pardon me. Oh, yeah. Thank you, Lori. Thank you for kicking off the discussion. I think it was important to have. Laurel? Yes.
Yeah, while we still have over 400 people with us, I thought maybe we could mention the Straight Talk that's going to be this Thursday night.
Okay.
It's up on the.
Concerned about the time though, and continuing.
No, I just was going to ask parents to go take a look at the district Facebook page that mentions it, because it is this Thursday and may be helpful to many of them.
I would agree. Okay.
It is on ways to help your child during the pandemic, just in case parents wonder.
Okay. Gretchen, you said you were going to make a motion.
Yes, and this motion is coming from all the discussion pretty much that's been going on tonight, and particularly what Jim said, that it seems inevitable that at some point we'll go remote. And because that will likely happen at some point, and Maciek has said over and over that cases will go up after the Penn State students come back with the 40,000 additional people in our community. And so I would like to make a motion to direct the administration to bring a proposal to the board at an upcoming committee or full board meeting for the organization of care centers and their criteria for qualifications to be enrolled in care centers. And I chose the term care centers because I was told by teachers that that was the term that had been used in their meetings. And this is the idea that was in my first motion, that when we go remote, that for the kids who absolutely need to be supervised for the reasons I mentioned in that first motion, IEPs, social emotional needs, et cetera, students who would be home alone otherwise, that we have sort of a safety mechanism for those students. And that's the reasoning behind the motion.
Okay. So the motion is to ask the administration to bring us a proposal at some upcoming committee meeting or board meeting. So there's not a time constraint. The reason I ask is I know that they're, pretty consumed right now with getting the school year up and running. So I'm wondering if there's a reasonable time frame for how long we would.
Yeah, I would think, as I shared earlier, we need 2 to 3 weeks, and we can't. I know I was criticized for not including teachers, but we included a lot of teachers through the summer. I meet multiple hours a week with scale leadership every week, with Will and Vern with me at a minimum, and as does Linda. So we need that time. And unless you want us to create something without anybody having conversations with us, we can do that. But I would propose they be called support centers. so that we don't, just for what it's worth, because of the issue with seal that we've had with care. You know what I mean? So because it would be, we'd want it to be for learning and supports of the students would be my 2 cents. But I don't think. Right.
I'm happy to change that, Bob.
Okay. I think right now we're scrambling. If we're going to have students and staff in schools, it's every second of every day focused on that, and that would be my request. I honestly don't think we have the capacity to pull that off while we're trying to implement this safety plan and remote and virtual academy in the in-school, because some of us are going to be covering classes.
Mm-hmm. Yeah.
That's exactly why I did not put any kind of a timeline on it. But again, recognizing that at some point, and as Maciek emphasized, we have no idea when it will be, because there's just no way to tell. And so because there's no way to tell when we will need it, to when possible start to organize to come up with a proposal. And that's deliberately why I did not put any kind of time frame in the motion, is because of what Dr. O'Donnell just said, because I was aware of this.
Okay. And although we've started with some of the planning, we really need to ask people some questions, because we need help from the staff and faculty, but we don't want to ask them questions about that right now, because they're really trying to focus on what our next steps are opening up. So that would be, I'm comfortable with the board giving us a charge on it, because it's something we have been working on. It's just we're not at a point where we think we can engage with our faculty and staff and principals as well, which would be critical to having these sites set up.
Okay. Is there a second?
I'll second, Laurel.
Okay. So that's.
Do you have a question of Dr. O'Donnell? I just didn't hear. I didn't hear whether you said you would be comfortable or uncomfortable.
Oh, I'm comfortable with the whole idea. I absolutely think, and you've heard me say in our discussions, I think, if we're closed down, I think, we were not supporting some of our students with special needs in a remote manner. We couldn't. Some of the services needed to be in person, as well as you've heard me say, and I think several of the board agrees, if our buildings are closed, I think we owe it to medical workers and first responders to have some opportunity, as well as, I've seen the notes from young families who both parents have to work and they don't have an opportunity to work remotely. And can we help them out? I think the support center concept would be a big help to our community. And it would also allow us to have, we'd be able to more easily manage the safety plan if our buildings are closed with less students, but we do need employees to help us with it. And that would take some time to plan that out.
Okay, thanks. I just didn't hear the word itself. So thank you very much for elaborating.
You bet.
I certainly support the development of these, and I think it's generally helpful to have clear board support before working on a project like this. So I guess I would vote to support this motion. I don't have any expectations that anyone would stop work with the work they need to do while they have kids in buildings to do this, but on the time frame that is reasonable and feasible. Any other comments or questions? Okay, so is there any public comment on this item?
Yeah, I do have a comment, Amber.
Okay.
I apologize for jumping in late. I don't know if anybody, this is one of the things where I'm a little closer to the world in which people are working right now to reinvent education, reinventing everything, and an incredibly complicated environment that they're being asked to develop and manage and implement. It is just mind-boggling. It's staggering to think about all that is expected of everybody in this moment. My own personal opinion is this is getting into the weeds, and I'd be inclined to just defer to the administration, allow them to come back to us at a time that they find appropriate to inform us about how things are going. I don't think a directive at this point really respects their world, particularly the mid-level administrators. I think building principals are right in the middle, trying to make sense of something which has never been done before. I just thought I'd offer that idea in the midst of this. I think it's excessive, and I think it communicates a lack of trust and respect in our administration and in our staff to do the right thing. Given this, in this present environment, any other time would be all right, but this is just an overwhelming experience for our professionals.
Dan, I'd like to disagree, because I think we certainly respect them, and we should respect their time, and the motion is specifically phrased to not ask for it in the near future. But by simply broaching the topic in a public meeting like this, and having the expectation that there will at some point in the future be a plan for this, that's probably reassuring to parents who are going to be looking at potentially rising infection numbers and not know if the school district will be planning for support centers or will not be planning for support centers. So I think there's value in simply signaling that we will be planning for support centers in the future.
I appreciate the nature of reassurance that would be provided to the community in a motion like this.
Okay. Gretchen?
I just wanted to say very quickly that I have nothing but respect for the teachers. So I disagree with Dan that making this motion is disrespectful to teachers. I think it's the opposite. I think that everything I've said tonight at this meeting shows how much I respect teachers. So I really take issue with what Dan said about me. I deliberately, as Amber said, did not put a time frame in here so that the administration could do what they think is necessary when they think it's necessary. And this is really a reassurance, as Amber said, to the community for families who have situations that would fall into needing a support center, to have it be there when and be able for them to be able to plan on it being there. So again, it's out of respect to those families, it's out of respect to the teachers, and it's also out of respect to administration, as Amber said, so that they have a clear directive, because if they don't, that's really confusing for them. And so this was discussed. I had conversations with people that led me to believe that this was really the most direct and respectful way to do this. So I don't really appreciate being called disrespectful. Thank you.
Any other comments from board members on this item? Linda Wade, I see you with your hand raised for public comment. If you could just unmute yourself.
Sorry, I was pushing the button. It just wasn't letting itself be
No
pushed.
problem. Thank you.
So thank you very much for sharing this meeting with us and hearing us. And I really appreciate what you have all done. I keep hearing the word scrambling. The teachers are scrambling, the administration are scrambling. And so I was just wondering if there's a place I can't think what it's called, a platform we could go to volunteer as community members to help with this. If 70 whatever % of us want the school to start and we want to have a good start, how can we help you do that? Is there a way? Copying papers, moving books, sweeping the floor, I don't know, getting coffee. So if you could help us know who to contact or how to sign up to be helpful with that. That's all. Thank you.
Thank you, Linda. And I really appreciate that. I think we'll take that. We've had like discussions in the past about volunteer efforts, and I think we can continue that conversation going forward, and really appreciate the sentiment and the offer. And it probably would be very helpful. RLE Brown. There we go. Oh, if you could just unmute yourself, Arlie, and introduce yourself.
So Overly is my wife. I'm David Brown. Overly speaks English as a second language. And
sure, name that came up on the account.
Yep. Radio Park. And I wanted to say first, thank you for the detailed health and safety plan. And it's great to hear that there's talk about the support centers. As a matter of fact, that was one thing that we were very interested in hearing more about. So we understand getting things up and going and open is, it takes a lot of energy to do it right. A lot of districts don't have the plan that you could see here. So it's wonderful to see that is being executed. For students that have special education, unique student populations with their needs, those complex learning needs, gains are often hard earned, even under normal circumstances. And disruptions like going from in-person to remote, it really disproportionately impacts this population. So knowing that there's the thought about a support center, should this occur, should help with that transition. And it also not only helps with successful outcomes, but I do think it respects the teachers, the specialists, parents and caregivers that are effectively acting as a team to help these children meet those successful outcomes. So I do agree with Gretchen's comment that this is to have a plan, to say that there's a nod that this should be planned for when the time is right. It helps a large number of people, and it does give reassurances. Understanding that putting a timetable on it, especially this late in the evening, as well as just trying to get school back in session, that is a daunting task. But there is a sense of urgency to begin planning as soon as possible, considering that remote could happen within days or weeks, even after the initial opening. So thank you for considering it. Please keep it on the radar, and we will be looking for ways to volunteer to help make it happen from the parent side. Thank you very much.
Thank you. Okay. I don't see any further public comments. David, I see your hand raised.
I just wanted to mention briefly that kind of a process thing. I don't think there's anyone on the board that would disagree with the idea that Gretchen's put forward. I think it's a swell idea. Typically, if we don't have something that's really concrete, we kind of go by a sense of the board that this is the direction we would like the administration to go. And and Bob will look around the room and everybody nods their heads and say, yeah, that's a good idea. I don't know really that a formal vote on this is helpful. That's just not typically how we do these.
Any other comments from the board?
I would agree with David. I think, actually, as I was thinking about this a little while ago, an up or down vote on something like this is really unusual. I mean, relative to earlier times, is this something we would just ask the majority of the board to support and we would just nod our heads and go from there? So I agree with David.
So you don't want to have to vote on the item? Or
yeah, I think I did, Dave. Well, I'm not. We're in the middle of it now procedurally, so I don't know if we can back out of it. But I agree with David's point. It's just traditionally, from my experience, I've only been at this for 5 years. David has a lot more of a track record with this stuff than I do. But I think he's correct that we would typically have, in past times, might just simply say, "What's the sense of the board about this? Is this something we'd like to have the administration work on and release it to them to take charge?"
Okay. I think we're
in the middle of a motion. I don't want to have to walk that back.
Pardon?
We're in the middle of a motion. I don't want to have to walk that back necessarily.
Okay. All right. Let's go ahead and have a roll call vote on this item then.
Ms. Zidney.
Yes.
Dr. Bader.
Yes.
Ms. Bedell.
Yes.
Ms. Brandt.
Yes.
Ms. Concepcion.
Yes.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos.
Yes.
Okay, that item has passed. We are moving on to item C on the agenda.
Madam President,
Yes,
it is approaching 1 o'clock at night. Motions to adjourn meetings for future time can be made when there's no motion on the table. I don't know a time, and that's why I'm hesitating to make a motion. If I had to make a motion and ask for a second, I guess I would move to adjourn this till tomorrow evening at 7 p.m. I realize everyone is busy.
we have to advertise meetings though.
Well, I believe and this would be a Dr. Etter question, I believe if you adjourn to continue the meeting until tomorrow that is not considered another meeting.
Dr. Etter, do you have feedback on that for us? He might have dropped off.
Fall asleep.
I just looked it up quickly online because it's been a long time since I've done Roberts, but it is considered a continuation of the current meeting.
Oh, Madam President, may I just remind board members that we still have a motion on the table to possibly start school remote, and I'm eager for for Scott's reply, but
I'm sorry, I did fall asleep.
Let me
what
just
was the question?
Out of respect for our community and their needs to planning, I think that we need to address a couple items on this agenda in order. Believe me, I want to go to bed, but people need the answers to some of the things that we have to approve tonight.
I don't think there's nothing on the table, is there?
It's not on the table, but it's been proposed. It's been added to the agenda.
It's on the agenda and people are concerned about the outcome of the vote on that item.
Scott, the question was, if we adjourned the meeting tonight and didn't finish the agenda, could we do so in continuation tomorrow evening and not be on, because we wouldn't be able to advertise for tomorrow evening through our normal channels.
I would view it as a continuation of tonight's meeting rather than a new meeting.
Okay.
So you're not, you're adjourning until tomorrow at whatever time you're restarting, rather than ending the meeting.
Okay. I would really like to at least finish that item and potentially the PA required emergency instructional time.
Which, okay.
I would be more interested in limiting the conversation, not eliminating it, but making it more appropriate and pertinent and moving through, because as Amy said, there are things that people need to know.
Amy?
Yes.
Oh, sorry, your hand's up.
Oh, was it still up? I just didn't put it down. Sorry.
Oh, I'm sorry. Okay. Laurel, did you want to make a motion then?
Sure. I make a motion that we adjourn to this meeting until tomorrow at 7 p.m.
I'll second Brant.
Okay.
I would certainly entertain a friendly amendment to change the time if someone has a different idea. I realize that there are important things to consider and that people have stuck with us. At the same time,
still 4 people on. Mm-hmm.
I'd like to simply call the question on this motion. It's been moved and seconded. Let's vote on it, please, if we can, and then we can move forward or stop, because that would be the most respectful and prudent, I think, of people.
I would agree with that. Anyone else? Okay. We will have a roll call vote then.
Dr. Bader?
No.
Ms. Bedell?
No.
Ms. Brandt?
Yes.
Ms. Concepcion?
No.
Dr. Duffy?
No.
Mr. Fazard?
No.
Mr. Hutchinson?
No.
Mr. Leos?
Yes.
Ms. Zidney?
yes.
That was not carried then, correct?
Correct. 6-3.
Okay. Okay, so the next item on the agenda, which is action item C. I'm going to read aloud the motion. What from Gretchen was a motion to add an action. Okay, no, I'm sorry. The motion was to begin the 2020-2021 school year remotely with the addition of care centers for students with IEP, social emotional needs, CTC students, and students who would otherwise be home alone. Is the motion. Is there a motion and a second for that?
Oh, I thought I already made the motion, but
We made the motion to add the motion, but now we're at the motion.
I'll make the motion to make the motion this time.
Logo motion.
Is there a second?
I will second it.
Okay, that has been moved and seconded. Is there any discussion around this motion? Laurel?
I seconded it only because I think that if we're continuing the meeting, this deserves discussion. I personally will vote against it because I think we should open while the opening is good.
Scott?
Yeah, I'm hopeful that all of the prior conversation around both the safety plan and the 2-week pause conversation is sufficient to, not require additional in-depth conversation on this item.
Gretchen?
I probably am not going to be extremely articulate because I normally would have gone to bed 3 hours ago. So I'll just say that I had to make this motion, again, out of respect to the teachers and the families in the community who hold this perspective that we should go remote, start remote. And then also for my personal conscience, just so that when the cases go up and we see people suffering through this virus, and some of them will have long-term health consequences, that I will know that I did everything I could to prevent that from happening, and I won't have it on my conscience. So thanks.
Okay. Gretchen, Lori, I saw your hand, but then you took it down.
Yeah, the points were all made. Everybody made points I was going to make, so I'm good.
Okay. Any other board member discussion on this?
Amber, could you reread the motion?
I would do so happily. It is a motion to begin the 2020-2021 school year remotely with the addition of care centers for students with IEPs, social emotional needs, CTC students, and students who otherwise would be home alone. Okay. I see we have one public comment. Michelle, go ahead. You can go ahead. If you could just unmute yourself, introduce yourself, and then limit comments to 3 minutes.
All right. Yeah, this is Michelle Rodino, and I'm in State College, and yeah, it's like the endurance meeting here. So, but I appreciate it. I just want to say that I very much support this motion and this plan to open remotely. I think it balances everyone's needs. The problem is right now there's a lot of ifs that we're depending on, that the safety plan, which is awesome, which I just don't think we're ready to put in place just yet. But there's so many ifs that hang. If students can stay 6 feet away from each other, from bus drivers, from teachers, if the room is safe with proper ventilation, if meal times are safe, if Penn State students follow all the rules all the time, if lags at testing centers don't come back like they were here a few weeks ago. And so that's a lot. And the problem is the cost of being on the wrong side of that if is it's life and death and permanent disability, and we don't even know all. I know that parents and some board members are frustrated. Why are we talking about this plan so late in the game? But I remember trying to bring this up sooner, and we were just told it's just too soon to talk about going all remote. So it looks like now is the time to talk about this. The other unfortunate thing is we do need to always be prepared, even with the plan, aside from this motion, the opening plan, we need to be prepared on a dime to go remote. So if that message isn't out with parents, that at very least need to know the current plan we have in place is to turn on a dime without warning. Now, I mentioned before that number one is a dangerous number. You know, one loss of a teacher is too many, one loss of a student, of a staff member, of a community member due to increased spread is too many. And America's number one, you know, that number one captures our place in the world in COVID cases and unfortunately in deaths by COVID. So we need to do something different. We can't maintain this number one position anymore. We have to do something different than what we've been doing. And what we've been doing is reacting in hindsight to the numbers after there's already a spike. And by that point, it's too late. So, you know, we cannot go on like this anymore. Schools in other countries had a 1 in 100,000 positive case before they opened, where they opened successfully. In this country, we're doing it, you know, with 50 positive plus or minus per 100,000. So we really need to, and it's on us as a local organization to turn it back, because we're not getting this message from the top of the government. We need to do it at the school district level. It's literally on us to stop the spread of this pandemic. And so since we would most likely need to flip to remote on a dime, again with frustrated parents, I get that.
Michelle, we have reached 3 minutes.
Okay, we have to, okay, I would say at least if we do it now, we can do it without the spread. Thank you.
Thank you, Michelle, and thank you for all of your attention to this. Okay, any other public comment? Okay, so now we will have a roll call vote.
Ms. Bedell,
No.
Ms. Brandt,
Yes.
Ms. Concepcion,
No.
Dr. Duffy,
No.
Mr. Fazzard,
Yeah.
Mr. Hutchinson,
No.
Mr. Leos,
Yes.
Ms. Sidney,
No.
Dr. Bader.
No.
Okay, so that item did not pass. Okay, so we are going to move on to what is now item D, is a motion to approve the PA required emergency instructional time as shown in that attachment.
Lazard, so moved.
Duffy, second.
Okay, that's been moved and seconded. Laurel?
Yes, I'm going to just say these things very quickly. I did send them to the board earlier. I think there are some things on this that need clarification. I have looked at a number of these around the state that have significantly more detail. One question is simply why having 3 Act 80 days would be equivalent to 3 learning days. Another is what it means to say that teachers in grades K through 5 will include some asynchronous learning activities for students. In general, I do not think that we are able, on the basis of what we have read here, to do the things that we are asked to check off if we approve this, which I was just pulling back up again. And they include things like that we acknowledge that we have clearly defined systems for tracking attendance and instructional time, that we will provide all students the planned instruction needed to attain the relevant academic standards set forth. I actually think we probably have planned for that, but I do not think we have documented it. And that is why I don't feel comfortable voting for this at this time.
Any other questions? Gretchen?
I have a question about the video cameras that are meant to be in the classroom so that the teachers can do remote teaching simultaneously while teaching to the in-person students. And I'm wondering if those cameras have all arrived and been installed, and if not yet, what date will that happen by? Thanks.
Our IT department has made provisions for the rooms that will not have cameras installed because they are still back ordered. The document cameras can be used by the teachers, and that's part of the instruction that's happening during in-service this week. I cannot answer. Justin, do you have a date, an estimated date of delivery on the cameras?
So we're very hopeful that the cameras, they're supposed to be delivered this week, but we are still dealing with the back order. So all of secondary except for, I believe, 10 rooms have been outfitted. So primarily elementary is the order that we're still waiting on at this point.
And can you describe what document camera, what is that? What does that look like for the student at home if the cameras are not here and they use a document camera?
Sure. So the document camera is, we're using Epson DC11s or 21s, depending on the classroom. But it's just a USB connection to the teacher's computer, very similar to the webcam. The image quality is a little bit less, but it still does pick up the room, whiteboard, things like that. It's just not necessarily as mobile as the webcam is to allow the teacher to easily move it around the classroom and interact. So it does take a little bit more effort on that part, but for a remote student, they get pretty much the same experience.
Okay, thank you.
I was part of that demo, and when we did set it up in the classroom, and the quality was not even really noticeable, the difference. So that's going to be something that'll hold us over until those cameras arrive.
Thanks.
Okay, thank you. Any other questions from the board on the instructional time document? Is there any public comment on this item? Christopher Kissel, I see your hand raised for public comment. If you'd like to unmute yourself and then introduce yourself, and then we have 3 minutes for a comment on the item.
Okay. Can you hear me?
I can hear you.
This is actually Marie Kissel.
Hi, Marie.
Hi, how are you? I'm sure you're all very tired. I just wanted to, as we sat here, I wanted to speak this evening first to all of you and to all of the work that's been done by administration, by teachers, by community members, everybody kind of coming together. And Gretchen, I would like to say thank you, and that is not to detract from other positions, but this tonight, and I know you're exhausted, but perhaps it'll make you feel better to know that, at least for me, if it means anything, I don't like to speak for other people, that it was brought up this evening from the perspective of teachers and cafeteria workers and paraprofessionals and bus drivers. Yes, we are all there for the children. And I'm telling you, I was lost without my children during remote, and that's why I'm still doing remote things with them on Friday evenings. That said, I too, we're in very conflicted positions, and we're all positioned in multiple places and with parents to care for and sick children. And yet the children we love at school. So if I had one thing to say, it would, I know we have a handful of teachers who come together and will serve on a committee, but perhaps that communication piece between faculty, administration, union, whatever, that has that more holistic piece, so that there isn't this gap of silence that parents can hear and we can work together as a community. So while I know you're very exhausted, I'm personally grateful to all of you this evening, and to those of you who really spoke up this evening. I know my husband has been probably more vocal because I've been conflicted about that. I love the kids and I love being with them, but I have a son with diabetes and I care for an 84-year-old father, and I'm immunosuppressed. So I get it. And listening to parents, and, you know, we're all very conflicted in this, and I'm very grateful to all of you, and everyone has put themselves out there on behalf of our children and our community. And I know it's been difficult for everyone. So I really do thank you and the parents. And I just wanted you to know that if being up this evening has meant anything, I'm still out here listening, and I'm very grateful.
Thank you, Marie. And thank you as always for everything you're doing for our kids.
Well, thank you. And, we'll just get it going here. So have a good evening and thank you.
Thank you. Good night.
Good night.
Karen Williamson, I see your hand raised. If you would like to unmute yourself and then just introduce yourself and where you reside.
Karen Williamson. I have a question about the legalities of students being able to tape classroom activities while they are home and learning through their remote cameras. If they could be taped, could it be down the road from to a student, or student to a teacher, or a parent to? But what if the information that they're participating in the class, are there any boundaries set for the child using them at home?
If this is in concern with, if you have a child in one of our schools, I would suggest talking with the principal at your child's school about this. Okay. Okay. Any other board member discussion? Any more public comment? Laurel?
Yes, unfortunately, while I don't know the particular situation of that person who spoke, the legality issue, and I do know that other board members have raised this, is a concern. And I'd like to ask, that the administration address this and let us know if there is a way to, at the very least, ask parents to sign off on a commitment not to tape. I think that is extremely important. And one of the big concerns with the plan, as we have put it together, along with concerns that have been mentioned throughout the night, like the professor who talked about how incredibly hard it is to do the hybrid synchronous teaching and how much time they have spent doing it, preparing for it, and still it's going to be hard.
Laurel, is your question is about probably pertaining to, I had asked last week about a user agreement, and Scott Eder had responded that that was something he was looking into.
Yeah,
thanks.
That is something that the administration is looking at, an acceptable use agreement with respect to that technology.
Good to know.
Okay. All right. At this time, we'll have a roll call vote on this item then.
Ms. Brandt?
Yes.
Ms. Concepcion?
Sorry, I was muted. Yes.
Dr. Duffy?
Yes.
Mr. Fazard?
Yes.
Mr. Hutchinson?
Yes.
Mr. Leos?
Yes.
Ms. Sidney?
No.
Dr. Bader?
Yes.
Ms. Bedell?
Yes.
Okay. So that item has passed. Item at this point, E is a motion to award the bid for crosswalk improvements at Park Forest Middle School as shown in attachment 6E.
Fazard, so moved.
Okay, that's been moved and seconded. Any questions or discussion? Okay, we'll have a roll call vote then.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell,
Yes.
Ms. Brandt.
Yes.
Okay, that item has passed. Item F is a motion to approve the elementary project change order shown in attachment 6F.
Bedell, so
So moved.
Okay, so that was moved by Lori and seconded by Dan, I think.
Yeah. That's about right.
Okay. Is there any questions on this item? Laurel?
Just checking what the status of the playgrounds are and if they are ready to be installed, assuming we approve this. So that's two questions.
Coral Street, the Coral Street Playground is the same status. I believe from the last meeting, the safety inspection has been completed. We are waiting for the final code occupancy permit, and the sliding board unit is still waiting on parts. The Radio Park Playground contractor has experienced additional delays. He's having a staffing issue related to several of his employees. And we're looking at potentially into the first week of school with construction. We have come up, while the playground equipment will not be used. So we have a plan to utilize every piece of the playground except for the equipment that's being under construction.
Any other questions? Okay, any public comment on the playground item? Okay, then we will have a roll call vote.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell,
yes.
Ms. Brandt,
Yes.
Ms. Concepcion.
Yes. Okay, that item has passed. And item G is a motion to approve students' request to attend Central Pennsylvania Institute of Technology for the 2020-2021 school year as shown in attachment 6G.
Priya, so moved.
Duffy, second.
Okay, that's been moved and seconded. Scott?
Yeah, just, sorry, just a quick question. There's 3 students on this. Transportation's just for 1. Is that because the other 2 will be driving themselves, or is that something that we might be missing?
No, I believe that the students will be transported together, so it's just a charge for one trip.
Got it. Thanks.
Okay, any other questions? Is there any public comment on this item? Okay, then we'll have a roll call vote.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy.
Yes.
Okay, so that item has passed. I would entertain a motion to continue the meeting tomorrow, if that's possible.
So moved, Brandt.
Second, Sidney.
Okay, that's been moved and seconded. And I guess I would like to ask before voting on this that we actually get the meeting scheduled. Scott?
So what happens? So I cannot attend. What happens if you cannot get the same attendance? Can it be a continued meeting? I don't have a problem doing it, but I can't be there. So
Tomorrow night.
correct.
I don't know if it would be different. Sometimes some members had to prematurely leave a meeting. So, I mean, Scott Etter can weigh in, but I would imagine it's not terribly different than that.
Yeah,
good point, Amy.
I don't have an issue with it, and quite frankly, I think we got through all of our action items, and it's just going to be information and discussion tomorrow. So obviously I'd prefer that we have a quorum, but you're not taking action. So it's not as if there's a grave concern on my part. It will be open to the public through the Zoom format and otherwise. So if all 9 can make it, that's great. If fewer than 9, that's fine too.
I think we probably need to know if staff members who have waited all night long and into the morning for this item, which I just feel terrible about, Molly and Paul, if it works for them. It's good, Paul?
We have marching band tomorrow night, but I'll make it work.
Yeah, we just need to know what we're doing to start teaching school.
I know. Yeah, Molly, I'm so sorry that you guys were here this late and this just.
We will be able to do a Zoom format, but we will not have the access or may not have access to the large group connection that we have tonight.
That may be okay for an information discussion item, because it would still be on, would it be on CNAT?
We would have to check with them in the later this morning.
And then for advertising to obviously it won't be in the CDT, but Lynn, Chris, and Nabil put it on the website and all the other platforms, traditional and otherwise, that we have the ability to do.
Yes. Okay. All right.
Amber, did we say 7 o'clock?
We did not say 7 o'clock. I was
Okay.
assuming. Is 7 o'clock reasonable for everybody? No objections to 7 o'clock tomorrow night?
Paul, what did you say about tomorrow evening in your schedule?
We'll be going from 6 to 8.
Okay.
But depending on how the outcome of tonight was going to be, I was thinking about making it 6 to 7 to try to possibly get some of the instrument masks distributed out to the kids. I hear their order is in right now. But we'll see.
Better if we do 8 o'clock then?
For me, 7 is fine. I think we can make it work. Yeah.
Okay.
Thank you.
Thank you. Okay, so then is there if there's no further board discussion of the motion to adjourn, is there any public comment? Okay,
Just
then.
clarifying, it's to adjourn the meeting until tomorrow at 7 o'clock.
Right.
Yes. Do we need a roll call vote on that, since
I don't think so.
we can just, okay. I see somebody would like to make a public comment on the motion. Linda, wait, if you'd like to unmute yourself.
Sorry, I just want to know if we have to get another link for tomorrow or not. That's all.
Yeah.
That,
Okay.
Nick?
Yes, I will create the meeting and put it on the remote board meeting website, and there will be a registration link that you will need to sign up.
Okay, thank you.
Okay, thanks. Okay, so then we'll take we can do a voice vote on this one then, right?
Yep.
All in favor of adjourning until 7 o'clock tomorrow night? Aye.
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 Anyone opposed?
Aye.
Okay. Whoops, no one was opposed, right?
No, I would be opposed. I'd just as soon let the staff finish and get out of here.
You're opposed to adjourning?
Yes.
Oh, okay. All right. But if on a voice vote,
Unanimous, is it?
that's what I'm asking. Does a voice vote doesn't have to be unanimous, right?
No.
Okay. Okay. Sounds good. All right. Then we are adjourned until tomorrow evening at 7.